Good morning, everyone, and welcome to our second day of the F50 Global Summit on Elevating Health Innovation. Today is the second day of this great summit that takes place online, and that event is broadcasted worldwide, and all the records available on YouTube. Dear guests, we welcome you here, and today we'll see a broad range of very important topics from our honorable guests will be discussed. Please subscribe on YouTube channel, on LinkedIn, and other social media. Don't hesitate. And I would like to welcome on stage F50 founder and CEO David Tsao to do a warm welcome to our guests.
Good morning. Again, it's my great honor to be here on behalf of the 4 co-hosting organizations, including Bay Area Council Economic Institute and UCSF Entrepreneur Center, Global Mentor Board, and Silicon Valley Entrepreneurs, as well as 22 global committee members to welcome all of you to this special online event, the 5th years of F50 Global Capital Summit. Thank you. I'm super excited to welcome all of you for another reason. This is the first time we are live on Zoom, as well as live on YouTube as well. The videos will be broadcast on 4 different channels online, including Newsbite, Floating, NetEase, and the Global Mentor Board. We expect to cover hundreds of thousands of people, and we hope to send our message to millions of people worldwide for elevating health tech innovation. I gave my speech yesterday. My theme is called The Infinity Game, Elevating Health Tech Innovation. I really hope all of you can join us and with entrepreneurship and technology innovation, so we can help the healthcare systems in many different ways, so our society can be better prepared in reacting the current pandemic and as well as the future pandemic. So just in case, if you have questions, so you can interact with us through our LinkedIn and also Zoom. We don't require tickets on Zoom. On YouTube, it's completely free. We already released about 30 videos on our YouTube channel. The channel name is F50 Global Insights. You search for F50 Global Insights, you'll find our channel. It's also on our F50 Summit page as well. So for this second day of event, but also the first day for the live event, we have put together a great list of speakers, particular roundtable interactions. I just want to go over a little bit about the roundtable interactions. We have nearly 100 speakers worldwide. So this roundtable discussion is open to all our VIP speakers, and also all the people who has VIP tickets to participate in interaction sessions using Zoom. All of you can submit the question to our speakers by clicking the question answer button on bottom of your Zoom. Or you can wait at the end so you have a chance to ask questions verbally if the moderator of the session permits you to do. And there's many other ways for you to interact with us. We also will share our video links on our LinkedIn channel. We strongly encourage you to share our message around to your social media work, especially on LinkedIn. LinkedIn is the primary channel we are using to communicate with our network. Again, I hope you can find many inspirational talks, knowledge talks, and also insightful presentations. Hope you enjoy the next 2 days of live interactive session and join us together to elevating health tech innovation. Thank you.
David, thank you so much for the inspiring talk. And we are starting our second day of the event. And the first session will be Global Economics Roundtable, moderated by Sean Randolph, Senior Director of Bay Area Council Economic Institute, and with the speakers, and joined by Jack Knowles, Managing Director and at VP Venture Investments and Health, and Bob Moore, MBA. Pardon. It's the Global Economic Roundtable discussion will be led by Sean Randolph, Dr. Bechara Couchair, Senior Vice President and Chief Health Officer at Kaiser Permanente, and Brenda Santoro, Head of Global Trade at SVB, as well as Vish Mishra, Member of General Partner and Venture Director at Clearstone Venture Partners. Gentlemen, it's great to see you here, and let's start the session.
There we are, we're live.
Yeah.
Well, good morning, everybody. Thanks very much for joining us today, the second day of the conference. And we're glad to be kicking off the morning by framing a lot of the discussions that are going to follow on the rest of the day and into the evening, even India. So just to kind of set the conversation a little bit around the global economic issue. Obviously, the global economy, our economy is not great right now. The IMF in April projected that the world economy would dip 3% this year, but huge drops in 7.5% of the Eurozone, 6.5% in the UK, 5.2% in Japan, 4.9% in China, just across the board. World Trade Organization expects global trade to drop 13% to 32%. That's a huge range, by the way, depending on your assumptions this year. And then the most recent forecast, which is actually by the World Bank, is a bit more pessimistic. They think the global economy will drop 5.2% this year. So that affects trade. Obviously, it affects investment. It's impacting startups, venture investment. We've seen upwards of 30,000 layoffs, probably more now by startup and early stage companies. And even though there's a lot of venture investment available, a lot of companies are keeping their powder dry. They're being very selective about where to send it in this environment. So a very tough time, but not necessarily a tough time for innovation, because innovation tends to happen most in challenging times, and this is certainly one. So there's going to be a lot of opportunity now for people in the technology and the startup and the venture community to pivot, to confront the new challenges, and really maybe create great companies and solutions out of that. So to get the conversation going, as you heard, we have three absolutely fantastic panelists to talk about this. We're going to start with Bechara Couchair, who's the Senior Vice President and the Chief Health Officer for Kaiser Permanente, just to frame the conversation around like what is actually going on with COVID and what should we expect over the next 4-6 months to a year. We'll go to Vish Mishra, who are going to talk about it a bit more from the venture perspective. And then we'll go to Brenda Santoro from Silicon Valley Bank, who will talk with us about what she's seeing in the portfolio companies there in the startup world. So we'll start with you, Bechara. And I think when all this began, when we started the shutdown in California in March, a lot of people thought, well, we'll shut down for 3 or 4 weeks, then we're going to come back. And people will be rehired from the furlough. We'll have a big V-shaped recovery, and not much will have changed. So that didn't happen. So I guess the upfront question is, why is the process of getting back to normal such an extended process? And if you're a business person, you're an investor, you're looking at like what to expect from your economic environment going forward. What do you think is driving the COVID crisis right now, and how long do you think it's going to take us economically to get back to something close to what a lot of us might recognize as normal?
Well, thank you, Sean, for inviting me, and Vish and Brenda. It's great to be with you on the panel this morning. I think, Sean, to answer your question, it's probably good to put this pandemic in a context of what is it that we know about pandemics. I'm a public health person. I'm a physician by training, but I spent most of my career in public health. I led the Chicago Department of Public Health in the midst of the H1N1 pandemic, the Ebola outbreak. And the reality is most of what we know about pandemics, we learned from previous pandemics. And we've had a series of pandemics over the history of this world that have been fairly well documented. And when you think of a pandemic, you think about 4 concrete phases, and understanding those different phases is critical to think about how we respond from an economic perspective, from an innovation perspective. So let me just kind of very quickly walk through these different four phases. So when a novel infection comes out, when a novel virus shows up and we have this outbreak, the first phase you'd want to do is you want to try to contain that outbreak, and you'd want to try to contain it by identifying people who are positive, try to isolate them, and try to quarantine people who've been exposed to the virus. And you'd hope that you'd be able to stop the outbreak right then. Now, the reality is when you get to a point where all these containment efforts are not effective anymore, you're going to start having a lot more community spread. And we've seen that in China, we've seen it in the United States, we've seen it across the world, where there is a lot more community spread, that those community containment efforts will fail. Then because you'd have a lot more infections, you just simply can't contact trace everybody, isolate everybody who's positive, and quarantine those who've been exposed. So it's really critical as we think about in the mitigation phase, that's that second phase, when your systems are overwhelmed with new infections, that's when you have to try to do everything you can to slow that community spread. And you want to slow that so that you can prepare your healthcare system to be able to get a lot more increases in number of people who are going to need to be hospitalized, need to be in ICU. And that's what we've seen over the last few months. We've put these measures in place that started by closing schools, stopping all these major events, big events in the communities. Then in many places, we went into complete lockdown or shelter-in-place orders. And really all what you're trying to do is you're trying to slow the community spread so you can give your healthcare system enough time to stand up for the increased number of cases that they're going to see. And you'd hope you gain more time to develop a vaccine or have an effective treatment. And we've seen these measures work in the United States and across the world. We've seen specifically in the early phases of these measures, a significant decrease in the number of new cases. Now that the economies are starting to be opened up again, we're starting to see an uptick, in many of the communities. In theory, when these mitigation measures work, and the number of new cases start going down again and become manageable again, then you move into the third phase of any type of pandemic, which is around suppressing the pandemic. And really the basic of suppressing a pandemic goes back to a lot of testing, identifying people who are testing positive, isolating those, doing contact tracing for those folks who've been exposed to people who've been testing positive, and then quarantine those individuals. And you'd hope and you'd want that if your testing is up to speed, your contact tracing efforts is up to speed, that you'll be able to contain and suppress the pandemic at that stage. And then eventually you'd want to move to the fourth phase, which is really focused on prevention. And that's when you'd hope that you have an effective, safe vaccine that you can put into people's bodies and hopefully be able to prevent that any future impact of that pandemic. The reality is right now we were in the mitigation phase. We're starting to see decreases in number of cases. We're getting ready to move into the suppression phase, where you start doing excessive tests, broad testing, contact tracing, The reality, though, with the economy opening up and people are starting to be out again, we're starting to see uptick in number of new cases. So we might be going back and forth between the suppression phase and the mitigation phase until we get to a point where we have a really good handle on the pandemic, and then hopefully we'll be able to move to suppression phase and then the prevention phase. And then I'll conclude by saying this, Sean, the only way that we're going to be able to get out of the pandemic effectively is by making sure that we have a vaccine that's effective, that's safe, and that we can get it into the bodies of billions of people across the country and the world. So tons of opportunities for innovation. But I think to understand how we respond in a pandemic, it's really important to understand how do pandemic behave. So I hope that was a good way to frame the economic discussion that's going to happen for the rest of the roundtable.
Yeah, that was great, Bechara. Thank you. Maybe a quick follow-up question to that. Sort of, given that our audience includes a lot of global investors, there are obviously technological challenges or opportunities here. We're seeing tech companies really coming on around contact tracing, using lots of big data, lots of work ongoing on vaccines, on a range of treatments. So, you know, KP is a big consumer of these kinds of technologies and services. If you had a room full of investors, which you do, and startups, where do you think that the greatest interest, the greatest need will be as a technology consumer for new technologies and new investments that are going to help us address the COVID issue, but maybe even some of these challenges beyond COVID?
Well, let me start by just talking about vaccines, just very briefly. You know, again, there's no way we're going to be able to suppress this pandemic and prevent any further outbreaks and surges until we get a vaccine that's effective, that's safe, and that we can get it to the bodies of billions and billions of people across the world. So as you think about that, we have a lot of energy and effort right now at getting into that type of a vaccine. I think as of my latest reading here, we have about 100 efforts to develop vaccines. I think about 8 of those are already in clinical trials, so that's a good sign there. And you know, a few of them will probably be successful at identifying the right type of vaccine. Again, I'm not gonna be in the business of predicting, but there would be a possibility that by the end of the year or early 2021, we would have identified a vaccine that's effective. Hopefully, we would have done enough testing of the vaccine, enough clinical trials. Tens of thousands of people participate in those trials to get us to the safety component. If you think about it, we're shooting constantly at this goalpost, so I'm hoping that we'll be able to score, you know, in one of these shots. The reality, though, is we need to be really realistic about expectations. When you look at previous vaccine history, it usually takes the fastest vaccine that we were able to develop took 4 to 5 years. So we're being really optimistic by saying we'll have a vaccine that's safe and effective by the end of this year or early 2021. But let's say we get there, and I'm hoping we will get there in early 2021, then you have to figure out how are you going to be able to get it to the bodies of literally billions and billions of people across the world. And think about all the logistics that are associated with that. I mean, we've been struggling with personal protective equipment, with swabs, with all of the stuff for the surges that we're dealing with right now on a smaller level. So think about, you know, all the vials that you're going to need to be able to get that vaccine out, the alcohol swabs, the needles. I mean, there's tons and tons of logistics that are going to be really critical to get us into that vaccine that's safe, that's effective, and that's being administered to billions and billions of people in the world. So vaccines is a huge opportunity to think about that. Let me just pause for a minute about contact tracing, because contact tracing is really our best bet until we have that vaccine. Really, it's our best bet for us to be able to suppress the pandemic. And when you look globally, you see some countries have done a really good job at identifying new strategies, new techniques, leveraging technology to be able to identify people who are testing positive, identify those who've been exposed to these people for 10 or 15 minutes in the last 10 days or so. So it's really important that we think about how we're going to leverage the technology in the space, knowing very well, though, that at the basic core basis of contact tracing is really shoe leather epidemiology. You find people who are testing positive, then you literally call them, talk to them in person, over the phone, over video, and try to identify their contacts, reach out to their contacts, do your assessments there, and eventually quarantine their contacts, and then getting them tested. So lots of opportunities for innovation there. And I have to say, I mean, the public health community have done contact tracing for over 100 years. We know how to do it. It's just we've never done it at this scale that we're talking about. For the United States, we anticipate we're going to need anywhere between 100,000 to 300,000 tracers to be able to do this job. And there are tons of opportunities for innovation there. So I'll stop here just to kind of get the teasers here out there as to why innovation is so critical in this stage.
Thanks, Bechara. That was a great setup. So we'll turn to you now, Vish. So putting on your investor hat, when you look at that landscape, what do you see in terms of challenges, opportunities? We have issues that have come up through COVID-19 around supply chain. So what's your perspective?
So, just as a kind of historical perspective, when it comes to innovation and entrepreneurship, I think we all know, and we got examples galore, most innovations have occurred during stressful times. And the sustainable company that have been built during the hardest of the times. And what happens, and this is a message for all the entrepreneurs, just because the times are good, or people just don't become smart all of a sudden just because times are good, okay? Or just because the times are bad, people just all of a sudden, they just say, oh gosh, they don't become, less smart, okay? So the reality is that the innovators and entrepreneurs, okay, they always are thinking, but because during the hardest of the times, since a lot of people have this fear and maybe they get concerned, so they don't put their best out in the front. So for all the entrepreneurs and all the investors, this is the time that you have to put the best out in front. And they, like as Bechara mentioned, there's no shortage of innovative ideas. And this pandemic, one thing, it's such a short period of time, it brought all the issues, global issues. Take a look at the health system. It doesn't matter whether the health system in the US or Asia or all over the world. Whether it's public health, private health, the weakness just became so obvious. The simple little things, okay? We couldn't get the supplies are available, but you couldn't get it delivered in time, okay? The ventilators are available, but you couldn't get them, going. ICU are available, but somehow you just could not provision, right then and there. So now the good news is that because the shelter in place took place all over the world, India is a country shut down. Let's tell you, okay, what saved us? The technology. All the tech companies, all of a sudden, okay, so the way now we have learned to live, the way we have learned to learn, and the way we have learned to work. And I think this is going to be, I think people are going to be more in tune, more adaptive to that, okay? So working from home, as you know, the businesses are already figuring out how people can work from home and be more productive. So now you don't have to be in the same location to get your work done. And of course, I've always believed that even for entrepreneurs, okay, you can be a 50% company and you can be multi or micro multinational company. And you'll see more of that kind of happening. So entrepreneurs, whether you are in India or whether you're in China, in Asia or Australia or UK, Germany, Japan, you name it, okay, or Latin America, just go about innovating. The other thing is the capital, okay, a lot of capital is available. There's a $120 billion alone available right now in the US from the VCs to invest. but they're looking for the good entrepreneurs. They're looking for people who have longer term view and more sustainable business they can build, okay? Globally, there's more than $200 billion available, even in venture capital. So my message to all of you who are entrepreneurs, do not lose heart. Just go, because whatever you create today, you build today, of course, it won't be consumed for another couple of years anyway. So by that time, this pandemic will all be over, and all the, the normalcy will resume back, and the life will be better. So whether you want to innovate in health, or you want to innovate in education, or you want to innovate in manufacturing, fixing the supply chain, or just even retailing, whatever, online shopping, I think opportunity is all over. Okay, so I'm very optimistic in that regard. Thank you.
Thanks very much, Vish. That's a positive outlook, which we can all use these days. And I think you're absolutely right. Great companies are often built in difficult times, and I think we're already seeing a lot of our younger tech companies and investors behind them pivoting to these new challenges. So absolutely, don't lose heart, startups. So Brenda, if we can come around to you now. So you oversee global trade for Silicon Valley Bank. The bank does a lot of financing, the biggest sort of bank in the world for working with startups. So what are you seeing when you look out globally in the startup community and the portfolio companies that you're working with?
So thank you, Sean. It's great to see you. It's great to see all the panelists. Great to have so many people participating. So I think to answer your question at Silicon Valley Bank, I'd love to walk through our State of the Markets report for the second quarter of 2020. There's a lot of great data in that. You can actually access that information on svb.com. But I want to highlight a few key points of information from this, because I think it will speak to what you said at the start of this, Sean, and certainly what the panelists have referenced in terms of, many of the great companies were started in the most difficult times. And I think what we're going to look at speaks to that, but it's also, of course, been naturally a very difficult time on the investing side. Certainly companies that didn't have runway are starting to really reassess where they're at and make some hard choices. So let's just dive into some of the information that I have here. And let me just move my screen over so I can turn the page. So you can see that this is a great point of data because it looks back at past recessions and looked at those funds that actually survived and the ones that really performed well. And what you're seeing in the data is that a lot of the companies and certainly venture firms experience really makes a difference. And many of the firms that you're seeing in the market right now have never experienced a recession. So I think that's an important data point to consider, because during the global financial crisis, those obviously who had experience versus those that didn't had a better history or rate of returns. In terms of public markets and valuations, we expect the late stage companies to take a larger hit, but I think that time will tell. I think it's still a little bit early, but historically, many of the late stage deals were typically the areas where we saw larger hits in terms of valuations. I'm going to skip forward to just this comment around adversity and what it means for innovation. If you look at the bottom part of the slide here, you'll see that many of the companies on the left were founded during the dot-com crash. The top tech startups founded in the global financial crisis, 35% of them were serial entrepreneurs. So this says that, yes, it's a difficult time, but we fully expect to see some great companies sort of born out of this. And what's going to happen over the next couple of months, I think, is difficult to tell. We've seen a lot of companies really focus on preserving cash and making some hard decisions, which is not surprising. But I tend to land on the optimist side, sort of aligning with what Vish had commented about, that great companies have historically been formed in difficult cycles. So where are we seeing the opportunities? Certainly consumer and health tech that relate to activity that can support during COVID. So not surprisingly, we've seen the biggest boost in food delivery, those supporting remote work and remote learning. And as you would expect, airlines and hotels and have been significantly hurt. So no surprise there. And in terms of, the health care sector in particular, certainly there will be a rise in hospital expenses as a result of COVID. I don't think that's a surprise to anyone. What that means to those companies that are in the sector, I think will play out over the next couple of months. As I mentioned previously, given the environment that we're working in, there are going to be runway, and the access to cash is going to be particularly important. So depending on what segment of the economy you operate in, we think, based on the data that we're looking at, that certainly companies that are unprofitable, it's going to be a tough road ahead. But those companies that have a strong cash cushion and have preserved cash certainly will weather the storm, in addition to those that are in industry segments that tend to benefit. And I'm going to skip forward in the interest of time, and I'd like to talk about dry powder and speak a little bit to the international market. So there's plenty of dry powder out there, as you alluded to, Sean, at the beginning of the conversation, waiting to be deployed. Certainly fintech is an area that we watch pretty closely within SVB. Pre-COVID, there were a number of companies that were acquired. We think the road going forward for fintechs will be more story of mergers and acquisitions, which is no surprise. On the international side, I'd like to skip ahead to an interesting data point in this slide, which is an area of extreme interest for me because I run the trade business at SVB. And many of the shifts that we saw in global, many of the shifts as a result of COVID to global supply chains actually started happening pre-COVID. So in the data that we are seeing, for example, 15% of US imports in February were from China. This was as high as 48% back in 2014. So the shifts had actually already started to occur pre-COVID. I think you're seeing that accelerate, but I think there needs to be time for this to shake out a little bit. Supply chains, no doubt, have been disrupted. I think companies will certainly look for other sources, but let's not forget that we work in a networked economy, and many companies need to keep sources of goods, for example, available from many domiciles. So I believe that, while supply chains have been impacted and many companies are changing their approach and their tactics, they still will need to source from trusted suppliers. You won't see historical markets go away. And I believe that, while there's a lot of conversation in the US about bringing manufacturing back, you can't ignore the fact that companies are multinational, business is multinational, and I expect the global world to continue to forge ahead, though the composition of it may be a little bit different based on the current. So I will stop sharing. Again, that's data from the SVB that's available on svb.com, and it is our State of the Markets report.
That's fantastic, Brenda. Thanks very much. Let me throw a question to all of you. So much now is moving online, just accelerating trends that had already begun. I've talked to friends at UCSF, and for the last 3 months, virtually all of their medical appointments have been done online. And what they're saying is they're not going back. something will be done in person, of course, but as much as possible of their medical checkups and appointments will be virtual, and they say it's working just fine. The other thing that we're noticing is a lot of the Bay Area tech companies and life sciences companies, they're collaborating internationally. They're doing research with and clinical tests in partnership with companies in China. They're doing it with partners in Europe. So it is a global process we're in the middle of here. It's not just us or one company, but it's very collaborative in many cases. So I'm wondering, in our last maybe 3 or 4 minutes, if you all have any perspectives on sort of the global nature of the innovation, the collaborative processes, those opportunities that are being brought to bear, and especially as we look at new things like remote medicine. How big is that going to become over time, and how is like the underlying IT infrastructure going to drive some of these changes and opportunities? And maybe we've got, I think, 3 minutes, so long question, but if you can be precise, that'll be awesome.
Happy to kick us off here, Sean. Let me confirm to you what you're hearing from UCSF. We're also seeing at Kaiser Permanente. We have 12.4 million members across the system, and in April, 80% of our encounters in primary care happen through a remote type of virtual engagement, whether it's phone, video, or any type of a remote engagement. And now as the in-person visits started going up, we're still at about 63% or so of our encounters happening remotely. And we do expect that this trend will continue. Prior to COVID, about 15% of our primary care encounters happened remotely. It got to 80%. Now we're about 62. And I can assure you that trend will continue. People are liking it. Our providers are liking it. I handle most of what I need to handle with Kaiser Permanente through my Kaiser Permanente app. So I want to confirm that.
Fantastic. And actually, so just a quick follow-up on that. Is the technology fine? Or if you were to say, I need better technology to do certain things, what would those new technologies or improved technologies maybe look like?
I think for us, we have a long journey of being in the telehealth journey. So what we've seen is our system right now, we've stretched our system to be able to increase the bandwidth, do more, but there'll be lots of opportunity for additional innovation here. So I don't want to take the full 3 minutes. I'm sure Vish or Brenda would want to weigh in too.
We actually have 3 more left, so go ahead.
Yeah. I will just echo the sentiment that Bechara you mentioned, but here's the thing that I would suggest. Because, of course, the established organizations like Kaiser, all the other people, so whether it's a healthcare or whether it's a banking system, they're up for major innovation, because the system that you guys have, it still does not give a user a wonderful user experience, because you are in a regulated industry. So you have a lot of restrictions, a lot of kind of stuff like that. Okay, so you can only come to my system and my side. Why can't you interact? Why can't, if I'm if I'm with one doctor, and why can't my data can be shipped to another system? It's a big problem that you have. So bank is the same problem. Okay, you come to my portal. Okay, I can Bank of America, Wells Fargo, they don't interact. Okay, so this is the one that's going to be major, and only the entrepreneurs can innovate in that area. And of course, and since you get the big buyers, so you'll be supporting it. But I see huge innovation opportunity in that. Telehealth is a big thing, but the one other comment I'll make about telehealth, as it becomes more popular, and the routine and the chronic stuff, you can do telehealth. You don't need to go to the doctor, all that kind of stuff. But also, I think in the country, underdeveloped countries, where they just shortage of physicians and people don't have as much access. So I think this is going to permeate a lot more over there. Also, innovation is going to come from the West, and it's going to permeate into the other part of the world also. So I'm very optimistic on both those fronts, fintech as well as the health tech innovation. Yeah.
Fantastic. Brenda, what do you think?
So to your question about the global nature of innovation, I'm very optimistic. Internally, what we're seeing in SVB, I think this is a time of disruption and a time of opportunity. So certainly for us internally, we're aggressively pursuing strategies that put us at the forefront for our clients. And what we are seeing internally is innovation will forge ahead and move forward. I'm very optimistic. I think it's going to be a time where companies with cash are able to manage through the cycle, but as we come out of it, very optimistic for what lies ahead.
Fantastic. And let's see, I'm looking at my clock. Oh, we have 2 minutes left and we actually have a question here. Hang on. Oh, one is for somebody in a different group. For Brenda, the CARES Act sets aside $425 million for mental wellness tech, aging tech, and then so the question is Silicon Valley Bank involved in startups that might be addressing some of these new fields or increasingly important fields?
Yes, absolutely. I can't speak to clients specifically, but broadly, mental wellness and aging. That if there's an innovation around any of those, that companies that we bank are involved, and the investors are certainly. So the short answer is yes, and I'll just leave it at that.
Vish, any thoughts on the aging tech, wellness tech?
Oh yes, yeah. I've already seen. I've seen companies already. They're trying to address the tech for elderly, like nursing homes. How do you monitor and also kind of telehealth. Okay, you got all the sensor, all the monitors, monitoring the conditions and stuff like that. And so that innovation is happening already. I've seen a lot of business plans. Same thing on the mental illness is a big problem, as you know, in America. And for that matter, other parts of the world also. So there's a lot of innovation occurring in that area as well. Okay, and again, the telehealth is coming in a big way because counselors are available for mental health, and so yeah, both are good areas. But the entrepreneurs have to understand the subject matter and domain, and maybe create a company.
We did a forum a few weeks ago that involved somebody from the Buck Center for Research on Aging and UCSF, and it was really remarkable. The takeaway was that for the vulnerabilities to COVID-19, it is overwhelmingly linked to aging. So it's really a disease of aging primarily, if you go back to kind of the underlying vulnerabilities. And so much seems to be tied into the aging process. And so there is some phenomenal research going on around everything to do with that as sort of a driver of how do you address all these diseases. You can address them one at a time, or you can address aspects of the aging process. So some of the deep research going on just here in the Bay Area, I think will lead us in a lot of really fascinating new directions. I've been told we got a couple more minutes longer if we wish to, and I don't see any more questions, but would anybody on our esteemed group like to have anything last to say before we wrap this up and turn it back to our host at F50?
Well, I would say one thing, maybe, and this is since Bechara is over there from the healthcare side. The healthcare industry globally is like $8 trillion industry. Okay, US alone is like 3 trillion, and the rest of the world is another 5. And I think this is where the public-private partnership, government, as well as private organizations, the health systems, they really have to think differently, because the weakness has become glaringly obvious in the whole system. System is really it just does not work. Unfortunately, it is broken. Okay, it is expensive, it's costly, so much waste. So, and I think that I see that an overarching, and I think people have become a lot more in tune. Okay, the industry is working hard at it, and the governments are working hard at it. So I see, a positive opportunities coming out as a result of this thing, and the other one is the financial sector. Look at this, the whole PPP. Okay, the rapid fire. Okay, our government, got all the trillions of dollars made available, okay? But even the banks, I mean, you talk about all the innovation, okay, they got, whether it's a Silicon Valley Bank or Wells Fargo or, 8,000 some other banks that we had, okay? They were not able to process this thing in time because of the regulation. So you will see also some changes in the regulatory stuff also, and I hope that our lawmakers and the policymakers and other people, operators, are going to be paying attention and collaborate in this innovation to do the greater good. Okay.
Sean, let me just add to what Vish had just mentioned. I think in addition to the opportunity in the healthcare system, I really look at this pandemic as an opportunity to get us a silver lining on the public health system as well. Mm-hmm. I think we mostly pay attention to the healthcare system because that's where the trillions and trillions of dollars are globally, and particularly in the United States. The reality, though, is unless we step up our public health infrastructure, public health system, we're going to face a lot more public health challenges that are going to disrupt our healthcare system, disrupt our economy. And really our opportunity is to make sure that we're lifting up the resources and the public health infrastructure in this country and in the world. So just want to leave you with that element.
I wholeheartedly agree, Bechara. That's a very good point you made. Yes.
So Sean, if I could just have a closing comment. So SVB did significant work in processing PPP applications, and this will be no surprise to anybody. Digitization is certainly an area of focus for us, and we're ardently working on it. So I think we're addressing some things that Vish raised. I consider us in a bit of a different category than the majors, but certainly our clients expect us to move forward in a pretty significant way, and we're doing that.
Brenda, thank you. We love Silicon Valley Bank.
I see Nikolai is back on the screen, which means we are actually out of time. So I want to thank everybody, Bechara, Vish, Brenda, for this really, really great discussion. I think you've done a great job kind of setting the conversation for the events that are going to follow over the next couple of days. So we really appreciate your sharing your knowledge and insights with us. And Nikolai, I guess back to you.
Oh my God, that was amazing talk. Sean, Brenda, Vish, Dr. Bechara. Super insightful. Special thanks to Brenda for insights from the SVB perspective. It was wonderful. Vish, Sean, Dr. Couchair, you were great. Thank you so much for sharing this. We need to move to another session, and another roundtable will be on the topic of investment trends and has anything changed in life sciences and healthcare. And the discussion will be moderated by Stephanie Marrus. And Stephanie is a director of the Entrepreneurship Center at the University of California. Stephanie Marrus is a director of the Entrepreneurship Center of the University of California, San Francisco. And she has built an extensive program whose mission to build the university entrepreneurial ecosystem and start companies from UCSF technologies. And the discussion will be joined by Jack Knowles, VP Venture Investments at Bayer. And Bayer, as you all know, is a global enterprise with core competencies in the life sciences and healthcare and agriculture, as well as Bob Moore, MBA Managing Director at Alta Partners. And Bob Moore brings over 20 years of life sciences investing experience, and as well as Robert Blajez, PhD partner at Mission Bay Capital. And he's a passionate biotechnologist with a diverse skill set. And I hope that we'll see amazing talk here. And welcome on stage, Stephanie.
Here, welcome everyone to the stage. So while we're waiting for our moderator, Stephanie, getting online. He was here earlier, I just saw her. So maybe we can ask our panelists to do a very quick intro about yourself. We start with Jake.
Sure. Hi, can you guys see and hear me?
Very good, very good.
Great. So hi everyone, I'm Jack Knowles. I'm an MD by training. I work with the venture arm of Bayer called Leaps by Bayer. Leaps, as you point out, covers all three verticals of Bayer. So we invest in crop science, consumer health, as well as pharmaceuticals. I primarily focus on pharmaceutical side of things. I'm still on one crop science board, but hope to be rotating off shortly. Leaps has really started to invest in next generation technologies. So we do a lot in the cell and gene therapy space. Recently, we've closed deals, Century Therapeutics last year, as well as a few on the protein engineering side, ProTech technology with DuPont Therapeutics and Arvinas. So my view is that we're looking to do more deals in the cell and gene therapy space and excited to be part of that team.
Go ahead, maybe Robert.
Yeah, hi, nice to be here today. Robert Blajez, I'm a partner at Mission Bay Capital and Mission Bio Capital, and also director of MBC Biolabs. So Mission Bay Capital invests in life science broadly, and we have a unique venture model where we use a network of incubators, life science incubators that we run nationally as a way to both support entrepreneurs, help them get their company off the ground, and then we get to know companies through our incubator, sort of an extended diligence that we do. Right now, we have over 30 companies nationally that are working on COVID-19 related projects, with 350 companies throughout our biolabs network. My background's in genetics and genomics, and I originally came to investing by founding a company out of the original biolabs here in San Francisco.
And I'm not sure.
Hey, Bob, it's you now.
Great. I'm not sure how this works and not sure if you can hear me or see me.
Very good.
Great. So I'm Bob Moore. I'm with Alta Partners. Alta is sort of a restart of Alta Partners. It's called Alta Next Gen now. Small venture fund. We do life sciences and tech-enabled healthcare delivery. Largely comes out of the results of my spending some time at the Gates Foundation looking for areas that were scalable and can transform borders. So drugs, curative therapeutics, and then tech-enabled healthcare delivery. And I've been doing venture capital for roughly 20-something years. So I'm not sure if we have Stephanie on here yet.
Doesn't look like we do.
Okay, I'll help. This is David. Welcome aboard. I appreciate everybody's participation in the summit. We'll help Stephen to fill in the first question. Is that we are talking about life science investment. So maybe each of you can share your viewpoint about the current trends, particularly in the wake of the pandemic. What type of things changed in the life science? Great.
I think I'm finally on. I've been frozen out. Apologies, everyone. It's technology. Thank you, David. So, hello, panel. I'm glad you had a chance to introduce yourselves. Everyone can hear me, I take it? Yes?
Yes.
Okay, great. So David sort of queued it up for us. We heard a really great panel by Sean and his panelists about innovation and the importance of it, and how even during the pandemic and in prior pandemic type situations, innovation has flourished. And now we have real investors on this roundtable. 3 different types of investors, I might note. Jack is a corporate venture capitalist, a little bit different emphasis. Bob is what I might call a more traditional venture capitalist. And Robert has an interesting affiliation with an incubator that gives him a deep dive look into very early stage ventures. So he's an early stage investor. And I just would like to ask everybody to describe what's the climate like today. Has anything changed since March or February, wherever you want to start? And I don't know who wants to start first. Bob, do you want to pick that up?
Yeah. I mean, I'm happy to start and pass on to the other panelists. And I think we're in what I would call uncertain times. And the biggest risk right now is companies or projects that have started a direction that can be complicated in this time. So I think if you're doing large clinical trials, if you're doing trials in flu or other things related, those have largely come to a halt. Yet the burn rate for those companies hasn't come to a halt. So I think if there's the first thing that I think people are concerned with in today's environment is, when can we get back to conducting clinical trials, getting data, pushing drugs forward, whatever that might be in the projects. And they're looking for creative ways to do that, whether it's through different geographies than traditionally done, looking at Southern Hemisphere versus Northern Hemisphere, where the outbreak may be controlled. But I guess I would say, I don't think, I would look, the previous panel had a terrific public health perspective on it. We're in unprecedented times from the perspective of the coronavirus, and also, I hate to say it, but political leadership. We're not very unified in a lot of ways. So we don't really know what's going to happen. And I think that anybody that says they know what's going to happen is, with any degree of certainty, is not to be trusted. The only thing I can tell you with a certain degree of certainty is that funds that have raised money are going to invest them at some point. And so the money's going to be put to work. How that's going to be done, there may be a break in timing. People looked at the first quarter numbers and said things are on track. I don't think we're really going to see the results of this until we see projects that were in process. They got funded. Now we're looking at what became an in-process project during the coronavirus, post-March, whatever you want to call that. And I would say from our perspective at Alta, we are investors in Vir, which is an infectious disease company. I'm on the board of Vir. That's, it's taking an awful lot of time and commitment and thoughts right now to keep track of what's going on in the coronavirus space. So that's encompassing a lot of my time. But also you look at very practical things. Like if you have labs, do you have to expand your lab facilities? Do you have to rotate people through them? Just practical realities of what's going on now. And I think, there are a lot of people are inventive. I think people will come up with ways around this. I don't think the venture capitalists are going to dictate what's done, other than saying that looks like a good idea in our new reality. And I would say, gene therapy is, we've seen a lot of articles written that gene therapy is on a pause right now. Gene therapy is a terrific therapeutic area. It is a little bit on a pause in some ways right now. We had a flu program at Vir. We're not doing a flu trial right now. It seems like a ridiculous time to do it. So you sort of play the hand you're dealt, and ultimately we're going to play for what the patients need. And that's ultimately what gets paid for, what these companies are in business to serve patients. So, we've seen a drastic, I'd say biotech has not seen a lot of impact in this relative to healthcare delivery. And healthcare delivery is shattered or changing. And, we can listen to the folks from UCSF or any other hospital or physician practice around the world. Things are going to change. And things have historically changed on reimbursement and what you get paid for. And we've seen big actions from CMS, for example, now of reimbursing for virtual visits. And, that's the single biggest thing I've seen out of this. We're going to see a lot of changes. And I think folks in biotech are largely stabilizing their portfolio to make sure that they can handle the burn rates that are going to be around with longer trials in oncology or gene therapy or whatever area it is. And we'll get back to normal at some point, but it's not normal now. And I would say we're looking for where the opportunities are that are presented by the new reality.
So just to comment on the UCSF comments that were made in the prior panel, that we're all going to stay in telehealth and so on and so forth. Clearly, our numbers went from something like 10% telehealth to 60% literally overnight, like in 2 weeks. And there's a huge burgeoning of telehealth applications, but it's not going to be everything. And we've reopened for business, and we're seeing patients again and doing surgeries and everything that needs to get done. So I don't want people to stop coming to UCSF. So just had to throw that in there since you mentioned it as well.
Well, I don't think people will stop coming. I think we're just going to have to re-gear for how things are done, and there will be some complementarity with, if you look at the big areas of healthcare, there's diagnostics. Diagnostics, I don't know how to judge in today's reality. Biotech, I think, is going to continue largely, it's been impacted more of a 6-month hiccup. But I think healthcare delivery is going to make dramatic changes, and I actually think largely for the better. And healthcare delivery has been based on you do what you get paid to do. When over the last 20 years in the United States, 30 years, you get paid to do procedures. And I think that, it's probably swung a little too much to pay for procedures. I'd love to see us paying for health and outcomes. So we'll see what happens.
Okay, let's switch to Jack, and why don't you speak from the perspective of Bayer and what you're investing in?
Well, I was trained as a for-profit VC, so I tend to think like that. So one of the big changes I've seen is the pre-money valuations coming down, which is nice. I think we had gotten a little ahead of our skis on some of these projects. The other big trend I would say is it's hard to do deals with people you don't know. So we've closed, one investment with a T-cell company that was, kind of on the books coming out of JPM last year, and probably close another 2 or 3 deals before the summer break. But most of these are with either firms or entrepreneurs we've worked with previously. So it's been a lot harder to evaluate projects, especially coming from Asia. Because of the language barrier, but now you have this barrier, you can't even meet the people physically. So that's been a notable change. I agree that companies have taken this opportunity to position themselves as COVID companies. So I've seen a lot on the antiviral space coming forward now. I even saw one, TNN K-cell company pitch themselves as a solution for COVID, which I don't think would work on a large scale. And so, there are clearly a lot of companies looking at, the pandemic as an opportunity to raise capital from interested parties. I'm cautioning most of the companies I work with away from that approach. I think by the time you actually get a therapy or even a project up and running, there will be a vaccine in the next year or two. So, it might be a way to raise capital near term, but I don't think it's going to be something you can actually tractably solve. I think
you're investing in non-COVID type deals, is that right? You
Correct.
haven't just changed your focus completely.
Yeah, we are considering one COVID-like company. It's technology out of Harvard that's able to scan different TCRs to look for responses to various epitopes, not just COVID, but COVID's one of the things they could go after. But I'm not changing my investment thesis around what I think is interesting. The one area where we have looked at a company recently is in the diagnostic space. So this was a company that makes an at-home flu diagnostic test. And they figured that they could also expand into COVID. So I think there is an ability to do at-home testing in a way that's not too expensive and burdensome. There would be a lot of people interested in technology, and it might be something that's critical to getting us back to work in the coming years.
Great. Okay, well, we'll come back to this diagnostics question, but let's let Robert speak a little bit about what he is seeing and what he's investing in.
Yeah, I think to echo what the other panelists have said, it's venture capital is a people business, and you do need to get to know the people. It's critically important. For us, we have the labs as a way to get to know the teams. We've closed several deals since the pandemic, but those, as Jack said, were actually deals that were already in progress. Things that we already knew. It was a matter of completing those deals. At the early stage investment side, we haven't yet seen a really big impact. And in part, that's because our companies, for the most part, are pretty clinical. We do have a couple of companies in our portfolio that are clinical, and those trials have been put on hold, and that will extend those companies' timelines. And it does mean that we have to reserve more money than we had planned originally for our portfolio. So I think in general, it's going to be harder for entrepreneurs to initiate new discussions with venture capitalists. At the early stage also, we see a lot of dynamism because the companies have an opportunity to decide if they want to start a program that might be related to COVID-19. As investors, though, we wouldn't invest in a company that was solely addressing COVID-19. Because as Jack alluded to, the pandemic, the proximal pandemic will subside. The companies that we're interested in would have to have something that goes beyond just the current COVID-19 pandemic. You know, and to the question of labs and how do companies operate, we've been fortunate in being able to keep our labs operational throughout the pandemic. Being biomedical research centers, we've been largely exempt. We've had to put protocols in place so that researchers can operate safely, meaning maintaining distancing, face masks, asymptomatic. But if you've spent any time in the lab, you'll know that the labs, it's kind of remarkable, a lot of data analysis happens, but the labs themselves aren't that busy. There's a lot of setting up reactions, allowing them to incubate. So for the most part, we've been able to keep operations going. The lab picture behind me in green screen is a lab that we just opened in May. So in the middle of the pandemic, we opened a lab. It's got space for 50 companies, and we already have 20 companies committed to move in. So I do agree with Bob, though, that long term, we don't quite know what the impact's going to be. In the near term, I think the momentum that we had coming into the pandemic, the nature of what's happening globally right now is it's a life science challenge. And I think there's a growing awareness that the solutions will come from the life sciences. And I think that's giving us some tailwind to push us through right now.
Great. On the topic of that your companies can still use the labs, one of our entrepreneurs told me that because he has access to his lab and nobody else really can come in, he's done 9 months of work in 2 months, and he's very happy about this. He's like, beating his milestones. Great, and I think you explained to people that the labs are what, and if you didn't, I'm just going to repeat it, that because you have labs available and you can get to see companies and get to know them over periods of time, that you can make an investment decision with having some really deep knowledge of how the company is progressing. And that sort of to the point that Jack and Bob made is like, well, we're not going to invest in entrepreneurs we've never met personally before. That's not your issue, Robert. Did I say that right?
Yeah, we almost 85% of our deals come through companies that we get to know through our labs. And it is an extended diligence process. For us, it's really gratifying because we get to be a place where entrepreneurs can come and get their companies going. We don't start the discussion with the venture capital side of our business. We start it with the incubator side of our business. How can we help you? And
yeah, very different model. Yeah, it's a great model. Not everyone can do that. Not everyone wants to run labs, but for those of us who do. So let's turn back to this. A couple of you mentioned diagnostics, and I'm curious as to, diagnostics have not been popular for venture investment. And that now all of a sudden diagnostics are critical to this whole COVID situation. So do you think that they're any more attractive now? And Bob, do you want to pick that up? Has it become a more interesting sector for venture to take a look at because of the heavy need of diagnostics or not?
I mean, from my perspective, it's actually a very confusing landscape. Diagnostics has always been an oligopoly. It's been difficult. And I believe strongly in diagnostics, and it's important, and in many ways, it's the practice of medicine. I mean, that's the sleuthing that doctors do to find out if, what is causing the disease in the patient. And if you find it out, there's an associated treatment with that disease generally. But, I think diagnostics have taken a pretty good 1-2 punch with, Theranos muddying the water for a lot of people for many years. And now, to be honest with you, I think the diagnostics landscape, as much as we say we need diagnostics right now, we received, at the Gates Foundation, we were working with UW to do a diagnostic. We received a cease and desist letter from the FDA. And as far as I can tell, it's political. They didn't want testing being done because if you don't test, you don't have cases. And so, right now we've got licensed diagnostics for both the virus and for the antibody. There's not a lot of transparency on what a good test is. People are trying to find out. There are literally hundreds of tests out there. I don't know where diagnostics goes from here, to be honest with you. So and when I don't know where things are going, I don't generally invest. And I agree with both the panelists. I'm not actually looking to invest in things related to coronavirus. I'm on the board of Veer and Affinivax because we started them both 5 years ago. And they happen to be caught up in it, but that was by mistake.
Yeah. Why don't you give people 2 sentences on what Veer does and how they're playing?
Well, I started Veer with Bob Nelson at Arch and a few other people. It's basically to work on infectious diseases, and it came out of my spending time at the Gates Foundation and seeing that we needed to work on infectious diseases, but we didn't see any of this coming, and we were working on, flu and hepatitis B and things, a lot of things, but COVID.
And now what are you doing? What are you doing for COVID and Veer?
I can't say much, but we've got a couple antibodies in process and mostly working with the government, frankly, now. And this has become a government project, but a confusing, erratic government project.
Jeez. You hope that the country would get it together. Jack, how about
I do think there's been a lot of effort, and to credit Bill Gates, he's been talking about this for a long time, and other people have. And we invested in Moderna and we invested in CureVac, and those are certainly 2 of the companies that are there. And they've also invested in Veer. So infectious disease is part of the future landscape. The question is always in infectious disease, how does it get reimbursed? And historically, it's not been well. So
Jack, you mentioned diagnostics before. Tell us more about your feeling.
Yeah, so it's just an observation. Obviously, I have young kids and a family that's very concerned about COVID, and people want to be tested. They want to know, if they take a trip. I haven't been on a business trip since March, but I'm sure I'll get back on a plane sometime in the next month or 2. My wife is probably going to make me quarantine in my garage. So if I had the ability to get a test, quickly and easily, and even if the sensitivity and specificity aren't great, I think it would just give consumers some comfort about, return to normalcy. So when I think about testing recently, it's been more about, shifting the location of these tests from, either hospitals or, outpatient, kind of urgent care centers to either things that are at home or, maybe flu tests they have sometimes at Rite Aid and CVS, things like that. I think it's really more about shifting access and delivering the tests to a place where consumers can engage with them quickly, safely, and easily. So again, I'm not a diagnostics guy, never invested in a diagnostics company before, but I do see that trend, and there's at least one company on our radar that we're considering.
Okay,
well,
cool.
and it's a great point. It's not just about point of care; it's about timing. I mean, I've been tested for coronavirus 4 times and have done a little bit of traveling. It's a 2-week turnaround time for a coronavirus test. That to me is functionally useless. Now, there are certain spots where it's a very quick turnaround time, but access has been terrible.
Yeah, well, we're all waiting for the saliva at-home test, right?
Be terrific.
Yeah, exactly. People are working on it, right? So let's change themes for a minute and talk about what you do like. So we're not just going to all pivot to COVID investments. What stands out as being interesting right now? What are the sectors or the indications? Is it gene therapy? Is it cell therapy? Is it aging? Is it immunology? What is it that people like? Who wants to jump in?
Yeah, I could give a start to that. I mean, for us at the earliest stages, we're still looking for companies looking to address some real steep technical risk. So these would typically be novel targets that aren't yet well validated, but if they have the ability to generate data that then validates those targets, those become interesting. Oncology has been an area that we've invested in generally, but I would say immunology is an autoimmune disease. That's a emerging area for us.
Okay, great. Who else? Jack? What do you,
Yeah,
what do
I
you
would say that immunology does appear to be an area that's been underinvested over the last decade or so. So we're looking at a few companies in that space. cancer continues to be attractive. So we do a lot of oncology deals. I don't expect that will stop. I guess one strategy I've been investigating more, there's been a number of oncolytic virus companies that have failed over the years, but no one's really tried an oncolytic gene therapy where you're really, not just focusing on the virus killing the tumor, but actually deploying a payload that, can help to attract the immune system. So, I think oncology will stay hot, but maybe looking at some new ways to tweak the paradigm for cell and gene therapy there.
I'd say that I just have two comments on this. One, I look at areas, but I mostly look at investing in people, and I hope smart people come up with good areas to invest in. So, and I think, we've touched on this, but one of the really damaging things of the pandemic is actually to young scientists or young entrepreneurs, or I probably don't need to be out, because I'm getting older. I don't need to be out on planes all the time beating the bushes for people to be able to reach me. But if you're a young person trying to build a career, whether that's as a scientist or as a young venture capitalist or whatever it is, you got to get out and meet people. You got to interact. You've got to make your case. And I think it's difficult in today's environment. If you're a young entrepreneur, you haven't started a company before, getting out in front of the three of us and making a case when we don't have a relationship, or it's difficult to build a relationship. That's the tragedy of what's going on right now. So I would never invest money in somebody I don't know. And it's hard to get to know people right now. So I tend to be, I invested in Todd Harris's new company, and it's an oncology company, but it's because I've done a company with him already. And I'm about to do another investment in somebody that I've already invested. So to a certain extent, it's the same thing that's going on an economy basis. The rich are getting richer. The folks that are, well established, if George Church calls me or Vicky Sato calls me, I have a relationship and I'm going to return that call, and it's going to be easy to build on. If young, great researcher out of UCSF calls me, it's going to be, I'd love to get to know you in the fall.
Yeah. That's tough. So even if I introduce that young researcher from UCSF and say, this is someone you should talk to, you're going to be, I'll take that first call, but it's going to take a long time for me to get to know them.
I think the time aspect is right. I think it's still possible. I'm just sort of mentally going through, as I said in the beginning, we closed some deals, but they were ones that were already in progress. But we do have some new deals that we're working on now. And one of them was one that we've never met in person. It's taking a little bit longer because we're needing to do more through Zoom, but I do think it's possible. But as Bob says, it's going to slow things down. There's no question about it.
Yeah. Any advice for our young new entrepreneurs? How can they make this better? Is there anything they can do? Or just hang on and wait a year?
For us, it's simple. We offer lab space, and we offer it first before investment. So come get a lab bench, get going. Getting operational is hugely beneficial. So if you're a company that only has a presentation, it's going to take you a lot longer. If you're a company that has a presentation and you're actually conducting experiments as an independent researcher outside of the academy, it gives you a lot more momentum.
Yeah. Bob, any advice for these young researchers?
Look, I think the great thing here is persistence pays off, and there are different times for different events, but it's going to take some work, and it's not easy. I've never been one to invest necessarily in science or in areas necessarily. We invest in, our threshold at Alta is we want to do cures. We want to do curative therapeutics. We don't want to do treatments. We want to do symptom amelioration. And I think that's largely because it makes trials easier if you have a cure, and it makes reimbursement discussions easier. But, so I'd say, but I also, 3 of the last 4 entrepreneurs I've invested in were under 30 years old. So, I actually like the young enthusiastic. I love being involved in that process and people growing, but they've got to get good mentors. And I think it's incredibly valuable to be in an incubation space, not just for the space, but because you're exposed to a lot of other people from a mentorship standpoint and learning. And it's not just science, and it's not just business, and it's not just the ability to raise capital. You're going to face a lot of different challenges over the years. And we're looking for resilient, persistent people that are going to walk through walls. They're going to, make appropriate decisions. This is a judgment business. People that are going to surround themselves with great folks that complement them, all those things are really important.
So maybe the advice to a young entrepreneur is keep at it, get to know Bob best you can in the limited technology ability. And when things open up, then you'll get to know him. And then maybe in 2 years, he'll invest.
Well, I not necessarily, first of all, there's a lot of funding sources out there. There's a lot of creativity. So I wouldn't necessarily focus on any one person, but you're going to find somebody whose your long-term objectives are aligned with theirs. And I'd say that alignment is huge in this business. And people will turn things down for a lot of different reasons. But to me, this is absolutely a people relationships business. You want to get to know people over time. You want to do what you say you're going to do. And it's pretty much that simple. But I think the proliferation of incubation spaces and, I'd say this is version 2.0. People were doing this back in the early 90s, not as well. Now I think they're, folks like Robert are doing this in such an effective way, and they're making great use of resources. And the cost of starting up has come down so much that you can get results, or at least hints at results and pointing in direction pretty effectively. And then you have a lot more to show people sooner. So it's a terrific opportunity. I'd get to know other other CEOs in the business and beg, steal, and borrow from them.
Great. Jack, weigh in here. What do we tell our young scientists, entrepreneurs?
Yeah, I would echo those sentiments. I think you have to get out of the academic bubble, get into one of these collab spaces. They were some of the first areas to open up. Everyone's still social distancing, but it's a great place to build your network. As Bob was alluding to, there are lots of first-time CEOs, people that are still in that same fundraising mode. So you can get introductions and share, network with them. But I think it's really important just to get started. It's always going to be a slog, and it's always going to take persistence. So if I was starting a company, I wouldn't let COVID stop me. I would just get out and do it.
All right, spoken like an entrepreneur. Any questions from the audience? So we could take a couple of questions now. And if not, I'm just going to ask everyone on the panel. So if you're projecting to the end of 2020, you know how many deals you did last year, 3, 4, 1, whatever. What's it going to look like this year, given everything, everything that everything that that's external to you? What do you think this year is going to look like? Robert, why don't you start?
Yeah, that's a good question. I mean, I think I think we all mentioned, there was quite a lot of momentum. It's only been a couple months now. So if I look at our deal flow and the deals we've closed thus far, I would say we're on pace to close the same number of deals. But to Bob's earlier comments, I don't think we quite have felt the full impact now. So I would say it would be lower. At the end of the day, our job as venture capitalists is to smartly invest our limited partners' capital, and that will continue to be our job. So we need to find good deals, and we're going to be active regardless.
And since you invest in therapeutics and the clinical trial thing is an issue, are you feeling that there is going to be some sort of workaround and if you need to do clinical trials?
Yeah, it's still an open question. I mean, the clinical trials, at some point, those people will need to understand that they need to open up the trials again, because otherwise we'll have a gap in new therapies emerging. As I said, for us, we're fortunate that relatively few companies in our portfolio are clinical stage. So we're not, on a portfolio basis, we're not that exposed to it right now.
Yeah, great. Okay, Bob?
Look, my fear is controlling your own destiny as these companies. And if you get yourself in a place where your burn rate exceeds the ability to raise capital, you're exposed. And that happens. And I think we will see in that event, you'll see some consolidation. I think, gene therapy is such a manufacturing-based business right now with the ability to manufacture. That requires sizable investments, and not everybody's going to be able to raise that. There may be very good technologies but there's going to be some consolidators out there as well. So I just don't know how the landscape holds up. Our job as a community, as a scientific community, is to keep pushing things forward. Now, whether it's what name is on the door at the end of the day, I don't know. There's going to be opportunistic buying by pharma or by large biotechs, and that's great. But the job of entrepreneurs is to push new science forward, innovate, and I think they're going to continue to do that. And I think there will be workarounds, and I love some of the things I'm seeing in our portfolio already, where they're doing, virtual chemistry in other countries, or they're doing, they're shifting where they're going to do their clinical trials. That becomes an opportunity for different geographies.
Yeah, great. And you mentioned pharma. Are they still out there looking at deals of various sorts, partnerships, or are they sort of faded into the background?
No, pharma's still very active. I think, like everyone, just not being able to travel has changed the cadence. A lot of these meetings like bio are now virtual, and it's just a different experience when you're doing everything over a Zoom or a telechat. Leaps had a very big year last year. We did 14 deals, deployed something like 250 million. It would have been impossible for us to keep up that pace regardless of COVID, but I think things are going to be a lot slower this year. Funds have been able to raise capital, so that hasn't been a problem. Companies have been able to IPO, so there's still exits. We've even seen some M&A, but most of the venture folks I've talked to, they're a little bit more concerned about their portfolio. They want to make sure they have enough dry powder to fund their companies. As Robert and Bob alluded to, we're going to see a data crunch in the next 6 to 12 months, and so a lot of these companies that would have been coming from a position of strength with great data to go out and do a raise at a step-up valuation are now going to be, out raising money at flat, or maybe, God forbid, even down rounds. So, I think a lot of venture funds, even though they've been able to raise capital and they're still getting exits and IPOs, are being a little bit more conservative about how they deploy that capital, and just making sure they have enough to support their existing portfolio if they need to.
To big pharma's credit, I actually think big pharma and big biotech is very active in the deal side of things right now. And I can't figure out if it's because it's opportunity or the CEOs are sitting on board. But
it's also
a lot of deals are getting done.
Deals are a lot easier when interest rates are this low.
Yeah. So stuff's happening, and I think you'll continue to see the ecosystem, like you see. You'll see a lot of innovation at the biotech side, but I also think pharma's getting more nimble. They're focusing on their projects, and I don't think there's anything wrong with what's going on right now, and I think it's viewed much more as a partnership than an us versus them. We work with corporate VCs all the time. It's terrific. So we're working all over. So the spectrum has come together. People are dialoguing, but I do think still at the end of the day, it's about relationships and trust, and that makes things a lot easier.
Great. Well, so now maybe being on this panel with Jack, you were going to find a Leaps and Alta deal coming up.
Absolutely.
You never know. I think we're just about out of time. And so before I thank the panel, I just want to mention that we are starting a global online entrepreneurship class for life science healthcare. So if you want to hear more like these wonderful investors I've got on this panel, this class is an opportunity to dial in from any place in the world and hear people from Silicon Valley and speak about how we do things here and why we've been so successful and how to create a business plan and translate science out into the real world. So if you want to learn more about that, you can look at innovation.ucsf.edu and find the class and sign up to pre-register. So
I just add to that, I think that's a great idea. And the more exposure you get to different people, actually, frankly, people that are different than yourselves, I want to work with corporate VCs. I want to work with, as I'm getting older in this, the energy and scientific innovation and can-do that young folks bring to this, and also then sitting with people like George and Vicky at Veer, there's wily veterans and there are people that know, and the best outcome is when you put people with different experiences, different backgrounds together to push one another, and I think that's terrific. And I see that my two panelists here, it's we're all coming at the same thing from different areas.
Yeah.
And that makes for stronger companies.
It's this diversity of thinking and experience that really matters. And when we do the class, we'll have about 20 guest lecturers from the Valley, and they all have a different perspective on how to do a company. And then we'll set up forums so people can together speak about whatever they want to. But you could have somebody from Chile talking to somebody in Tokyo. And yeah, it really opens up the world. So that's one good thing about all this online stuff. Anyway, I want to thank the panel. Great job, panel. Thank
you. Thank you a lot. Thank you, Stephanie from UCSF for leading the discussion. Thank you so much, Jack, Bob, Robert. It was wonderful to hear the insights, the investment trends. It's also was nice to hear that the investment focus is not limited to resolving the effects after the COVID. So it's a kind of positive news. We are moving to a next session, and I'm calling for the speakers of the next roundtable. And the next discussion will be led by Daniel Teo, founding partner at Hunniwell Lake Ventures, and we'll be talking about the breakthroughs in intelligent surgery. And just a small background about Daniel. He's a venture capitalist, and he's currently investing in medical devices that improve surgical outcomes. And he's a founding partner at Hunniwell Lake Ventures. So welcome on stage, Daniel and his guest, Tak Chun, principal at NEA, and David Upper, senior partner at Alira Health.
Thank you. Thank you so much. Hello, everyone. I just want to welcome everybody. My name is Daniel Teo, a managing partner for Hunniwell Lake Ventures, and welcome to this roundtable on intelligent surgery. We're privileged today to be joined by Tak Chung from NEA and David Uffer from Alira Health. And the format today will start with a brief discussion between the panelists to introduce the subject, but in the second half of this 30-minute session, we'd like to hear from the audience, any questions or comments that you may have or you might like to make. And to ensure that everyone has, there's time enough for everyone, I would ask that you keep your questions or comments short, 30 to 60 seconds tops, so that we can have an opportunity to hear from everyone. You may begin to post your comments in the Q&A section of the webinar now, even as we continue on this program. Before I begin, I just want to say that intelligent surgery is probably not only one of the most exciting things to happen in the field of surgery in decades and possibly centuries, but it is also timely. While there have been many advances in many areas of our lives, particularly in computing and data and telecommunications, and some modest advances in the surgery suite, many of the tools that we're still using today in surgery are absolutely medieval. I mean, my cellular phone here has got more computing power and intelligence than many of the hardware that we have today in surgery. Now, the good news is that there is a wave, a tsunami of innovation that's in the pipeline, one that's going to change the face of surgery as we know it over the next decade. And a lot of this development comes on the back of other enabling technologies, like computing power, breakthroughs in material science and engineering. And these are the innovations that are going to help us make surgery more accessible, safer, and effective. So to discuss these exciting developments, I now invite the panelists to introduce themselves and the work that they do in this space, starting perhaps with Tak Chung from NEA. Tak.
Daniel, thanks so much. Nice to meet everyone, and thanks so much for the opportunity. I'm a principal at NEA. NEA is a larger venture capital firm that's been around for over 4 decades. We have over 20 billion under management over that period of time. In March, we raised NEA 17, which is a $3.6 billion fund. Half the monies go to tech, half the monies go to healthcare. Within healthcare, there are 3 verticals: biopharma, services, and medical devices. And I'm very firmly within medical devices. I've been here for about 2.5 years now. I was previously at another firm called Marrus. And then before that, I was an entrepreneur, like many of you. Co-founded a company called Lexington Medical. Before that, I was in big corporate for about a decade in cardiovascular and ophthalmology, Edwards Life Sciences, AMO, Bausch & Lomb, and then I have an engineering MD and MBA background. So really, thank you so much for the time. Look forward to the discussion.
Thank you very much, Tak. David Ufer, Alira Health.
Thanks, Daniel. I've been in medtech for now 30 years this year. Most of my career has been spent in the areas of strategy and business development in large cap medtech companies. I started with Abbott Laboratories. I spent 6 years with Boston Scientific in interventional medicine and oncology, Hologic in corporate development and women's health. I have had time in neurosurgery and neuromonitoring, and my last stop was with Medtronic by way of Covidian, and about 30 different product categories with $5 billion of revenue, leading business development there. I joined Alira Health 3 years ago. We're a global service provider with offices across Europe and the US, and we help clients along the way of medical affairs with the full regulatory and CRO clinical services. We are strategy advisors and corporate and business unit, and then we do on the product level strategy and health economics and market access. And finally, we are investment bankers, and we lead transactions in the mid-market from $20 to $200 million enterprise value. We do that both in medtech and pharma, biopharma.
So really almost a full service provider, David.
Correct.
Well, thank you very much, Dave and Tak. So, today's topic is about intelligent surgery, and that word may mean different things to different people. For instance, at Hunniwell, we're looking at innovation that makes surgical instruments smarter and communicate with each other. Surgical innovations that help our surgeons see, treat, and heal. C refers to the various surgical, intraoperative visualization and navigation technologies, as well as novel point-of-care diagnostics that are non-invasive or minimally invasive, non-radioactive. Treat refers to different treatment modalities like radiofrequency, microwave, laser, ultrasound, as well as some of the more esoteric technologies like cryo and plasma. And in heal, we refer to wound closure, tissue healing, and tissue reinforcement technologies. And somewhere in there also is home and portable dialysis. So these are the areas that we are interested in and which we define as intelligent surgery. So I'm just curious, Dave and Tak, how do you look at intelligent surgery? What does that mean for you? Maybe let's start with Dave.
For us, intelligent surgery goes beyond just the actual device. For us, it's the perioperative procedure. So we look at pre-surgical planning and processes to bring a patient into the OR, the intraoperative processes that would lead to better outcomes and more efficient procedures, and of course, the post-operative patient monitoring and care that leads to the better outcomes. So in general, that is all the perspective that we try to keep on having an intelligent surgery. When it comes to the technologies in intelligent surgery around products, we want to see the inclusion of advanced sensors and advanced diagnostics and monitoring technologies that have either biofeedback or some type of advanced system that will give you either point in time information or post-procedural information based on what is going to be better efficacy with a better economic outcome.
Thank you, Dave. And Tak, intelligent surgery, what does that say to you?
Yeah, I think I agree with a lot of what Dave is saying. Some of the areas that, just to get a little more specific, that folks have been spending a lot of time are sort of, identifying, what's cancerous and non-cancerous tissue, so that you can, just cut what is necessary to cut. Tracking bleeding, overlays of key either nerves or blood vessels, things like that, to make surgery easier. I would also say that, well, I guess we're going to get into challenges a little bit, but the health economics and the safety efficacy ultimately are going to be super critical, as you're certainly trying to drive towards more favorable outcomes for the patient, the provider, and the system.
Okay. Thank you, Tak. So we've heard sort of quite a broad definition of intelligent surgery. What I haven't heard yet is kind of robotics and AR. Where does that fit in, Dave? I think you have done quite a bit of work in this space, haven't you?
Well, robotics are central to intelligent surgery because they not only help the surgeon perform in certain aspects, they have so much intelligence that can be incorporated into it. It's really incumbent on the companies that are developing these robots to take it to the next step by delivering the information from their systems back to either the HRs, back to administrators, where they're where they're providing information on the procedure itself, the entire incorporation of robotics into more intelligent systems. And that could be the system itself, that could be the application of intelligence within the patient, or that could be within the user or the clinician who's using the system and giving some biofeedback into their procedure.
I think one of the common themes that we see is that, you know, when we talk about intelligent surgery, there are two steps. One is the device itself, how to make that safer, more intelligent, smarter, more user-friendly, more data-driven. But on the other hand, there is also this communication that's between devices. I mean, you know, in the world of software and electronics world, there is this whole Internet of Things, right? Devices that are talking to each other and communicating with each other. But I think today, by and large, if you go into a surgery suite, every device from every different manufacturer has its own protocol, and they're all kind of like, you know, standalone devices. And I think part of intelligent surgery is also trying to bring all of them onto one platform so that they can start to talk to each other. Otherwise, surgeons have to, if they're using 3 different devices, they're going to be looking at 3 different screens up there. Why can't they all be put together? And that's certainly something that we are very interested in seeing and hoping that there are companies that are innovative enough to bring about that outcome. Tuck, do you share that same vision as well?
Yeah, I think I think that's real. You know, I guess the question is, you know, if you know, as people start to think about, you know, forming entities around this, you know, startup or otherwise, just sort of thinking about the forces that be, you know, whether it be Intuitive or J&J or Medtronic, you know, who's owning sort of the box that's closest to the patient and sort of, you know, what, you know, your level of sort of, you know, if you're looking at, you know, Porter's 5 forces, how do you think about, you know, where you fit in there and how much sort of value you can extract from building something like that. But I certainly think it is important. It is critical, and not only, you know, interoperability between the systems inside the operating room, but also with the EHR systems and you know, bringing in CT scans and ultrasounds from, you know, pre-op and things like that.
Great. I think Tuck has begun to kind of talk about some of the technological challenges that we're facing in trying to implement this vision of intelligent surgery. You know, Dave, I think you have some thoughts about that as well. You know, what are the major barriers or technological challenges that's been keeping us from getting to that vision thus far?
Give you a few thoughts on that, but I think the first place where I would follow on is where Tuck was just talking about getting into the EHRs to enable more intelligent systems to integrate with the patient information that's either already been done in pre-surgical planning or incorporated into that patient information is key. And the interoperability between the many different devices that are being used in the ORs, that interoperability with the EHR is key, because the systems have to report back out. We have the capability now. It just needs to be opened and collaborated and collated between the many disparate systems that are not talking to each other. Some of the other challenges are the size of the devices now. As we're getting to smarter devices, they keep incorporating more technology within it, and they could be larger than the keyholes that we're trying to deliver them through in laparoscopy. So when in the past we were doing perhaps 10mm incisions, and now we've gone up to 12mm, and some cameras are accepting 7 and now down to 5mm ports. I think the systems are going to be too large, and the devices or the end effectors in the robotic systems will be too large to incorporate all of the technology that we're trying to build into them. So that has to be key. And then as we're making more intelligent surgeries and intelligent systems, they're going to be more individualized to the patient in preoperative planning. And I think being able to deliver each of those technologies on an individualized patient is going to be tough to achieve through clinicals and validate which devices are appropriate for which patients. And that'll be a long haul.
Certainly, miniaturization is a major challenge, but the good news is, of course, there is new technology every day that's making things smaller, whether in integrated circuitry or in sort of materials engineering. So it's a challenge, but I think it's certainly something that is also viable in the near future. We talk about so miniaturization, I think it also has two aspects to it. One is how to make the devices smaller, so that they can fit even into the smaller spaces, even go up the arterial or venous channels. But also how you can pack more power and more functionality into those devices. So we think about like the pill can, which is a camera that you can swallow and performs all kinds of diagnostics. I mean, the standard of care today is a dumb camera. But what we're seeing down in the pipeline are a whole bunch of companies that are developing capabilities so that it's not only able to do an imaging, it's able to do testing, it's able to do a whole range of other functions as well. So certainly a lot of exciting things happening in the world of miniaturization. Tak, you mentioned earlier on about sort of the need to get this adoption, how to get these technologies adopted in the market, and the fact that there are large incumbents there that are, maybe in the way. What hope is there for a startup? I mean, what can they do, and how can they kind of overcome that sort of a hurdle?
Yeah, it's interesting. I mean, to be honest, I think we haven't made any robotics investments, and actually, the robotic investments have actually largely come from tech firms, and not necessarily from healthcare firms, med device firms. Part of that is sort of the sort of safety, efficacy, health economics point of view. And it's just some of the data is coming out now, especially around pelvic stuff, but it's really unclear. There are frankly cardiovascular surgeries that you can do by robots, but they just take longer, and there's probably more safety issues. And so the equation never really worked out. Having said that, the Intuitive has also obviously done amazing. And frankly, as we talk to people, and my view is that the hospitals are buying the products because they want patients to know or think that they're the cutting edge. And I'd say that that's true for the physicians as well. Physicians choose hospitals based on these types of things as well. Going forward, I think it is really important to have for more full-fledged adoption, really clear health economics and safety efficacy, benefits. And I'd say that that's true now. And look, at some point, if there's a change in administration, I would say that's going to become even more acute. And then I would also say that if we want to expand this beyond, the United States, where we spend, 20+% of our GDP on healthcare, if you want to expand it to Europe or other places, Asia, even developing countries, the costs do have to come down. So that's another sort of big challenge. And then as you think about funding startups, there's sort of the categories of startups that are accessories or sort of software logistics type things that work with the incumbent products. And then there's people developing robots on their own for completely new indications. And what I would say is that, there are only a few incumbents that own the robot. And so, it's Intuitive, J&J, and Medtronic soon. And so, you really gotta, convince them to buy your stuff and pay you a lot for it. And that's really hard to do when there's only a few of them. And there really isn't a way for a startup to directly access the market with something that is just, some sort of software or something that relies on someone else's robot. So, if we were to do one, it would more than likely be, building a completely new robot, or, investing in a robot that's fairly far along, but bringing, large, it's fairly capital intensive. If you look at some of these things, there's $500 million of, paid in capital on most of these projects. So, we would bring together a lot of capital and push forward a platform, and and some place that we felt like we could get some health economic value. That's how we think about it.
So still on the subject of sort of overcoming barriers and marketing and adoption barriers, I think one of the things that Hunniwell does is that we're a little bit contrarian. As a venture capital firm, most VC firms tend to invest across a diversity of space. We're actually investing in a very focused area. In our case, within the GNI, thoracic, endovascular, hepatology, urology space, so that our portfolio companies can enjoy synergies with each other. I think that the view is that when you're fighting against a 800-pound gorilla, you really want to have all of the help that you can get, and there's no harm in having companies kind of work and collaborate with each other. And so the idea is that so that they can build scale by helping each other and to a higher level, to a bigger level, before they are IPO'd or sold to a strategic buyer. Dave, I want to ask you on this whole area of sort of overcoming marketing challenges. What does Alira Health have in terms of advice to startups?
I go back to the old saying, it takes a village, and we don't see any one company that's going to deliver all of the intelligent systems that's going to make an entire operative theater work seamlessly and intelligently. So again, we talked about some of the pre-planning imaging that, well, look, we can do two dimension CT and hand that to an orthopedic surgeon, but when they go to perform their implant, do they know what's going on at the time of surgery? Is the patient completely oriented the way they were when they took the CT? And what does it look like right now at this time? Or the same in oncology when you're going to do a tumor resection in the lung. That was 2 weeks ago, and now I've got a patient breathing and moving on the table, and I want some type of real-time CT or fluoro guidance that is not incorporated. Not every OR has a CT in it. So we're looking at the marriage between preoperative imaging and that would have intraoperative capabilities. And that's not going to be done, at least today, from the companies that are delivering robotic systems. So let's keep the robotic systems in where they are. They're expanding. You're looking at more end effectors and more tools to be used in the robots, but they don't also have the implants. And now that the implants are smarter or have different feedback, they're not preparing a knee for the implant. There's so many different components. You have to have interoperability and collaboration to make these better and more amenable to having better, talked about the economic outcomes. We can talk about efficacy, but we also have to look at when he's talking about 20% of the US GDP in healthcare, they have to be economic as well. A lot of the arguments are out the window. You can talk about intuitive, that would be an entire dissertation. And is that cost cheaper, and is it relative to the outcome? Perhaps if you're taking out a prostate, but maybe not in a lap chole, and they can argue that in a different forum. But those are the considerations that everybody has to make.
I think the trend that we're seeing is these robots sort of becoming smaller and more specialized, so that you don't have a $1 million multifunctional robot, because at the end of the day, you're only using one or two of these functions at any one time. So that's certainly what we're seeing. Before I go on to the next question, I just want to make a note that we're looking at a Q&A section, and there are no questions from the floor. I'd like to encourage the audience to fill the question. If there's something that you would like to ask, kind of raise your hand, put something in that, and we will get to you in a minute. Quick question for our panelists. Your Tuck, you're an investor, and Dave, you're an investment banker and advisor. As you help your clients kind of, or you help yourself or your clients look for opportunities in this space, what do you look for? What part of this space do you gravitate towards, and what do you look for in a company? Tuck, maybe?
Yeah, I mean, you know, I think in this space, we would probably be looking for, you know, for intelligent surgery. You know, I would say I would have to take this more broadly. I'll be honest, you know, with Intuitive, Medtronic, and J&J with robots, with surgical robots for GI, it's really hard to bet on even a CMR that's, you know, not that far behind. You know, you can see, you know, Transenterix, Titan, you know, there's dozens of them, and it's just not super clear how they're going to beat out the incumbents. You know, Intuitive has a massive installed base. You know, Medtronic and J&J have reps and, you know, dozens of reps, you know, across every hospital system. And so, you know, it's going to be really hard for someone new to compete in that space. If they were going to, it would have to be something fundamentally different that would allow for improved health economics. So it'd have to be a fundamentally cheaper system, which, you know, isn't great for returns. And then, or something that allows you to do, you know, some surgery that you weren't able to do before. So there's a company, Vicarious, that has a robot that can sort of do a 180 once they get in, so it's easier to do a ventral hernia. You know, you have to decide if that's a large enough market, but something like that where you're doing something that's fundamentally different. I would also say, you know, look, you kind of have to look at AI and robotics in other spaces, right? Like, you know, we know that there's robots in other spaces, lungs, hair restoration, you know, BPH ablation. There's got to be others. There's opportunities in. You know, I'm going to throw one out there that's completely, you know, it's AI and it's robotics. It's not necessarily surgery, but I think it is interesting. So there's a company working on in vitro fertilization, actually, and so you can imagine that, you know, IVF is actually a massive market in the United States and in other places around the world. And, you know, it's largely sort of, you know, done by technicians who sort of pick the sperm and pick the eggs and stick them together. Well, you know, if you can with AI determine which sperm and which eggs are more viable, and then you can use robots to actually do the pipette insertion. You know, there is a potential for increased efficacy there. So you can have an increased conversion in a highly, you know, expensive, market. And so, you know, that is a place where you can probably provide very clear, health economic value to, you know, people who are willing to cash pay. So that is, you know, and that's sort of going outside the system. And outside of you know what we're currently looking at. I'm just saying that there's probably other places. I think GI surgery is going to be, you know, sort of tough to make investments in right now as far as building a big robot. I think David can probably speak to some of the other accessories.
Yeah, good points, Tuck. You know, what we look for people that have two components, either unique value propositions. So Me Too's are just not that interesting anymore. They have to have some type of differentiation versus what's already been incorporated. Certainly trying to go against the behemoths that dominate the space. And then compatibility with either process, procedure, or technologies. So if you're going to disrupt a standard procedure and not be incorporated into the other tools that are being used, they're going to find a much more difficult pathway into the marketplace, regardless of how advanced they are. So if you have something that enhances a robotic surgery by vessel identification, or Tuck, I know, had a lot of themes along the line of bleeding identification and determining where the source of bleeding or enhancing some type of reduction in bleeding. Those have to be incorporated within the current technologies that are being deployed. So we look for the interoperability within the current technologies that are being utilized, as well as something that's unique. You can disrupt, but it has to be within the certain realm that you're disrupting the individual technology, not the entire process.
Thanks, Dave. We now have one question from the field or from the room, and it's coming from none other than my colleague, Richard Fang. And I promise this wasn't a planted question. So Richard, if you're on, you have a question for, I think, all of us, or maybe a comment. Administrator, could you put Mr. Richard Fang on?
Yeah, my question is still, if you look at all those players, either is Intuitive Surgical and other players, J&J Medtronics, they're all doing the similar thing as Defensive will do. In order to, as Ted put it, in order to do things drastically different, how do we do it? I mean, I understand the barrier from the incumbents. I would like the panelists to comment on that. Thank you.
Dave?
I want to be very clear. We don't look at intelligent surgery at Alera as Intuitive, J&J, and Medtronic in laparoscopic robotic systems. Intelligent surgery goes everything from, again, feedback of instruments, talking to the EHR, looking at standards of processes and procedures and reporting to administrators. This surgeon is substandard. We need to do training and improvement. These surgeries are going extremely well at your institution, your in GI, but your GYN service is well behind your peers. There's so much that goes into intelligent surgery. If you want to ask how do you disrupt the Intuitive, I don't even think that J&J, even with their $4 billion Auris acquisition, or Medtronic now with their release of Hugo, have that completely identified yet. We'll see. They have 6 million surgeries that they've already performed. You have to have procedures done to be authorized to do them in some institution. That's a major disruption. So to even CMR, I think we only see 4 or 5 players in that particular market. However, if we're going to talk just robotics, not even intelligent surgery, we've landscaped over 165 different robotic systems in medical across everything from percutaneous needle biopsy all the way to knee implants. So there's a huge plethora of technologies out there in just robotics. I don't want to just purely comment on how you disrupt the 3 major players in the laparoscopic field right now.
It's for.
But nevertheless, Dave, I think in whatever field, whether robotics or non-robotics, the reality in the medical device industry is that in many of these fields, it's often dominated by 2 or 3 incumbents that are out there. So in the competitive landscape, in the competitive analysis, the competitors are one thing, but who is also driving demand, and how do you get adoption at that end of the scale? I think that's also important. In some of our earlier discussions, Dave, you had some views about who is driving and demanding intelligent surgery today. You want to kind of share with everyone? You're muted, Dave.
There we go. Good. Sorry. Yeah, look, this is a combination of the facilities and the administrators. If we look at what was done in the case of Intuitive, this was driven by the facilities' desire to draw in more patients by advertising and promoting robotic surgery and the benefits of that, not only for, say, prostatectomy, but we're trying to drive that into GYN surgery with hysterectomy and other GYN oncology procedures. Again, that was marketing efforts based on the facilities. The clinicians wanted to use that either the fatigue standing over patients for 7, 8, 10 hours a day, in driving multiple laparoscopic tools over that time. There's a lot of fatigue. Being able to sit down at a system and be able to drive those robotic arms without standing over that operative field is a huge advantage. And then there are certain areas where the talent is not done. It's not that the clinicians aren't talented. They might not be the most advanced laparoscopists compared to some of their peers or competitors down the road for them. And now they're able to perform certain procedures that they were precluded from with their laparoscopic skills, and that afforded them newer skills. So those are some of the demand generators from those who wanted to adopt certain systems. Of course, the payers are quite concerned about, can we make the connection between the outcomes and the economics of those outcomes with the increased spend. There's no doubt that these systems cost more. The payers haven't noticed that as much because there's not a pass-through, so the facilities had to potentially eat the cost of a $2 million piece of capital and the maintenance of that, as well as an increased cost of the tools that go along with it.
Thank you, Dave. So we're coming towards the end of our session, and thank you everybody for joining us. One final word from our panelists. What final word of advice you may have to entrepreneurs who are currently developing a product in the field of intelligent surgery? Tuck, what advice would you give to our entrepreneurs?
Yeah, it's interesting. I'd say that for most things in medical devices that we've invested in, you definitely take in KOL feedback, but also, ultimately, publish papers on safety and efficacy that are super
okay. Dave?
Critical in adoption. But what I would say is actually in robots, KOL feedback and user feedback is penultimate. So that is ultimately, you need to have a system that is easily adoptable and intuitive for the doctor, part of the pun. I mean, it really does have to be. And that's what differentiates Intuitive from, Transenterix, from Titan, from, so that's what's going to differentiate all these is actually, how easy it is for the physician to adopt it if they like it.
Thank you.
Yeah, sorry.
Thank you, Tuck. 30 seconds, David.
Yeah, beyond the KOL feedback, which is always paramount, ensure that you're talking to the hospital administration as well, and that they have other objectives and goals for the entire outcome and procedure that they're driving. And the intelligent systems now are going well beyond just that limited procedure, and they're looking at the entire outcome as well as the entire operation across the facility. And that's hospital administrators that have different objectives as well. So assure that you're speaking with them.
Thank you, Dave. And at Hunniwell, our take is clinical needs analysis. Everything starts with clinical needs analysis, ends with clinical needs analysis. That's the way to go. So thank you, Tuck Chun from NEA and David Ufer from Alira Health. I want to thank you and everyone else who's with us today. We hope that you found our discussions helpful. Just a quick reminder that Hunniwell is also hosting a 7-hour online networking lounge immediately after this. So please feel free to register at our website, www.hunniwell.com, and join us. See you soon, and good luck in the rest of the summit. Hope you enjoy it. Thanks,
Daniel. Thank you, guys. It's a great panel.
Excellent. Thank you so much, Daniel.
Thanks.
David, for fascinating talk. Really insightful thoughts, very interesting presentation and conversation. So I would like to remind to our guests that you can follow the agenda at f50.io/summit. You can look all the background and bios of the speakers and all the guests and the participants. And you can also follow the presentation sessions on the YouTube, and those conversations will be available on YouTube. And please subscribe on LinkedIn and YouTube and social media channels. And now we are moving to our next session about medical devices. And it will be the host and moderator for this session will be Dr. Shan Chan. He's a medical director at
Nikolai.
Yep.
So maybe I can help you this one. So let me introduce the moderator for this panel. He's a very young a smart entrepreneur running also a medical device company. And Prathamesh had been an EIR for F50 for a while ago, and he has a medical doctor license in India, as well as graduate from Georgetown University in medical field. Okay, please big welcome to Prathamesh.
Thank you so much, David. Hello, everyone. My name is Prathamesh Prabhudesai. I'm a physician by training and the co-founder of SafePBM. SafePBM is a medical device startup in the ventilation and airway management sector. We bring the resuscitator functionality closer to the transport ventilator. And for the COVID-19 pandemic, we are pending emergency use authorization. Today, I will be moderating a medical device development panel with our esteemed panelists, Dr. Xiang, Peter Liu, and John Ashley. They bring several years of diverse experience from clinical medicine, medtech industry, and the investment world. Without further ado, let's learn more from them. Can each one of you, starting from Dr. Xiang, give a brief introduction about yourself and your journey in the medical device sector?
Right. Well, good morning, everyone. I'm actually, in fact, is in the clinic today. Therefore, I kind of muted my background early on. It is my great honor to be here. Thank you for F50 for organizing this wonderful event. And I've started listening to it since yesterday. Have learned a lot. I can recognize a few familiar faces here, including Peter, who is a longtime friend. It's good to see you here. So myself, I am a pain management doctor at Stanford. I have been in the field in the medical field for more than 20 years. I did residency at Stanford, a fellowship in pain management, and now I've been practicing on a daily basis. I am also the founders of the Society of Chinese American Physician Entrepreneurs in the United States. We have over 500 members with physicians across 50 states, 38 subspecialties. Many of them are involved in creative entrepreneurship for medical device, etc. Myself, my adventures in medical device first initiated as one of the founders for an implantable device for headache treatment. Currently, we are still in the process of developing prototype for migraine treatment. And during that process, I've learned a lot about our communities on Stanford campus. People who are working on various devices learned that many talented people who are trying to do the great things for the communities. And then I started to get more and more involved in that. Because of those earlier work on medical device and also my daily use of medical device, and I'm very interested in this panel of discussion, and I look forward to learning from all of you. Thank you.
John?
Yes, hello everyone. I'm excited to be participating in the F50 conference, and I've been enjoying all the panels so far and the discussions. I'm a medical device entrepreneur. I've been in this industry for 30 years. My background is as a mechanical engineer with a master's and bachelor's from MIT, and I've worked in over a dozen companies with 8 exits, and we've returned over $1.2 billion to investors to date. I'm very much sector agnostic. I've worked in products like orthopedic implants, heart catheters, surgical tools, and energy-based delivery systems and medical devices. I enjoy both the challenge of developing a new technology and commercializing it and bringing it to the marketplace, as well as what is required to set up and structure a company to successfully manage that process through all the challenges with clinical and regulatory quality and reimbursement, IP, the whole 9 yards. I think that's just as challenging, as interesting as the technology development. Happy to be part of this group.
Peter? I think you are on mute.
On mute?
Yeah, we can hear you now.
All right. Okay, hi, good morning, everyone. Thank you for having me for this session. And my background, I came from a trained cardiologist in China and went to Yale Business School and get a degree. And then get into this venture capital side and about 20 years, and the total career in the medical field is about 30 years. So for the medical device journey, I've been invested in a few companies in cardiovascular, ophthalmology, and dermatology area. And some of them already exited, and some are in the process of developing. So very happy to be part of this group. Thank you, guys.
Thank you so much, all the panelists. So my first question is, at this point, because of the pandemic, we have a lot of smart and well-resourced individuals interested in working in healthcare. How should they find and evaluate medical device opportunities in any order?
I'm happy to start, Ramesh. Thank you. Well, I think that the primary avenue for developing a new technology is identifying the problem and identifying what the need is in the marketplace. In this case, the surgical suite or the ICU or wherever your medical setting is, to find out what the problem is, understand the problem, what the requirements are, and how you might be able to develop a new technology to address that situation. My own personal experience with that is, I'm not a doctor like Peter or Zhang, but I like to hang out with them. So I think having a lot of conversations with doctors, surgeons I've worked with in the past, to see what their challenges are on a daily basis. As Zhang said, he's in there every day treating patients. And so that's a invaluable source of information to get that kind of perspective of what the challenges he's seeing every day, and what can I bring to the table to help him address that. So I think having the conversations with the frontline healthcare providers, and as much as possible getting there in the room with them to see what they're doing, is a method that I found very successful for identifying new opportunities.
Yeah, I like to contribute my thoughts on this topic. I think globally and locally, there are two different topics. And because our firm is primarily focusing on China, so which is a developing country like India. And from that perspective, after the pandemic, I think, especially for the medical device perspective, I think the very hard point is diagnostic medical devices. And from the developing countries, from developed countries like the United States, I think the robotic and the remote control devices are really, really hard. This is reflected by the stock market. You can go look at that. And for you know, on the extension of that part, I think some medical device related, like a reagent, and for the radiology imaging, also very, very, very popular. And one of the portfolio companies in China focus on imaging, remote imaging diagnostics. Is very popular, very hot. Okay, thank you.
I want to give her a point. you know, the pandemic definitely has changed the landscape of how we deliver healthcare here, not only here in the in the United States, but also worldwide. Just give you one example on the clinical side. You know, before the pandemics, we barely are able to see patients virtually. I mean, even though telemedicine, they have been here for more than 20 years in this country, but the insurance, you know, agencies or the institutional policies, the restriction, etc. I mean, in our practice, we barely see any patients through telemedicine. But do you believe the numbers right now at Stanford? In our clinic, we're seeing our patients 99%, 99% seeing patients via telemedicine. That's unimaginable. So there's a lot of challenges the pandemic brought to us, but there are opportunities too it presents. The telemedicine so far, we have been able to meet most of the needs from our patients. They're satisfying. In fact, many of them are very, very grateful. Imagine that you're living from out of state or in Central Valley, just here in California. You do not need to take time off anymore. You do not need to bring your cars on the highway anymore. No more CO2 emissions. You know, 4 hours driving now becomes 30 minutes of visits. It absolutely has changed the way how we interact with patients. But there's limitations. We can't land our hands on the patients anymore. That gave us opportunities for medical device innovations. There are tools being developed right now that, you know, we can guide the patient to initiate self-initiated physical exams. In fact, I've been talking to companies for developing those tools in the past couple of weeks that they can help doctors to really, you know, not just the wearable devices, but also more specifically, for example, a guidance, you know, for doing a knee joint examinations or shoulder joint examination, etc. Those medical devices that, you know, can help us shorten the distance between the physicians and the patients. I want to add one more point is that, you know, in the histories of medical device innovations, most of the time, the ideas are initiated by the clinicians. Sometimes, of course, non-physicians who have fundamental understandings of medical needs, etc. And you form a startup and you know, get the prototype going, and the VCs comes in, and then you grow. And I think the role of the medical side of the physician is irreplaceable for the innovations. Obviously, we need collaborative effort from everybody. Engineers is just as important as clinicians, and of course we need a management team and etc. Everybody come together and, you know, reach our promised land.
My next question is on intellectual property. Once you identify a good problem to solve, you want to make sure you have strong intellectual property. So I wanted to ask all the panelists, based on the stage of the company, how much impact does IP have in deciding ideation, maybe seeking investment, or in later stages once you're discussing a merger or an acquisition after the startup has a lot of sales? Starting from John.
Thank you, Prathamesh. Yeah, I think fundamentally from a viability standpoint and a investment standpoint, any startup needs to have a good IP portfolio. That said, it was insightful from you to break it into different stages. Before going out and shopping your startup around, you certainly need to file IP. You need to capture your idea and development and invention you have. But I'll share you one story. About a year ago, I was pitching to an angel group, and one of the investors said, "Well, it seems like your issued patent is about 12 years old. It doesn't have much life left on it." And I said, "Well, yeah, that's very correct. But in my experience in the medical device startup world, you file your patents with your idea and your first prototype. And then between that and your commercial product, there are many changes that occur and innovations that happen along the way, and more patents get filed. So the first patent you file is rarely the patent that is totally defining and protecting your commercial product. So it's a process that evolves along with the growth of the company. Many times you'll take a product to the market and do your first clinical study and get feedback from clinicians and find out you need to make a few changes. You make those changes, you patent those changes, and you go back out. So it's an evolving process. And I want to reinforce one thing that Zhang said, which is, yes, the majority of these ideas do come directly from the clinician, the surgeon, and in my experience in a medical device startup structure, it's very, very important to have a doctor as a chief medical officer, somebody, a part of the company who's keeping that focus foremost in the company's progress, and it doesn't get sidetracked and going down a pathway that isn't really totally focused on both the patient's needs and the surgical user's needs.
Peter, as an investor, what is your opinion on intellectual property?
All right, that's a very good question. Actually, I think, and also the different scenarios. And in the United States, and I think investors prefer you have a creative, first-hand innovative innovation. Basically, the IP is critical for the startups. I think, however, on the other hand, in the country like China, we invest in a number of deals. The IP important, but not the first priority, because the creation ability is not as strong as in the United States. It's relatively weak. However, the market is huge. There are a lot of the underdeveloped market. So that's kind of for the relatively later stage companies. We are more concerned about the manufacturability, the marketing sales channel. So based on the two things, I think the IP can be put in the second priority. So we are more concerned about the ability to sell product, to get us through of regulatory and etc. And because of the market, the size, like India, China, and I think the local manufacturer or local entrepreneurs have some advantage in terms of the service, in terms of relationship, in terms of the culture, etc. So, and in different scenarios, I think we have different strategies to deal with. Thank you.
Dr. Zhang, would you like to add any thoughts to that?
Well, I think Peter has pretty much summarized all. Okay. And then John, did an excellent presentation on your side. I just want to maybe one more comment is that, of course, IP is critical for a lot of startups here in the United States. The IP, however, could come from two sides. One is from the engineering side. How do you make the stuff? How do you put the logistics, everything together? On the other side, finding a clinical indication is also very, very important. You can have the best tools in the world, but you need to find a unique treatment scenarios. And then I think that is also critical. For example, I have recently involved in a project treating allergies, which is a huge problem in the United States. And then there's a group of innovators in the Bay Area. They have spoken to the ENT doctors in the field. They learned that there's a very small nerve in the inside the nose, underneath the mucosa. They might be involved in the allergy pathology. And that knowledge is critical for the startup to develop a cryoablation device that goes into the nose. They basically freeze the nerve terminals underneath the submucosa. and got excellent benefit for allergy treatment. Their companies, I think, was formed about 3 years ago. They were just bought by Medtronic. I think Peter may know that company. I think you're part of the investors, and they had excellent exit. This example gives you idea that the patent could be in the device itself, but also could be in the clinical scenario as indications, also, as well as critical, both of them.
Mm-hmm. How do each one of you approach regulatory and reimbursement for medical devices, like globally and also in the US specifically? Starting with John.
That's a great question, and I like that Peter keeps bringing in the global perspective on these questions. Well, I think these days, particularly in the United States, where reimbursement is the biggest issue, the regulatory and reimbursement really go hand in hand. It used to be kind of separate pathways and separate approaches, but a smart startup is going to develop a strategy that addresses both of these areas, because there is a need to provide evidence for regulatory approval. There's a need to provide evidence for reimbursement approval or reimbursement payments. And that evidence is always in the form of clinical data. And if you don't put a strategy together that ties these two, you're going to end up doing twice the amount of work or 3 times the amount of work to get that evidence. And if you put a strategy together early where you're tying them together, you're likely going to reduce the amount of work you have to do, because you are able to collect data to support your regulatory approval and to get reimbursement. And one of the straightforward strategies with any product is to look at the competition and look at the predicate devices. Obviously, if you're developing a product for the FDA that's a 510K device, the predicates are what you're going to use to show equivalency and get approval. But even if you're going after a PMA product, looking at the competition is very important, because you can see what kind of clinical study they used to get their PMA device reviewed and approved. And that can give you a strong indication of what kind of study you'll likely have to use you'll have to follow to collect the evidence to get FDA to approve. So looking at the competition is a strong strategy for a fundamental drafting of a regulatory and reimbursement strategy.
Peter, what are your thoughts on regulatory and reimbursement in the Asian market? How do you guys take that into account prior to investment?
All right, that's a very, very good question. Actually, for us, I think that's critical to when we look at the startup or whether or not you make an investment. I would suggest, for every single startup entrepreneur in the medical device field, even before you start the startup, I think you should put the design or product, any idea or thinking, you should think about first the regulatory and the reimbursement scenario in the future. That's very important. Sometimes because it's very costly to develop product, and if you don't put the regulatory or reimbursement, your product maybe get approved from FDA. You can hit the market. However, you will face a huge challenge from reimbursement. I witnessed a number of the entrepreneurs in the Silicon area, and they have really had a hard time in later. So to face the reimbursement, I think, as I said, there are 2 different scenarios in China and the United States. However, as far as I know, so in China, there are less 5% of these products have no reimbursement. Very, very small percentage. For the huge percentage of device, you have to get approved. Otherwise, you cannot survive in China. So reimbursement is a big problem, and also you have to consider that ahead. And in the United States, I think there's this big number for the entrepreneurs, even though the commercial insurance system is well developed. But however, I think you have to consider about that. So for the commercial, for other, financial funding resources, how to reimburse your product, or even for patient. That's the key factor for I think for entrepreneurs and also for investors.
Yeah, I mean, I fully agree with both John and Peter. It is definitely something you have to think about it before you start on something. But on the other hand, for certain disease, when we lack of therapies, or when we lack of comprehensive understanding of how we're going to treat it, the new devices that comes out, the new treatment that comes out in the beginning, they're at disadvantage because it takes a while for the insurance companies or CMS to start to think about whether to reimburse them or not. For example, I'm just talking about my own specialties. Back pain in young people in 40s, the discogenic pain accounts for about 60% of why we visit ER. But we don't have really a good therapies for back pain due to discogenic problem. Most of the devices that have been developed in the past have failed in the end, not because they're not good. They're good. They provide some sort of benefits for some patients, but not to a point that you can see clear-cut benefits, to the next level, such that there's no reimbursement. And most of the patients, when there's no reimbursement, they have to pay by themselves, unless this is a kind of a game changers. They're not going to be able to afford it, or they're not going to be willing to pay for it. And that kind of killed the medical device industries for that respect. So right now on the market, there's no good therapies for discogenic back pain. It's a huge market. It's multiple billions, $1 billion of business, because we have so many people, hundreds of millions of people have it. So it's kind of high risk, directions that certain companies, obviously the big one, the big players, they are developing techniques, and then hoping that one of those devices could, give us next levels of pain control, pain management. And then they have good data come out, and they can convince the regulatory agencies to start to reimburse. And I think that's kind of just another way to spin it. In a nutshell, regulatory approval is extremely important. It's critical for your survival. But if you have a deep pocket, or if you want to diverse your investment or your innovations repertoires, then you definitely could explore that possibility for a bigger market.
Prathamesh, I want to add one more comment there. Both Peter and Zhang made me think about with their insightful thoughts. As much as we've talked about getting the input from the clinician and understanding the clinical needs and staying focused on that, what's become very clear in the medical device industry is you need to understand the economics and where the dollars are these days. And your reimbursement strategy has to take into account what money is being spent on your market right now and how your product is going to move that money around. Because if you're going to bring a new product into that market, you're expecting some of it to come to you in your company. But if that's the case, you're going to have to save some money somewhere else. So that economic analysis is becoming just as important for medical device development as your impact on the health of that patient. And the reduction in complications is one area where you can say we're going to save money, and that's going to be part of our economics. Displacing other procedures that are more expensive is one way that you can show you're going to make money, and also displace some costs elsewhere, because it really needs to be a a win-win, that you're going to make money and you're going to reduce costs somewhere else. If you're just taking money away from somebody else who's selling a product and you're not lowering the overall costs, it's going to be a much harder product to bring into the market than sell than if you're able to demonstrate that you are able to reduce the overall costs to that patient population, to the insurance company, to the hospital.
Thank you, John. So Dr. Zhang, I think you have to leave. That is okay. Peter, you were saying something?
Yeah, I have. I have a add-on patient to come in about 10 minutes or so, but I'm here, and I just have to excuse myself for 5 minutes in the middle. So go ahead.
Okay.
Oh, I mean, so I just wanted to just 2 cents for following the John. Actually, so our strategy when we look at the startup, so we are focused on whether it's clinical driven. The need is from the what's your motivation for the physicians to use this device? Why use it? Where is the value, clinically and economically? So I think all these assessment should be made before you kick off the long journey of an entrepreneur. So it's very, very important. So that's what I want to add to say. Thank you.
Thank you, Peter. So a lot of people who are outside healthcare think that because of COVID-19 pandemic, there must be a lot of money flowing into healthcare. But on the contrary, hospitals are running on razor thin margins because all the acute procedures are not happening. So in such a situation, how do you see investment landscape changing over the next few years? And what is your advice to entrepreneurs on things that they should pursue?
Peter's got the money. I want him to go first.
All right. Okay. And just I've been thinking, sitting in the home in Silicon Valley. So basically, we have a daily conference call with the portfolios in China. So far, we have 25 portfolio companies in healthcare service, in medical device, and also in new drug development. And also the fourth area is for the healthcare related technology. So this question is very important for all the portfolio companies. We almost discuss it every day. So how for the company, I think the critical thing is save every single dollar you can. So because I think down the road it's going to be a hard time as well. And also because of the income, because the whole social networking change, I think for these companies, especially for the R&D and healthcare service businesses, I think they are going to be impacted hugely by the pandemic. So for the R&D, it's kind of a little bit better because if you get a funding already, you just do it. And also save money. Try to preserve as much as possible in your pocket. And for like the company who are looking for new fund, I think my feeling is that the valuation, pre-money valuation, basically cut 30 to 50% already. So this is a direct impact. And also some companies, I think, because of the pandemic, has revealed some drawbacks for the whole healthcare industry. I think you may think about how to shift your idea towards to, I think, the popular area like the vaccine. Some device, as we mentioned, related with how to prevent and diagnostic these areas. And well, that's the situation. That's basically.
That's a very good comment. Thanks, Peter.
I'm sorry.
Thank you, Peter.
Okay. Are you hearing? Good. Where are the people?
Any final comments?
I just
Dr.
make
Zhang?
a real quick comment on the investment and money.
Can we
I
pick
see.
like 3 sentences for everybody?
Yeah, just real quick. I'd see that it's much more challenging for medical devices to get started, and the entrepreneur needs to focus on alternate funding to get to the point where they're ready to collect patient data, whether that's grants, angels, or family offices. That's really where I see the investment dollars coming from. Thanks.
Thank you so much.
Dr.
Excellent.
Zhang, any
Okay,
final?
yes.
Thank you very
Yes, well,
much.
I think one word Peter already mentioned is every dollar counts now. So I think we just have to be mindful for the entrepreneurs that before your product can't meet the patient. So cost saving, be more efficient, I think it's all very important.
Great. Thank you all for the great panel. Bye-bye.
Thank you so much.
All right, bye-bye.
Thank you for the invitation.
Bye-bye.
Thank you,
Bye-bye.
Prathamesh, for
Bye-bye.
leading us.
Thank you.
It was a wonderful talk from the panel on the medical devices. For those of you who just joined us, today we've heard opinion leaders, famous scientists, researchers, investors, venture capitalists, and academics. Today in the morning, we've heard global economics discussion. We've listened investment trends and breakthrough in the intelligent surgery. Just recently, we've heard about medical devices. And now it's the time to move to our next roundtable discussion. And it's a fascinating time because now we'll be talking about the legal. And I would like to introduce the roundtable led by Roger Royce, famous Roger Royce, who is now partner at Haynes & Boone. And thank you for all the participants and speakers who will be presenting. David, do you want to say also a couple of words?
Sure. So I just actually want to do advertisement for Roger. Roger had been an amazing committee member for this event. And Roger, with his team's support, actually organized many great sessions, including our kickoff session with Dr. Thomas, and also several wonderful food tech as well as ag tech content. So this is a great time to meet with Roger's team. I'm sure many of you know that it costs lots of money to ask Laura some questions. So I'm sure today you got pretty good opportunities. It's a lunchtime. We're going to let the session run a little bit longer. So for the audience, you have any question you want to ask our all-star team. So stay tuned. Thank you, Roger.
Warm welcome, Roger.
Okay, well, thank you very much. Thank you for that introduction. Very good introduction. I don't know if that famous Roger Royce can make it, so I'll fill in for him here. So again, I am Roger Royce. I'm a partner with the international law firm of Haynes & Boone, based in Palo Alto. I'm here today, and I've moderated quite a bit of panels at the F50 Global Summit, elevating health tech innovation on agriculture tech, food tech, but I'm here today to talk with a team of lawyers about some of the legal and maybe some of the market issues in health tech. So what I'd like to do is just briefly introduce the panel, let each of the panelists just take a couple of minutes to tell us about themselves and their experience in this space, and then we'll go into a deeper discussion. You know, I will say that all four of us are with the law firm of Haynes & Boone. We all just recently joined. We're building out the West Coast practice. And we all four have a pretty deep, pretty big footprint in health tech. It's a big part of our practice, although we all come from it at a different practice area. So your timing, David, could have been better for this conference. It coincides really well with our launching of an expanded West Coast practice. So we have Virginia Slutu. She is a corporate lawyer. She came over with me from the Royce Law Firm, been with Haynes & Boone for about 2 months. She's going to talk about some of the financing trends. Roger Kwan joined us, I guess about a month ago. He's an IP lawyer, has a background in AI in particular. We'll talk a little bit about health tech in that space. And Jason Novak, also from Haynes & Boone, joined us about a month ago, intellectual property lawyer. So before we get too deep into it, again, I'd like to give each of you an opportunity to say a little bit about who you are and how you come to the space. And Virginia, I think I'll start with you.
Hi, everyone. I hope you can hear me well. So my name is Virginia Slutu. I am an attorney in California and also licensed in France, in Paris. I started my career in-house in a highly regulated industry in the aerospace, so not unlike the health care industry, and currently servicing several healthcare, digital health companies.
Okay, thank you, Virginia. Roger?
Hey, thanks, Roger. So my name is Roger Kwan. I'm a partner out of the San Francisco office, well, the soon-to-be open San Francisco office for Haynes & Boone. I chair the Precision Medicine and Digital Health Practice Group for Haynes & Boone. I focus my practice, along with Jason, around building out IP portfolios and also protecting data rights for companies in the precision medicine and digital health spaces. Very similar to Virginia, I also had a very significant stint in-house. My stint was with Thermo Fisher Scientific, where I oversaw IP for a lot of our instrumentation, software, and equipment product lines that launched out of Thermo Fisher.
Okay, thank you. Jason?
Yes, thanks, Roger. Yep, my name is Jason Novak. I'm also out of the soon-to-be San Francisco office. Partner. We've had our practice now for almost 4 years as of, I believe, next month. And much like Roger, I came out of in-house practice as well. I was also at Thermo Fisher Life Technologies for about 5 years, where I supported the genetic sciences, instrumentation and software platforms, handling all IP issues dealing with that business. And my background is really in biotech. Once I started going in-house, before that I was more so in med device and food. My background is in both of those from an undergraduate and before law school as an engineer, but have been in the healthcare and life sciences space ever since going in-house.
Okay, thanks very much. Jason, I'm going to stick with you for a minute. Can you tell me a little bit about digital health technologies? I know that's an area you're active in, and what that looks like these days, especially some of the legal issues that are sort of unique to digital health.
Sure, I'll touch on a little bit of it, and then Roger can obviously jump in and add quite a bit more as well. My impression of the digital health, and when I say digital health, I'll talk about telehealth, telemedicine, those sorts of companies and platforms, is this has been a trend that's been going on. And when Roger and I were developing our plan for the practice back in 2016, the idea was, and the thought was that this space was going to start growing in 2018, 2019 years, and that that the legal issues that were going to surface with this, particularly in the intellectual property side, were going to be pretty deep. What we agree on and what we're seeing now is with COVID, what we're just seeing is an advancement of the adoption of these types of technologies a little quicker than we probably thought would occur, because of the fact that everybody's shelter in place and staying away from the clinic, that these platforms are become a little bit more important, a little bit more essential. A lot of hospital systems are looking at a lot of different, but with new entrants into the space all at one time, a huge bolus of entrants. And so while solutions are improving and buyers are looking for solutions, now presents a new issue of how do we on all of these new platforms that may not have had a lot of history in the industry. And as a result, you've created new problems as opposed to not having enough solutions. Now you have too many solutions, and I mean, not necessarily having the right solution out there or the ability to determine what that is. Roger, you want to talk a little bit more about that as well as the legal issues?
Yeah, sure, happy to. I mean, as Jason says, I mean, with COVID, it really advanced a lot of, I guess, the trends that were starting really starting to gain traction in the last 3 to 5 years, right? The areas that we've seen have a lot of significant growth, and I think you touched on this, Roger, earlier, is AI machine learning as applied to the delivery of medicine and healthcare to the masses, right? Where basically they try to go ahead and use AI machine learning techniques and technologies to again to target medications and in a very specific way. It also affects how the discovery and repurposing of new drugs and existing drugs for different type of applications. So a lot of the the need for these new drugs as well as a result of COVID really drove a lot of that the developments on that side. The other areas that we're seeing that are growing as a result of COVID is really innovation in the telehealth and as well as the what term is virtual health space, different ways of again delivering medicine at a distance and not having to have patients show up in person. And lastly but not least, what's also related in that issue is the wearables devices, and for especially in its era of contact tracing. So you see wearables devices or mobile apps being used in that type of capacity around the world, actually. What's interesting, from a legal perspective right now is like traditionally as IP attorneys, we traditionally have always focused on patents, trademarks, and copyrights when we talk about protection of intellectual property assets. There's been a shift because the AI and machine learning has become more so pervasive in these spaces. Protection data right now is actually in a lot of ways even just as important, if not more important, than the underlying IP. So there's definitely we're involved in a lot of transactions where we represent either companies or healthcare systems that own a lot of data that collaborate with other solutions providers. So we make sure that they get the requisite data rights they need or retain the IP that is derived out of the data rights. So very interesting fields, a lot of developments.
Hey, Roger, before we leave you, I just got to ask, while I got you, is you authored an article, I think it's for Harvard Business Review, adopting AI in healthcare will be slow and difficult. And I have to ask what you meant by that. Doesn't sound very optimistic to me.
Yeah, I think that the title came out a lot more negative than it really should have been. Really, what we're trying to point out is there's a lot of different hurdles, right, in adopting AI machine learning in healthcare. I mean, the primary hurdle, honestly, is going to be around the regulatory pieces of it, right? How do you go as a construct? Machine learning AI innovation is meant to be a constantly moving construct. It's very dynamic, right? As data is fed into these systems, the inferences that these systems make are are improved. At least that's the idea. So those of you who kind of play in regulated space in FDA, the last thing the FDA likes is a software package. Let's say a software package that's used for let's use in radiology, right? To go ahead and to identify tumors in a CT scan. The last thing the FDA likes to deal with is software that kind of continuously changes or in the black box manner. So it's difficult because you're going to have to figure out how to go and regulate this dynamic nature of these products in that space when they're applied in the space, as well as you're going to have to be very defined, what I term as adoption constructs. How do you adopt these tools in a way that again doesn't put the patient at risk? So those are challenges. It is it takes time, and that's kind of really the idea behind that article.
I see. Okay, good. Well, I recommend everybody should read it who's interested in the space, especially the FDA compliance component of it. Virginia, I know you're chomping at the bit to tell us about how these companies are going to get funded so they can do all of these great things we've been hearing about. So maybe you could talk a little about, you're a corporate lawyer, you do financings all day, every day. Where can a health tech startup find some financing?
Right, Roger. So the trends nowadays are pretty much similar to what we can see for other tech startups. So mainly going and trying to get angel money, VC money, or corporate VC money. But there are a couple of hurdles and or pitfalls in this process for health tech for the health tech industry. Mainly we see that when companies go to the wrong type of angels or VCs, the ones that focus mainly on tech and do not really understand the heavily regulated area of the healthcare or generally the health tech industry. And just to give you an example that comes to mind that has happened recently, there was a company, Sherpa, that recently merged with Crossover Health. So Sherpa was an asynchronous care platform. And in the early days, they got funded by SoftBank. It was quite an interesting story to follow because basically the VC did not understand at all the health tech area and the life cycle of such a company. And therefore, there was a big misalignment between the company and the VC to such an extent that they actually fell apart. And Sherpa became a non-VC funded company before its acquisition. And so it's a cautionary tale. You can go and tap into the, the standard avenues for getting funding here in Silicon Valley, but you better watch out who your investors are. You just have to educate them in advance. The life cycle of a health tech company is not necessarily similar to the life cycle of a standard tech company. You might not get those returns in 5 to 10 years that a standard tech company might provide to an investor. So, and that is not to say that the investors won't want to invest in you just because you're a health tech company, but it's gonna, they will have the time to rearrange their strategy, to internally decide how to support best this type of company. Now, just to pick back at the panelist from the previous panel who said that he's expecting to see a little bit more of alternative funding avenues right now that we're in COVID times. So for instance, going and getting money from angels or from grants, I would add from strategic alliances. It is quite interesting to make this observation. There is quite a lot of success possible just with angel money, and the example that comes to mind, it might be a little bit outdated, but it does come to mind. It's a great example. Back in the late 90s, Arterial Vascular Engineering was a great company that sold to Medtronic, and they frankly got just angel money. Just there for them, and I think it's what one should take home from that example is that the angels were not your random angels. They were not unsophisticated investors, and more importantly, they were people from the same profession. They were all cardiologists and understood quite well the industry in which arterial vascular engineering was starting their growth. So they were able to actually not only support the company with money, but also with their expertise. So with just angel money, this company was then acquired by Medtronic, and I do not remember what the amount of return was. It was a crazy amount of return that they received on the money invested. So it's quite an interesting strategy to follow, provided that you know the individuals that you're going to tap into. Sorry.
You know, Virginia, we see that a lot, actually, and especially in medical tech and health tech, the medical device side. You know, I see so many affinity investors, doctors and physicians that say, geez, I could use that in my practice. I'll put some money into that to get it launched. It might not be a bad place for an early stage startup to start, right?
Well, absolutely. That's definitely a good strategy. And yet another strategy to follow, it is, you know, tapping into strategic alliances. And in health tech is a crossroad, is at the crossroad between health and tech. So there's a lot more possibilities here for intelligent strategic alliances, either with companies in the tech area or with companies in the healthcare area, to provide something of value to your both to your shareholders and to your clients. So that is another avenue that is interesting to explore, in my opinion.
Yeah, you know, this last panel also had an interesting comment about how, you know, the hospitals don't have a lot of money right now, so, you know, the market isn't that great. I can tell you from my standpoint, I've just been seeing a ton of new stuff over the last 2-3 months. Been seeing companies not only on vaccines and pharmaceuticals and stuff like that, not only the, you know, the equipment and masks and everything, but just new industries seem to have emerged, especially in telehealth. So in fact, we're seeing the timing is now right. I've seen companies that a year ago couldn't get a lot of interest. Now they're interesting because the market's changed so much. So I guess I'd like to ask you guys, Roger and Jason, I mean, this is your area. What are you seeing in the market? Because we're kind of at ground level, right? I mean, as soon as somebody gets an idea, they tend to call guys like you and say, we want to patent this, or we want to protect it, we want to trademark it before anybody else hears about it. So to the extent you can talk about trends that you're seeing without giving away any secrets, what's hot out there?
Yeah, I mean, what's hot about that? I mean, in the telehealth space, really anything that makes the interactions easy on the patient and the physician. Anything it's all about ease of use, right? And also transactionally, how do you, for example, even do something like prescribe medication? How do you do it, you know, and through cell phones? How do you do it through just an interaction on your computer terminal, right? Because as we all know, in those spaces, there are a lot of regulatory requirements related to it, and they're not designed to be done virtually or through telehealth. So you see a lot of different platforms are making improvements in that to make the transaction of healthcare being delivered on virtually or through the phone easier. So that is stuff that we've seen. The other thing that's happened is that, you know, again, this I'm going to go back to data. A lot of data is captured as far as a result of these virtual health and telehealth platforms. And slowly but surely, a lot of these companies are kind of getting wise that, hey, there's always got to be a data play, right? In our overall strategies, not just, for example, charging a monthly fee or use fee for the use of the service, but you want to have rights track the data that's going back and forth between the physician and the patient, and track outcomes. Because at some later point, the data can be repackaged and sold to pharmaceutical companies and other types of companies that are using that data for different purposes from a health perspective.
Roger, can you hear me?
Yeah, no, Jason, I think you're muted.
Yeah. Oh, how about
no,
now?
You're not muted. How about that? I can't hear you. Okay, go ahead.
Okay. I just wanted to add a couple of comments. I think in terms of trends, things that we're seeing, particularly in the remote patient monitoring aspect, I think it's any sort of platform that is going to allow folks to do what they could be doing in the hospital, do at home. You can say, like, does a patient want to go into the hospital to do a sleep study, or can they do a sleep study at home? Be able to do that. That would be something that's interesting. Mental health is another space. I think you were talking about, Roger, like last year, some companies couldn't get any money, and now all of a sudden it's interesting. Well, mental health is one of those. With a lot of the sheltering in place, folks are alone, particularly folks that may not be in a family or may not have a spouse or kids or something like that, and they're alone. Mental health has become an issue, depression and whatnot, and so mental health platforms through telehealth is another attractive investment opportunity. That being said, if anybody was at the Future of Healthcare conference last year, before all of this occurred, remote patient monitoring platforms were dominating the floor. So even before this happened, there were a lot of entrants into these spaces. They're only going to increase. So again, I think go back to the initial comments that I was making about the fact that it's not even the type of solutions that are out there, it's the sheer number of them that are out there, and how folks who are looking to partner up or to acquire some of these assets, how they're going to do diligence and understand the value of one versus the other.
Hey, Jason, while we're on this, you know, all these technologies that you're describing, I just got to ask, how important, I mean, I've heard you, Roger, talk a couple times about how important data is right now, but I don't think you can patent data. I don't know, but how important is patent protection, and how soon should a company get it when they have some of the telehealth technologies that you've been describing?
Well, I think obviously, depending on where you are from an investment standpoint, it's always very good to have an IP strategy. Whether or not that results in actual filings that need to occur at that time, but it depends on where you are in your product development cycle and how far along you are in innovating. But that being said, because there's so many entrants into these fields, and you know the entire world is a first to file system, the sooner you get your patents on file, the less likely you're going to run into issues down the road. All of these patent applications and patents become public, and now it's a race to see who had the earlier date. And so with early entrants, with a lot of entrants, IP protection can be valuable from being first in line, but also from an investment standpoint, to have an IP strategy in place for now and into the future is still very important. And protecting a lot of these technologies is still very possible under the case law. In fact, particularly on the software side, as case law has developed since 2014, there's been a lot more clarity as to what you can patent. There's more of a limited nature of what you can patent, but there's more clarity about what you can protect. And Roger and I often counsel a lot of clients on strategies as to what to patent, what to trade secret, in terms of getting that overlapping coverage.
How about the data? How does somebody, because what I'm hearing from this is that the data is so important now. How does somebody protect that, or can you?
Roger, please, man.
Yeah, well, usually it's in the construct again of how the data is shared, right? And when these companies accept data in, right, or they gather data, usually they're not the ones who are actually using it. They oftentimes collaborate, right, or enter into some sort of data sharing agreements with other third parties who are actually using their data in various ways. So the way you protect them is you protect them contractually. You have to spot the data in this space is kind of interesting. There's a lot of different forms of it, and it's used, and each of them kind of pose different types of unique challenges, right, so to speak, both from again an ownership perspective as well as privacy. And one thing that people have to understand about data, it's unlike it's exactly like every other type of intellectual property. Like, for example, when you license patents, you can go ahead and restrict them for field of use. You can restrict them on geographies of use. You can restrict them in all these different ways. You can do the same thing with data. You can carve it out that way. Hey, I will let you use my data for use in discovering drugs in oncology. I'll let you use my data for use in products that are sold in certain geographies. It's really the same. You don't file on it, but you protect it from perspective of when you do release it to third parties for use. You bind them contractually in how it's used, and also bind them from a perspective of any type of patent rights that arise from the use of that data. You can also get a license to that as well, or ownership of that as well.
Sounds a lot like trade secret.
It is sort of in a lot of different ways. It is, but in trade secret you don't actually transfer anything, so to speak. In data, you're actually transferring your data to someone else to use. It's a little so it's got a lot of the same concepts. You have to protect. You have to obviously protect the data, keep it confidential, and just like trade secrets, if you release it or you don't take the active measures to keep it protected, it ends up you end up losing protection over it, right? Very similar idea.
So I asked Jason about patent protection. I'm going to ask you, how important is it for a company to have patent? When Hunniwell Lake Ventures comes to look at your company and they want to make an investment, how important is it to a company's valuation to have patents?
It depends on the business model. right? I mean, and I'll you know, if your business model is just to get subscribers to adopt something, right? And really your value is really in the number of subscribers, the number of users of your platform. That's your value. Then I don't know, not saying the patents are not important, but that's really not the driver, right? But if you're a device, your software package that does something, or your reagent, molecular diagnostic, et cetera, the value is in the IP. If you can't protect the IP the IP that's underlying your platform, device, or otherwise, basically your value to an investor is kind of null in a lot of ways. When I was in-house at Thermo Fisher for almost 8 years. So I've probably gone through, I'd say during my career, about maybe 20, 30 deals in terms of vetting it out from an IT perspective for diligence, right? What I looked at, and we do the same thing, Jason and I right now for our clients, is that we do two things when we do diligence. One, we look at the portfolio, and not the IP portfolio of the target company, not just for, you know, I think a lot of firms, what they do is you just trace down the assignment to make sure everything's assigned properly. In other words, very formalities driven. We don't do that. When we looked at IP, especially on the biotech side, we look at the claims to make sure it covers the core technology that is of value to the investor, right? If you're a device company, you could have 50 patents covering orthogonal technologies. It means nothing to you, right? I mean, to the investor. But if there is one particular patent family that claims their issue, that covers exactly the platform that is really the driver behind the transaction, that's what you look at, right? So that's what the things that we look through. So when we build out, conversely, when we help our startup clients and our emerging company clients, build out portfolios, we're not about numbers. We're not about how many funds. How many funds you are is good. It's good to unsophisticated investors. Sophisticated investors are looking in this space, understand the space. They'll ask you, what does your IP cover? And that's more important. Yeah.
Interesting. Well, speaking of investors, Virginia looks so lonely way over there in the upper left-hand corner of my screen. I want to come back to you for a minute. You know, we've moderated 3 panels of venture capitalists and investors for the F50 Global Summit this time around, elevating health tech innovation. And I got their perspectives on the investment climate. And one of the things I've been hearing about people talk a lot about is valuation and terms and what we're seeing now and what we expect to see. And I've kind of heard them all over the map. I've heard some people say that they expect valuations to plummet, so they're just going to wait. I've heard some investors say they're just going to go ahead and close their deals, and now's a good time because there are new opportunities. So in your practice, what are you seeing about both valuations and terms? And let me add one more thing to that. And I hate to keep raising this, but I can't help it. Are we going to go back to 2008 because of what's happening in the world? Because those were truly ugly times for a startup company lawyer being on the startup side, and not so much fun if you're on the investor side either, to be honest, in the later rounds. So what do you think, Virginia?
Right. You know, it's these are interesting times for so many reasons. One interesting thing that transpired, and I believe it was published in TechCrunch either today or a few days ago, it is the fact that we're not seeing as many down rounds as people initially thought there's going to be, which is a good thing, but does not predict what's going to happen necessarily in the next 6 months to a year to 18 months, right? In my practice, I'm lucky to see our clients not coming for down rounds, and it's a good thing. However, it is really important now at this moment when the numbers are good to actually look into what a down round could look like for your company or for the company of a client, and just anticipate if this is a reality that they will face or not. It's just one of those things that it's better to prevent than to be sorry about. And that's where I believe the alternative rounds for funding could be something that has a meaning to people right now. Yes, go after that VC funding if this is what if this is what you started. And I believe that VCs also don't necessarily want to kind of rush into deals right now, but they still want to support their companies. At the same time, if you have the opportunity to think long-term and to think strategic, then definitely consider partnerships with other companies, or licensing your technology, or trying to figure out a way that provides or brings money in, right? For the company to survive not only today, in the next 6 months, but also long term. And I think that's what I've been seeing people trying to do. So it's a lot of, okay, let's start closing the deals because it's hard times. We don't know what's going to happen tomorrow. And at the same time, trying to look forward for a long-term type of solution to overcome this difficult times, uncertain times, I'd say.
Okay, thanks. We just did a week or two ago on the Haynes and Boone platform, a presentation, an hour and a half, on doing business in a downturn for startups. And really, it's good, bad, and ugly. I mean, there are some good parts. If you're in the right business, the kind that Roger and Jason have been talking about, this might be a great time to start a company, right? You might be in the right place at the right time. Your time has finally come. Or you might be a kind of company that can get that alternative funding that Virginia is talking about, government loans, government grants. People, I don't think, pay enough attention to all the grant money that's available out there. But a big part of the presentation was focusing on existing companies, what to do to prepare for what we expect is coming in the economy, and how to protect yourselves, how to protect the company, preserve its relationships, and for God's sakes, not incur personal liability for doing anything, because that's where I see companies mess up, is they panic and they do something dumb that they probably wouldn't have had to do. So, so keep that in mind, and that content is available. We've got a few minutes here left. So I think what I'd like to do is, I'm not sure I covered all the things everybody wanted to talk about. So around the table, I'm going to let each of you sort of sum up digital health, technology and healthcare, where you think you are, what you think the immediate future will be like. And we're going to start on the far right hand of my screen with you, Jason. Go ahead, let us know.
Yeah, real quick, I wanted to make one comment on what Virginia said about what she's observing, and I've been observing the same thing as well. Is in this downturn, companies are moving towards trying to close deals, close partnerships instead of trying to close rounds, and I think it's sort of reversed the order of operations and establishing a proof of concept for your product by striking these deals. And it allows for more of an easy process for getting the rounds closed, because you can have 2 or 3 deals under your belt. I think it really helps. So I think I've seen that focus. So I just want to overall, when it comes to digital health, I think the point that I would leave is that it's more important now than ever, because you may have to go through a little bit more aggressive diligence with investors, is to have an IP strategy. It isn't necessarily, like Roger said, to have filings per se, because it may not make any sense, but having an IP strategy that even includes budgeting and planning out 18, 24 months will show the investors that you are serious about it, that you're spending your money wisely in the innovations that you should be protecting, that you're making decisions with your counsel such that you are not burning through your cash, that you're making the right decisions, but also that you're not spending money just to spend money, that you maybe have a strategy that requires you to file maybe 6-9 months from now, but at least you've had that discussion. I think the strategy rather than the numbers are what's going to be the most important thing when it comes to IP.
Okay, thank you. Roger, anything to add in closing?
I think we live in some amazing times. I mean, not just because of what's happened with COVID in the last 6 months, but also live in a time where there's this unique convergence of tech with traditional healthcare, and how that's all melding all together right now. Companies that are going to be successful in the digital health precision medicine space are really, and then this is touched on by some of the panelists earlier on, the investor panelists, really have to get their house in order early. What I mean by that is, like, you have to address things, not just IP, but you got to address your reimbursement strategy. You have to address your data rights, data privacy strategy. You have to go ahead and get your FDA regulatory strategy all in place. Those things have to, they're not something that can go sequential. Ideally, you have a map. You have an idea how you, 3 to 5 years from now, how you're going to approach each of those, addressing each of those topics. And to go ahead and do it early really does two things. One, it sets you up for success, especially with, I'm going to go back again, sophisticated investors. Sophisticated investors spot that stuff very quickly, and that's what we've noticed. And also, it reduces the amount of remediation that you have to do later on, because it's not just a monetary cost, it's a time cost. And that's in tech businesses, as we all know, time is everything. If you slow the market by a year, you lose a potential lead to be first to market, et cetera. So these things are all important to kind of, again, strategize early.
Okay, thanks very much. Virginia, it looks like you're going to have the last word here.
Right. So I will just add to what my colleagues said in terms of strategy. I think it's very important at this time to really scrutinize the investors that you're going to bring in, the advisors that you're bringing in, the type of employees that you're bringing in to your company. It's really, really important to have, your stock is very valuable, and in that way, you don't want to spread it to individuals that are not bringing value to your company. By having knowledgeable investors, angels, advisors, employees, that's what will make your company grow. Ideally, those individuals will be also the early adopters of your technology and will be the ones who will come in with connections, either connections to the market, connections to your customers, connections to other investors. It's really important in these times because again, it's a time of uncertainty. It's not a time when you can really dwell and just take your time to see who is working and who's not working. Scrutinize those individuals or those companies in advance. Have a process of decision-making in advance and see how they fit within your long-term strategy, not just in the next 6 months. So that's my last word here.
All right, well, I've heard that word strategy come up over and over again among all the speakers, and business strategy as well as legal strategy. I want to thank our panelists, 3 lawyers, corporate and intellectual property from the law firm of Haynes and Boone. I'm Roger Royce, and I'm going to turn it on back to you, Nikolai.
Roger and the team, Virginia, Roger, Jason, thank you so much for the wonderful talk. It was very interesting to hear the perspective from the legal side. And as of today, we've heard attorneys, scientists, venture capitalists, investors. So now we're going to have a short break, 15 minutes break before we start the afternoon discussions. And later afternoon, we'll hear some additional venture capitalists, angel investors, and we'll discuss on the investment trends, some PE from private equity perspective, AI in health tech, angel network roundtable, and followed by the virtual reception for our guests. So please stay in touch, follow us on the LinkedIn and YouTube channels, and hopefully you enjoy the conversation as I am. One more time, thank you to everyone, and we'll have a short break and we'll be back in 15 minutes.
introduction. Many here in Silicon Valley, but participants from around the world in Europe, in India, and in China. I think you'll find it very, very interesting, but also very inspiring to see what innovation can be brought to bear to address these challenges and also these opportunities. We look forward to seeing you on June 16 and 17 and believe that you will find it to be a very worthwhile investment of your time and that you will take away a lot of information and a lot of insight about where we are going in the future together around global health and COVID-19.
Hi, I'm Daniel Teo, Managing Partner for Hunniwell Lake Ventures, and I'd like to invite you to the F50 Global Capital Summit to be held online June 16th and 17th, where Hunniwell is also the sponsor for the medical device track and the Hunniwell Networking Lounge. The organizers at F50 have carefully curated a rich collection of content from over 80 speakers and panelists covering various topics in healthcare, including AI, telemedicine, life sciences, global economics, COVID-19, and of course, medical devices. Hunniwell Managing Partner Richard Fang will be a keynote speaker discussing the future of surgeries, while I will be honoring how the medical device industry has come together during these difficult times. During the summit, we will be launching the Hunniwell Index of Startups in the Fight Against COVID. We will also be publishing a current list of grants all over the world to help startups find funding and to accelerate the development of COVID-related solutions. Other members of the Hunniwell team will be chairing various panels, discussions, or judging the pitch competitions. We will also be hosting a networking lounge so that from even thousands of miles away, you could have an opportunity to meet, to exchange ideas in small virtual breakout rooms with entrepreneurs, subject matter experts, investors, and fellow practitioners, all of whom share a common passion for medical devices, and in particular, intelligent surgery. Meet new people, generate new ideas, create new opportunities. Please visit either the F50 website or the Hunniwell website for more registration details. We look forward to seeing you June 16th and 17th. Thank you.
It is a pleasure to welcome you back to this afternoon, the second day of the event. Hello again, and a warm welcome to everybody around the globe who are joining us today. For everybody, feel free to connect to all the speakers and organizers and the co-host on LinkedIn. Join them on LinkedIn. All pages are available. And also to subscribe. This is a recorded session. I will be made available on YouTube, so please subscribe to YouTube and like the video as well. It will give us more attendees. And please feel free to share to social media. This afternoon is very busy with a set of amazing roundtables, starting from entrepreneurships and entrepreneurial initiatives in life sciences, in artificial intelligence related to health, all the way to investments from angels and super angels. So I hope you will enjoy all the panels. This will be 4 roundtables that are each half an hour. And we will start in just a few minutes. For the first roundtable, we will have a wonderful moderator. Her name is Stephanie Marrus, and she is the director of the Entrepreneurship Center at the University of California, Irvine, San Francisco. Stephanie has built an extensive program with an unbelievable mission to build the university's entrepreneurial ecosystem and to start companies from UCSF technologies. In just the last 7 years, under her leadership, 37 stage venture participants have raised over $300 million. Besides being a mentor and advisor at UCSF, Stephanie Marrus teaches, speaks, and consults all around the globe. And she serves the US State Department by speaking at the Global Innovation in Science and Technology program. Today, she will moderate a panel on the joys of challenges of starting a life science and healthcare business.
Hello, everybody. Welcome back from lunch or whatever you had. I'm very pleased to be kicking off the afternoon session here at F50 with three of my favorite entrepreneurs. Let me just tell you a little bit about them. And also, I think that we're just going to put up a slide or two to talk about my global class. There it is. Great. So before I introduce my entrepreneurs, I want to tell you about a class that I'm starting, which is a global online version of a class we've done at UCSF that has produced some very successful startups. So this will be a master class coming direct from Silicon Valley. We're going to have about 20 Silicon Valley guest lecturers who are everybody from investors to CEOs to entrepreneurs and serial entrepreneurs. And please pre-register for it here. You can get more information about it at this link. Our pre-registration deadline is this week, and we hope you can join us. So thank you for paying attention to that. And let me now talk about my panel. I'll mention each entrepreneur briefly, and then they're going to have a chance to talk about their company. So Yug Varma, who is at least on the right side of my screen at the moment, is the CEO of Phi Therapeutics. And he was a postdoc at UCSF, which is where I met him. He holds a PhD from Johns Hopkins in bioorganic chemistry. And because this is going to India as well, I'll mention he went to IIT Bombay, Mumbai, before that. So Yug had founded Phi out of my class in 2016 and has reached some new milestones. So we'll hear from him in a little bit. Second is Christy Sheehy, who is, you probably should unmute Christy because you're going to be on pretty soon. Christy is CEO and founder of, just something blanked on the name, fill me in here, Sea Light Technologies. That's what the afternoon does to you. She founded the company in 2014, so she's been working on it for 6 years, and she postdoced at UCSF in the Department of Neurology. She has a PhD from UC Berkeley in vision science, and she was also in the UC Berkeley Skydeck Accelerator. So we'll hear from her about what she's doing. And then Sangeeta Agarwal. Sangeeta, also a 2016 graduate of my class. She was a cancer nurse at UCSF, I think still is, Osher Center, and also at Stanford and Mayo. So she pretty much toured all the top medical institutions in the country as a cancer nurse. And because of that, she came up with the idea for Help See Health. She took a class that I used to teach called Lean Launchpad, which is part of the I-Corps, NSF I-Corps program, where she did 100 interviews in her target market before she was allowed to graduate from class. So we'll hear from all three of these entrepreneurs. And I want to start by asking them to just describe the company and what they're doing. And I think I'm going to start with Yug.
All right, thanks, Stephanie, for the generous introduction. Always great to see you again and see all the other people I recognize on the screen. Phi Therapeutics is a microbiome startup that's trying to change the way we treat chronic microbial diseases. So the microbiome is this new sort of forgotten organ in our body, which is essentially this microbial community of bacteria, viruses, and fungi that kind of coat our body inside and out. And they actually play a very important role in our health. Which is something that recent research has uncovered. And with chronic diseases, the treatment is usually antibiotics. And the one way to think about it is, if you go into your garden one day and you find a weed in your lawn, what are you going to do? Are you going to pour gasoline all over your lawn and set it on fire just to get rid of the weed? No, of course not, because but that's what you're doing to your microbiome every time you use antibiotics. And so is there a better way? If, like in your garden, you just scoop up the weed and replace it with a patch of grass, can you just kill the bad bacteria without affecting the good bacteria? And so our startup has the technology that actually does that. It kills only the bad bacteria causing the disease without affecting all the good bacteria, which helps build a sort of more resilient community. Our initial focus is skin diseases, and we focused on acne and eczema. And my company has been proud to launch our first acne product based on this technology, and we're a little over a month old.
And that was a huge milestone to be able to actually launch not only a product, but a consumer product, because it's going to be sold direct to consumers for acne. And here's your PhD scientist who's learned consumer marketing. And I'm not sure you like it, Yuk, or you do like it.
I like learning new things, and I'm actually I like it once I figured it out.
Yeah, okay, that's great. Well, maybe you'll share a screenshot of your product later on so people with acne can order. Christy, how about you next?
Hi, everyone. I'm Christy. I'm the CEO and co-founder of Sealight Technologies. Thank you so much for having me here on the panel today. Sealight is a neurotech and AI company. So we take a 10-second retinal eye tracking scan, and we use that to assess brain health and therapeutic efficacy. And so many of us here on the call have a loved one with neurological disease, a colleague, a friend. They affect roughly 1/6 of our world's population. And so even with such a high impact globally, there are still minimal to no viable therapeutics in this space. And this is really due to a lack of biomarkers that allow drug developers to effectively produce and assess these drugs. And so that's what Sealight's focus is, being able to provide an objective fingerprint of neurological health to allow for effective drug development, patient stratification, and even competitive advantage testing. And so we were lucky enough to be also a part of Stephanie's class, where we performed many customer interviews to really understand our market fit. And we've sold research grade devices thus far and are currently in our seed round fundraise.
Great. Thanks, Christy. Okay, Sangeeta.
Yeah, thank you so much, Stephanie, for this opportunity. Hi, everyone. Pleasure to be here with you. I was really grateful to be in Stephanie's class. As a technologist and as a clinician, I thought when I did research and I saw the problem in the market, I thought I knew how to solve it. But only after I took the Lean Launchpad class, I realized how much more I needed to learn on the business model side and truly understand the market and the needs of the individual. So really grateful for that class. In fact, in the class, we ended up doing 300 interviews and building the prototype product, and 2 other groups moved in the same direction, and we ended up acquiring them after the class ended. So there was a bit of M&A after that. So really fortunate to have been part of Stephanie's class and her guidance and mentorship throughout. The main challenge that we face in healthcare today is that it's really good that a lot of care is moving outpatient so that people can be at home when they care for themselves, but that brings a lot of challenges with it. As we know, many people are struggling with multiple comorbidities, many health issues, or sometimes they're going through health problems that are very complicated and require a lot of learning, like cancer, cardiac disease, stroke, etc. And that's a significant percentage of our population that goes through it. And what happens is when they are at home, they're really terrified on what can happen to them. And in fact, 90% of people who go through these conditions do have 1 to 3 treatment disruptions, and about half of the people going through these critical conditions end up going bankrupt. So their fears are very valid. They're going through suffering. But the thing is, those suffering could actually be prevented if we could give them the right guidance and support throughout the journey. But that means everyone would need a full care team that's by their side all the time, which is not really practical. So when I saw these challenges, I literally started to clone my brain as a nurse onto a solution so I could always be by their side, no matter what time they needed something or when they needed it. And then over time, I was very fortunate that we were able to clone brains and knowledge of over 60 to 100 different healthcare professionals, so that we have all that knowledge engine that's available to each individual, like an entire care team that's by their side in their pocket all the time. So the core of what we do is we are a cloud-based platform. It's an AI, artificial intelligence engine that automatically, based on a person's health issues and the treatments they're getting, automatically anticipates the side effects and the frequency and the time of those side effects, their physical needs, emotional needs, and social determinant of health needs, and automatically creates a care plan to support that individual in a personalized way and their family member, and then continues to support them throughout the journey with the AI nurse that is guiding them and supporting them throughout the care and anticipating their needs, engaging them, doing real-time management, as well as escalating the care to healthcare professionals when needed. So it transitions between high tech and high touch. And by doing all of this, we are able to significantly reduce those problems that people face, the suffering that could be avoided, which was the goal and the mission in starting this company. We are able to reduce that. And the outcome of that is that it ends up saving a lot of money for the insurance and for the employers, and gives good outcomes, and for the individuals. So those end up becoming our customers. We also have a COVID solution in the market that is addressing similar issues for COVID, as well as behavioral and mental health, and for return to work. So we have won a lot of awards in this area and have some top partners in the country working with us to serve the community, as well as state contracts related to these topics.
Great. So, so what these three entrepreneurs have in common, they have a lot that's different. Christy's working on a device diagnostic, Sangeeta has a digital health solution, and Yug has a consumer product based on heavy science. So really different types of companies, but what they have in common, and why I asked them to this panel, is they're real entrepreneurs. And that means that they haven't been doing this for 3 months. They've been doing this for years, and they've had some really hard times and then some really fun times. And I've asked them to tell a little bit about their stories, and maybe focusing first on what they like about being an entrepreneur, and then maybe a story about what was hard and how they overcame it. Because I think our audience today is meant to be entrepreneurs, and so they can learn from this. So who wants to start? Okay, I'll call on someone. Christy has the biggest smile, so go ahead, Christy, you're on.
Yeah, so being an entrepreneur, one thing that I love about it is that we can follow our passions. And so many of us get into this space because we have found an unmet need that we are extremely passionate about personally and professionally. And so for me, for neurological health and neurodegeneration, it's definitely been an issue we've had in my own family. And so being able to look for solutions, being able to talk to, cutting edge physicians and therapeutic developers, it has helped to really drive home that passion I have to solve this problem for the world and for my family. And, another area that I love being an entrepreneur is that we really get to create our own day, our own week, our own year in what milestones we need to meet. And so being able to be your own boss it's always something great. That being said, you need to have self-motivation and perseverance and just inner strength. And as Stephanie mentioned, many of the hard times as well, but being able to go after your passions and to do so in a way that you choose is very rewarding.
So just a couple of comments on that. This issue of having particular disease states in your family, very common theme for entrepreneurs, right? People want to solve a problem for themselves or for a family member. So that's a really great motivation to have, and I'm sure one that keeps you going in some of the harder times. The idea of creating your own day, there is definitely an entrepreneurial mindset. And Christy has it, everyone on the panel has it, but that mindset is, I don't want structure, I don't want someone to tell me what to do, I'm gonna figure it out and I'm gonna make it happen. And that's what Christy was talking about, creating a day. So thanks for the lessons. You wanna speak next?
Yeah, I'll say one thing about what I like for myself and what I like for others. What I like for myself is, I love learning new things. And so just this past week, there was a day where I went in early. I went into the lab. I got an experiment started and I was working on that over 6 hours, took a couple of calls, just, pretty boilerplate logistical stuff. Went on our back-end website, looked at a couple of things. I was doing some homework for some marketing stuff that we had to do. And, all in a day's work, that all needs to get done. And it's a lot on your plate, but it doesn't really seem like work to me because I just want to be there and I want to do it. But whether it's science or marketing or, technical things on the website or, learning just how things work is something that I love. What I like for others is I was always frustrated as a researcher where I'd read and be very fascinated by a lot of technology and findings that were coming out, amazing papers publishing breakthroughs, right? Figuring out this is a new way to look at a disease or look at, a paradigm. And after that publication, you just wouldn't hear about it at all because academia moves on and it's actually legitimately hard to convert science into technology. We always think of them as mutual, but a scientific finding has many, many, many miles to go before it becomes a technological product. And so it always frustrated me that there were all these beautiful indications that you had of amazing scientific ideas that could become technology, but they just disappeared. And so instead of expecting others to do it, I decided to do it myself. And I took an idea that's been around for 100 years. I think it's probably the oldest biotechnological idea there is. And I try to basically make it a reality. And I think now that we've launched, we get external feedback where we see people coming to us saying, I've tried this for my acne, that for my acne, this is how my skin looks now. I'm, frustrated, I'm humiliated by all these false dawns, and we're able to give them an option that doesn't suck. So.
Now, you started doing acne for the science, not because it was a family problem, different motivation?
That's correct. But my co-founder actually has suffered for acne for all her adult life. And she took many rounds of Accutane, which is a very harsh drug, although it seems to work. It's the best tool we have against acne right now. But it gave her lasting gut issues and some liver damage. And I mean, that's kind of par for the course, unfortunately. So we're all about giving people a better option.
So there's a personal connection for you as well.
Yeah, I mean, not so much. I think for me, the drive is more the technology.
Okay, great. And I like when you talk about doing everything. People who come from big companies don't know what that's like, right? They do their little job and they hand it off to somebody, and maybe IT helps them with something and maybe an admin. But when you're an entrepreneur, there is no one else really. You got to do it all. So that's your experience.
Yeah, a lot has to be done, and it has to be done incredibly fast.
Yeah, which means you cannot be an academe. Sangeeta, speak to me.
Yeah, I think I relate so much to what Christy and Yug were saying. Christy talked about like working on something that's your passion, and Yug talked about seeing research, and then that's the end of that research. And I strongly resonate with both of those. And the core of what we offer at HelpC is essentially a whole health approach to healthcare, which is evidence-based and leverages a lot of integrative medicine modalities, everything from nutrition, yoga, exercise, mindfulness, so the entire spectrum of healthcare. And what was joyful and at the same time frustrating to me was that growing up in a traditional medicine environment where I came from, Ayurveda and yoga, where my grandfather was a renowned Vaidya, a renowned doctor in that space, I saw the value and the impact of that, and I lived with that. And at the same time, I was working in healthcare setting where we constantly are talking about how difficult it is for having good outcomes in healthcare, especially as it relates to behavioral health. And we talk about, you know, medication adherence is like less than 30% of patients are adherent, and so many diseases are challenging because of adherence and because of support. And at the same time, when we look at research, what I was seeing is that we were having such good outcomes when it came to integrative medicine. And as you know, I was at Couchair Center for Integrative Medicine and doing work there. Like, it is so effective, but then that was never getting translated into practice to millions of people who are in need. And I was seeing that suffering in the clinical practice, but I was seeing great results on the research side. So I really wanted to bring that to the community, translating that research into practice and into technology solutions that could be available to anybody and everybody at the touch of a button. You know, if they have the phone with them, they have the answer right there. And that's how I believe it should be. So that's kind of what drove the motivation for me, is translating that research to practice and bringing it to a larger community and being able to make a difference in lives of the very people I saw suffering. I mean, with you know, as a cancer nurse, I saw a lot of death and dying, and I saw a lot of people going bankrupt. What hurt me most was not the ones that we knew we had no option to cure, but the ones where we had hope, we had a possible path, but they still lost their life, or they still lost all their savings because of preventable complications. And that's what I wanted to address. So that's where my passion for this comes from, is being able to prevent problems that could be prevented. And it's truly a joy to be able to see that I could make a difference in that capacity, and having so many patient advocates and people who have worked in this space guide and support us on this journey. It's truly a movement. It's a community from the very beginning. You know, doing the Lean Launchpad and the work we were doing before, we ended up having hundreds of people who were involved with us, and we've carried many of them along 5 years in, and they're still part of the journey and they're still contributing. And that's truly an honor to have that community backing this whole effort, and a movement that is truly changing the way we look at healthcare and the way we provide support and actionable hope to individuals. So that's what I'm passionate about, and why I love being at HelpC and doing what we do. And I love the people. I love meeting so many amazing people, hearing their stories, and working with them in a way that makes a difference, that makes our world better. And we are working together on doing something that's positive. So I absolutely love that. I think one interesting thing that Christy mentioned, and I would say the flip side of this is interesting, is you learn to about discipline. Because yes, you have complete freedom to plan your day, but you also are the one who's responsible for doing everything and doing it very, very fast, and things you don't know. So having discipline in your day and in your schedule becomes very, very important, because you know there is nobody else you can blame other than yourself. Right. And at the same time, you need to be compassionate to yourself. So learning to be compassionate to yourself, learning quickly, and being disciplined is really important. And that's something I learned being an entrepreneur.
So we'll call that one of the challenges, is
Yeah.
you have endless time, but then what do you do with it and how do you make progress?
Mhm.
So I love the passion that you have, Sangeeta, and everyone else has. That's what makes a life science healthcare startup special. Because I never meet anybody who's doing one of these startups who said, I'm in it for the money. Nobody is, it's not tech, it's something different. People really want to change the world and make it better. And it's just so impressive. And I'm fortunate to have seen so many teams and startups going through my programs. And I'd say every one of them has some sort of passion to do this. I'm just, since Lean Launchpad has been mentioned a couple of times, I'll just explain for people in the audience who don't know what that is. It's a course that we used to teach at UCSF, which is totally based on interviews in the marketplace that you think you're going to address. And the purpose of it is to find out if the idea you have actually is perceived to have value by the buyers out there. And in our case, buyers are often not the consumer, not the doctor, but the insurer. And so we teach our students to go out and talk to all these people and find out what are their problems, what's their day like, how, what are their needs, and then try to figure out if the thing they have in mind fits into what their problems are. So that's Lean Launchpad. Christy, I want you to tell your story. You know what story I'm going to ask for, right? What you did when you didn't really have enough money to keep on one of your team members, co-founder, right? Zach's co-founder.
Right. Yeah. So kind of just in the same respect that Stephanie was talking about, where many people have this perception that as a startup entrepreneur, you're rich. But for us, we have to typically prove our validity before any other investment. And so there's a lot of experiments and science that needs to go on very early on in order to prove that you're worth buying. And so in the early stages of our company, we were very fortunate to have NIH grants that allowed us to do a lot of that early on development. But as soon as those NIH grants ended and right before we got our next investment, we were in a space where we were coming very low on cash flow and not sure what to do for salary for the employees internally. And so this is one of those times when you have to become very resourceful. What can I do to bring in revenue for the company? How can I self-generate this revenue and bootstrap? And so we decided at that point that we would create a research grade device and sell it to a university for pure research purposes, which isn't our go-to market, but it allows you to have an early stage prototype device be bought. And so we ended up selling a device for about $80,000 to the University of Houston. And that allowed me to have a salary and runway for my team that otherwise wouldn't have happened. And that almost that perfect amount got us to our Skydeck accelerator money, as well as some other smaller VC investments through Dorm Room Fund and Aero Capital, which are micro VCs on the Berkeley campus. And so it was very serendipitous to sell that device at that time and be able to carry the team through. But it takes a lot of work and being sure that you can take care of your team. And so that's just one way in which I made sure we could still hang on.
I thought that was a wonderfully creative solution to the problem. I was very impressed by that. I know everybody's had difficulty at some point raising money and keeping going because it's not easy in our business in life science and healthcare. You'll maybe just very quickly talk about the sort of your journey through that and how, you're now in a pretty good spot. So how did that happen? How did you turn it around?
Yeah, I mean, we were very fortunate as well, because when I was a postdoc and we had generated all this data independently, I was working nights and weekends. We wrote a grant for NIH funding, and the first grant that we wrote got funded, which we were very, very lucky to get. And that enabled us to get to it. But, at some point that runs out, and especially with research, you have to put all of your money into research. So after that, we spent some time with industry collaborations and just trying to eke our way forward. But there were a lot of sacrifices made along the way. I mean, I remember one time when it was basically rent was due. We hadn't been paying ourselves. We've been doing research based on stuff that we had in the lab, but rent was due on Monday. And that Friday, I was at a healthcare conference and I decided to enter a pitch competition. And it just so happened that the exact amount of the first prize in the pitch competition was the exact amount of rent. And so I remember thinking, it'd been a hard few weeks. And I remember going in there thinking, look, I got literally nothing to lose, because if I don't win this, I don't have the money to pay rent, and maybe that's it. We pack up and we move on. And so I entered the competition. I think it was kind of freeing not to have any pressure that way, although it's almost the most pressure you could possibly have. But we won the pitch competition. I got literally a giant check, which also translated to real money. And we were able to pay our bills on time, and we never looked back.
Yeah, that's such a cool story. I can't imagine the pressure you would have felt going up on that stage to pitch and knowing it was life or death for your company.
Yeah, I don't know. I think it was the adrenaline, but I remember feeling very clear-headed.
Well, good job. Sangeeta, you've been working the partnership side of things. Just give us a few words about what that's like. Does it take a long time? Is it easy to engage them? What can bring you over the finish line?
Yeah, so thank you, Stephanie. Yeah, so it's been an interesting journey working on partnerships. Business partnerships take a long time. The cycle, assuming everything goes well, is anything between 6 months to a year and a half. So as a startup, you have to keep working and surviving through that. And at each stage, there is a chance that everything will come apart because there will be more people involved, there'll be more directions, more angles. So there is always that risk throughout this that at any point this can fall apart after you put in 9 months of effort or a year of effort. What I've seen happen, some positive and some challenging scenarios, is that when I worked on some partnerships that didn't work out in the end, part of it was related to while this was very important to the organization and from their marketing standpoint as being, patient-centered or whatever, it actually was not their top 3 business priority, which meant that I was trying too hard and things would always get slid to the backdrop. So that was one challenge I faced, and I learned from that I need to understand really the intrinsic and the extrinsic motivation of the organization and what their top priorities are.
Secondly, I think you said something very important there that I would like to emphasize. So you have to understand the needs of your customer. In that case, it would be the partner as opposed to a buyer. But if you don't understand it and you're pitching them, you're not going to hit the mark. So it's more of this customer discovery activity. Go out and talk to the marketplace, whatever that is, and then figure it out from there. I'm going to cut you off here because I think we only have a few more minutes.
Okay.
But I just want to ask the panel, in case there are some investors who are tuning in, is anyone here interested in money? No, I'm just kidding. Yes, we're all. Yeah, but seriously, if there's anyone who, please raise your hand if you think you could utilize a little extra infusion, and therefore an investor might want to get in touch with you and learn more about what you're doing. Christy, okay, everyone but Yug, okay. Yug, you're going to count on the, Yug needs product sales right now, so
Yeah,
look up his line.
That's how you fund us.
But so if anyone on this call would like to get in touch with one of our entrepreneurs, you can get in touch with me through the conference and be happy to put you in touch with them. Just to summarize, the things that I heard today and that I know about these people I've known now for years is there's great passion. People are pursuing something that really matters to them, and that's what keeps them going through the hard times, which inevitably, there are the joys, but there are inevitably challenges when you're doing a startup, and it's a long road. This is 4 to 6 years in this crowd have been working on their startups and now seeing some success, so it's great. A second thing I heard was, you know, you're gonna have to do everything. You don't have a lot of help. You have to learn new things all the time, and you have to do things you've never done before, and you have to make them happen fast. This is not an academic timeline. One of the things I teach, and when I teach at UCSF, is, you know, you guys who think you're going to be able to get to proof of concept in 3 years, forget it. Nobody's going to be interested. Let's see what you can do in 6 months, because this market moves fast. So quick timeline, do everything. And then the third thing to bring out is how resourceful you have to be as an entrepreneur. I mean, you never have all the resources that you need, whether it's money, whether it's team, whether it's a facility, whatever it is, you're gonna have to go figure it out. And I love Christy's story because that's a perfect example of resourcefulness. But everybody here has been resourceful when things haven't gone well, which always happens in a startup. They've just figured out how to get over the bumps, and they haven't had people who made that go away for them. They had to make it happen themselves. So I want to congratulate 3 of you for having achieved as much as you have in this time frame, and for sharing your stories. And I'll turn that back over to whoever is moderating from F50. Thank you, guys.
Thank you.
Thank you.
Thank you.
Hello. I actually want to add one fourth point. How important is to have a mentor who walks you all the way from the very beginning and knows your story and cheers for you and is there for you to hold your hand and help you troubleshoot all along the way. So we've heard from Stephanie today about how in depth she knows everybody's stories and how she has been handling all this all along the way. So people have actually a reference point. What we're looking at is 3 very young entrepreneurs would come in with a passion from a heart, but having years and years and years of wisdom and experiencing in mentoring them is just equally important. So number 4, and maybe this is number 1, find the right mentor. And so please, thank you again, everybody on the panel. Good luck to the very young entrepreneurs. Many, 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 many thank yous from me personally. I'm very impressed to hear these talks, and also to realize the breadth and depth of mentoring that goes into these programs. So many thanks to Stephanie for not just coordinating this and moderating and putting together this amazing panel, but also for all the work all along the years that makes such a huge difference in the world and enables these young people to really bring something that they have and show it in the world. And it shows us that big companies have a role, but the individual in the society has a role as well.
Thank you for the comment. It's very apropos because mentorship is so important to all these companies. I feel very passionate about trying to help my companies. And it's because we've heard in other panels that people invest in the team. I invest in these entrepreneurs. I have a certain amount of time. I have a lot of entrepreneurs out there, and I choose the ones that I think have the passion and are going to be able to make something happen and make a difference in the world. So that was a really, really excellent point to bring out. And I'm very, very proud of these 3 people. So they know I'm always rooting for them.
And from now on, all of us are going to root for you. And for everybody on the call or who's going to watch the YouTube video, please again check the class that Stephanie is offering at UCSF and all the work she's been doing to encourage young entrepreneurs to take on a path that's often actually unusual. I've been working a lot in academia, and now the academia, as every single one of them pointed out, this is not the easy track. but it's always been in the world how hard you work, and it seems that hard work, when you have a passion, it's not so hard. That these young people take amazing risks and learn to look at the very small detail as well as the big picture, which I think is very impressive.
Yeah. Yeah. So thank you for mentioning the class. It is an opportunity for me to bring some of the learning that we've been able to have at UCSF out to the world, and have the same great speakers that we've had in our class come and educate people all around the world. So if there are any entrepreneurs out there, or possible entrepreneurs or government officials who want to learn what innovation is all about, or corporations, this is a great, easy way to do it fairly rapidly and get a good dose of it, of what we do here in Silicon Valley. So hope some people will join us.
Thank you again. We are almost ready right now to prepare for the next roundtable, which is about AI in health tech industry. We've heard a lot over the last few years about artificial intelligence that's taking more and more and more of a place and space in our lives. We've heard a lot about the downsides and the upsides of artificial intelligence. So we're looking forward to this panel, in which we have, is everybody on the call? In fact, we have Lu Zhang, Dr. Uli Chetipalli, and Amit Saha. Is Lu Zhang on our call already? So we are going to wait a few more minutes for Lu to join us.
Hi, this is Uli Chetipalli.
It's very nice to see you again. Dr. Uli Chetipalli has been speaking many times at many round events around here in Silicon Valley, so he's very well known. For the ones who are joining us just now, please again, you are welcome to join us on LinkedIn, also to watch the YouTube live and like the YouTube and share on social media. Thank you to Lu Zhang for joining. So if everybody's ready. Yeah. So I would like to introduce our next panel, which is moderated by Amit Saha. Amit is a research engineer and advisor at Stanford University, and his current research is focused on chronic fatigue syndrome. The chronic fatigue has been such a huge issue for many people, but also it's an overwhelming issue for the medical system. We really don't have a cure for chronic fatigue. Amit is working on designing a microfluidic platform for diagnostics and exploring treatments for chronic fatigue syndrome, as well as extending the platform for examining other diseases that have a similar biochemical basis. Some of these are lupus, multiple sclerosis, and sickle cell disease, among others. So he will moderate today a panel on artificial intelligence and health tech. So welcome, everybody.
Great, thank you, Anna. Thank you. Welcome, everyone, to this AI in Health Tech Roundtable. Today, we have two wonderful speakers with us. We have Ms. Lu Zhang, who's the founder and managing partner of Fusion Fund. She's a Stanford alumni who's an entrepreneur and turned investor. Lu is a 2018 recipient of the Young Global Leader of World Economic Forum. And she's also been featured in the Forbes 30 Under 30 list. Our other speaker, Dr. Uli Chetipalli, is, as Juana mentioned earlier, he is very well known in the Silicon Valley. He has presented many times with us. He's a physician, a researcher, an author, and an innovator. He is the president of Innovator MD, which is a healthcare innovation company. As a physician scientist, he is interested in technology-enabled care. Dr. Cheripalli has received the Pioneer Award of Innovation from the Kaiser Permanente Group, and also the Morris F. Collin Research Award from the Permanente Medical Group. So with this, I'll let our speakers take the floor, and this is a roundtable, so we'll keep it interactive. We'll start off with Ms. Lu Zhang, and then eventually move to Dr. Cheripalli, and then start taking questions.
Sure, thank you, Amit, and so glad to have this opportunity to share with everyone about our perspective about AI in healthcare. I think the past 2 quarters to start 2020 definitely make 2020 a very challenging year for everyone. And also from the VC perspective, you know, we've been investing in healthcare since when I started Fusion Fund. I was working on a medical device company when I was an entrepreneur. So definitely healthcare is one of my major focus since day one. But to be honest, not many investors was focusing on healthcare investment since 2015. But for this year, I definitely heard a lot from my fellow investors saying that, you know, healthcare is so important, and we definitely see lots of challenges and opportunity for this big sector, which accounted for more than 20% of US GDP. So lots of opportunity coming up, and I will see more concentrated capital investing in healthcare. And within healthcare, you know, lots of new opportunity, especially related to, you know, diagnostic technology was related, powered by the integration between the new technology like artificial intelligence, edge computer was a traditional sector. So on one side, you know, for diagnostic technology in general, no matter it's for this crisis, for coronavirus, or for other typical like cancer, heart disease, or mental disease, the goal of the diagnostic is trying to be more personalized and targeted, which requires tons of analysis based on personalized data and how to better collect the data to monitor the situation, how we could really realize and discover the value of the biometrics data in order to provide a personalized diagnostic result and even personalized treatment plan. So I think now with this quick, rapid growth of integration of AI with the existing healthcare medical device, definitely lots of new opportunity, and gonna push us to approach the boundary of doing very early stage diagnostic. Another thing is the digitalization transformation in general. For this crisis, maybe one good thing about it is push and kind of force some of the traditional industry to go through the digitalization transformation, which including the traditional healthcare industry. So we do see, including our portfolio companies who are working on maybe enterprise SaaS platform solution powered by artificial intelligence to help traditional pharmaceutical company, traditional medical device company, even FDA as a regulator, to go through the digitalization transformation to improve the efficiency and better utilize the data. And the last thing I want to highlight before the end of my statements is the correct attitude of how to really consider the relationship between AI and other new technology with healthcare sector in general. You know, there's the tons of the media coverage since 2017 talking about AI replace doctor, AI replace nurse, which is totally wrong concept. Like for us being investing in healthcare for so long, and actually we've been one of the first VC investor proactively promote AI in healthcare since 2017, the main thing should be empower. How to better use AI technology to empower the existing player, no matter it's a physician or nurse or just healthcare provider, to help them better, you know, utilize their time, higher efficiency, improve the accuracy, and meanwhile improve the access. I feel in general we still need to resolve the main issue, maybe AAA issue, access, affordability, and also kind of accuracy. These are 3 things we want to resolve fundamentally for this system, and AI and edge compute definitely could help a lot. So if we could really have a right perspective about how to better, you know, value AI and healthcare, how to better help them integrate with each other, how to better facilitate the conversation between AI expert and healthcare expert, meanwhile better help educate the FDA as regulator to help push this wave. Definitely there's a bright future for AI in healthcare and other new technology integrated with the healthcare sector in general. I will end there.
Great. Thank you, Lou. We'll now move on to Dr. Chettipalli and have his thoughts.
Sure. Thank you for having me, Amit, and the F50 innovation team. It's a pleasure to be here. And Lou, very great thoughts. I really appreciate what you talked about. And if we look at, generally the COVID pandemic, right? What it did is that it exposed, all our weak points in our healthcare system. People ask me, why isn't there a drug? We have thousands and thousands of drugs. Do we know which ones will work for COVID-19? Why isn't there information about how many people are being infected, or where are the clusters that are happening, or how is the disease being spread or not spread or prevented from spreading? How do we know, which is a safe practice? There are so many different practices for prevention we're trying out. How do we know which one works best? What's the best way to get back to work? So all these questions, as Lou was pointing out to, points to our weaknesses where a lot of data is needed. True, AI is great. It works great, and it can give us a lot of insights. But before we go there, we need to have a lot of data coming in. And so one of the things that this pandemic exposed is that, we don't have a good public health data infrastructure. We don't have a way to track people. We don't have a way to see how our health systems are doing in real time, and see how our population health measures are doing in real time. So that's one of the big glaring facts that came out. The second thing that came out of this pandemic is that a lot of the people that are being affected are the ones that have, I would say, poor social determinants of health. People who are living in crowded places, people who are poor, people who are, racially discriminated. Those are the people that are being affected, the immigrants. And so it highlighted the fact that social determinants of health are very important in this pandemic. The third thing that we see is that people that are affected are not only the age factor, but also their comorbidities. How many of them have hypertension? How many of them have diabetes? How many of them have respiratory disorders like COPD or asthma? And how is it affecting them? We know that all these will add to the mortality and morbidity of COVID-19. So, but we don't have a way to track them. And so, if you can imagine, if there are methods and ways to use AI to be able to, number one, detect, how it is spreading and how to prevent it. Number one. Number two, how do you test it, and how do you know where the disease is spreading? Number three, how do you treat it, and what are the best methods? What medications that we already have that people may be taking? Do we know? Do we have a way to measure if those medications are effective? Or are there some other medicines or vaccines or something that is preventing people from getting COVID-19? And so there are a lot of things that we could deduct from data and AI that we don't have that capacity because we don't have the infrastructure. And so one of the big things that we will see from this, episode of pandemic is that it lays bare all our weaknesses of our healthcare system, why we are not able to, use data in a significant way to solve the problem. We think that, okay, COVID-19 is a new disease, it's a new problem that we need to solve. But if you go back and look at, okay, what are the things that are needed to solve this? We need data interoperability. We need a way to control chronic disease, the diabetes, the hypertension, the COPD, and high cholesterol, the smoking. All those things affect COVID-19. And number three is, how do you take care of the social determinants of health, and how do you make people, how do you engage with patients so that their behaviors, their social behaviors can be modified so that they become healthier. Those are that's the big picture that I can take from this COVID-19. That's my spiel for today. And if there are any questions, I'll be happy to do that.
Thank you, Dr. Chatipalli. So now we actually open the floor for questions. If anyone would like to ask something to our panelists, please put in the questions in the Q&A feature. While people are thinking of different questions to put in, I actually have a couple questions for both of you, whoever wants to take a dig at it. So firstly, Dr. Chatipalli, you pointed out that there is a dearth of good data sets, right? A large amount of data is needed, which is true. Now, obviously, starting from the actual basic research state for any disease, COVID, diabetes, whatever it is, but starting from the fundamental understanding of the disease to then the medicine to different medicines rather, and then eventually getting it to the patient to either treat or cure them. There are several steps, right? So of course they are often staggered; they don't always happen in parallel, but especially in the times of urgency like COVID or maybe some other emergency, we of course then have to kind of prioritize some of those steps, right? So where do you think AI in health tech would be more useful, in that situation, or rather, or is it that it'll be equally efficient in everything, but we have to prioritize some steps? So either way, which of the steps should we more focus on? So if you guys could take that question.
Sure, I'll take that. So obviously prevention is better than cure. But in this case, we were a little behind on the prevention part of it. And so what happened was that there was an immediate surge of cases. So when you start thinking about cases, okay, what treatments are effective? We already have a lot of EHR data on patients. So health systems could look at that data and say, okay, of all our ICU patients, which ones are doing better, and what are the factors that are affecting their treatment? And AI is a great tool. Machine learning is a great tool to actually find those nuggets and say, hey, if we, gave drug A versus drug B, there's a benefit here. If we did, intubation versus, so much oxygenation versus the rate of oxygenation, or an intervention where, maybe positioning the patient, maybe this is better than the other. So there are ways of fine-tuning the treatment part and picking the medications that have the most effect on the patients on a positive side. So that is probably the easiest, and I won't say it's easiest, but compared to all the other big problems with our data structure and interoperability, this would be an easier problem to solve within the healthcare system, within the hospitals, I feel.
Yeah, so to totally agree with the doctor, and also to add on to that, definitely if we could do better prevention and also better diagnostic, it would be good, but now it's a bit late. Now the focus is on vaccine and treatment. But still, using AI would be a perfect tool to try to find out all the correlations. Even now we have the coronavirus, in different region, different country, but this virus is progressed itself, and there's mutation happening, there's new correlation happening. So using AI to collect the data, as we both mentioned, at the first time in the history, we're able to continuous monitoring the data, collect the data, and to do better correlation. And this thing could be done better than AI and more efficient, more accurately. Another thing, I kind of echo what Dr. mentioned about using the AI to better choose the potential drugs and also the potential better to do the drug development for treatment. Besides that, another thing AI has been playing an important role is to helping the R&D process, just simply using AI to improve efficiency, for example, for using natural language processing to help the researcher better extract the data from other research paper, and better to help them understand the analysis information using the AI model, or maybe just lots of AI platform now trying to help the researcher from pharmaceutical company or medical device company to help them become a data scientist without actually become data scientists, just leverage the AI platform they're using. So that's another very good application right now to help us, kind of fight against this coronavirus.
Yeah, those are very good points, Lou. So one of the projects that I'm working on is where, how do you, typically, when you want to do a clinical trial, you have the intervention arm and then you have the control arm. Can you use AI and machine learning to create a synthetic control arm where, you're looking at the data and not necessarily having, because when you think about it, if you want to do a clinical trial and a control arm and an intervention arm, the cost of that is huge, right? Yeah. So what if we eliminate, or decrease the cost on the control side? You can use data to create a control arm that matches the intervention arm, and be able to come up with conclusions, and like Lou said, help in the R&D process. For pharma companies that are looking at different drugs and different interventions. So that's a good application for AI.
Yeah, totally. I am very happy to hear you talking about it, because the synthetic data has been a new trend we've been looking at since last year. And totally agree with you. Not only definitely data is a foundation, it's a nutrition for AI algorithm, but on the other side, to try to collect the data, collect the data from the existing world, it's hard to find the edge case. But synthetic data is a very good path for the existing data points, the data resources we have, and using AI model to create it definitely is a very high efficient and low cost way to do it.
Great. Those are great thoughts. Actually, I have a follow-up question along these lines. Of course, we have seen some usage of AI to actually simulate, so to speak, data for different prediction. A good example are in cases of certain vaccines, they look at different structures and predict what might happen the next season. But the question I have is, these are now possible because we already have a fair amount of knowledge about whatever we are using AI for, right? But how reliable would AI actually be in case of a novel pandemic, right? Like the COVID-19 pandemic. And given that we are in the middle of one, are there any key takeaways for us that can help us understand how AI can help us prepare for another pandemic if and when that happens?
Yeah, I can answer that. So one of the key things that we need to understand as healthcare leaders is that the data that we are collecting, there's huge amounts of data, and there are some wonderful nuggets in there that we are not utilizing. Just imagine that there is a drug for some bad cancer, and we don't know about it. What a shame that would be, right? What a waste of human life, because we don't know that there is such a drug, and it cannot, we don't know how to use it, or we don't have knowledge of it. So also there are so many nuggets that are buried in our data, in our healthcare data. And we've done some interesting projects where for example, when you think about chronic disease, you can think about, hypertension or diabetes, right? So there are more than 65 or 70 hypertension drugs. Do we really know which drug will help which patient? We don't. Well, we may have a certain class, certain, subset, but, can we actually personalize the treatment to a specific person? Yes, it can be done. For that we need AI, and for that we need data, and for that we need researchers who can ask the right questions, to be able to come up with the right answers. And so we need to get into the habit, or we need to get into the zone where we know that, okay, data is very useful. So let's build the infrastructure. Let's build the systems to be able to collect that data, to be able to study things when they happen, in an emergency situation. So if we have all the setup already made, all the infrastructure all ready to go, then it would be much easier to study anything that comes our way, right? So first we need to build those pipelines. First we need to build those connections, build those networks for data to be transmitted or to be shared between healthcare providers and researchers. Yeah. And that, I think, would be the first step to be able to tackle the next pandemic or next disease that comes along.
Yeah, I would totally agree, especially talking about the access to the data. I think now the issue is, on one side, definitely, how to better collect the data. But on the other side, with all this existing data we've been having, there's the isolation of the data. Like each hospital owns their own data, and the clinical healthcare service provider, regulator, patient themselves, pharmaceutical company, that everyone owns their own data. But if we do not connect the data together, we could not see the whole picture, which also correlates back to the coronavirus situation. If we were able to connect all the data at the beginning and find out the correlation, we'll probably be able to identify the situation much earlier and have it better under control. So this time, definitely the whole reaction was too late. So if we could have a better solution, how to really build up the bridge for each different parties to share the data, instead of having this isolation of data, and also having a certain type of rule, like a common rule, common standard, everyone would follow to provide access, meanwhile still protect their ownership, that would be great. Another thing is not only just between the bigger player within the system, is another big problem, and also big opportunity is whether there's a type of technology or application could be available to help the hospital or traditional data owner to directly share their data through a third-party independent entity with the startup companies. For example, when the like new situation happened, we do not expect that the hospital gonna for sure have all the AI solution to utilize the data. But if they have the platform, our third-party platform, to directly gather data, make it in a way, formatting in the right way that ready for AI to use. Otherwise, sometimes, for AI founder or startup, when they talk with the service provider, they got huge amount of data, but some are high quality, some are not very high quality. The label are all messed up, and there's not a correct format for them to quickly integrate a solution with the data. So if there's certain type of application could resolve that issue, would be great. And on the other side, that will also provide another revenue resources for the data owner or data provider to better use the data, instead of they have to, figure out the solution or technology application all themselves. We start to see some company trying to, build up this third-party platform, talking about with a different hospital to have all their data source to the platform. They work on it and package it ready for either a large tech company or smaller startup company to use. But I think that's only the technology part. We could utilize AI. We could use edge compute distributed network to better define the ownership and also protect the data ownership. Meanwhile, make it available for everyone to use. But on the other side, we definitely need more complicated regulation on that, since that's not only data, that's also digital asset. and how we could have a better and comprehensive protection over the data asset and have clear definition of who owns it, storage rights, how to do monetization. That'd be very critical. That's not the thing could only done by the technology or healthcare sector. I think we need a more broader discussion to looping all the policymaker, the major player, and also technology.
Great, thank you. So we have a question from the audience. Steve here is asking, in the personalized medicine domain, obviously looking at generic data or applying artificial intelligence to generic data may not be entirely fruitful, right? So in case of personalized medicine where you need more specific information at a personal level, how do you think the AI can be useful?
Yeah, that's a great question. A lot of people think that, we don't have good data, so we should not do anything. I disagree with that statement because we will never have perfect data.
Yeah.
If you think about, personalized medicine, I don't think that, you need to think about an individual as the person, right? So let me give you an example. We looked at, by the way, I do this every day. So we looked at data on diabetics and wanted to figure out, okay, how do you find the best drug that would help a specific diabetic? And as we looked at millions of records, we kind of found that diabetics, when you look at the variables, diabetics were falling into different clusters. So, there were 4 big clusters, which had a different set of variables, which means that there are, 4 big types of diabetics. Although they're all type 2 diabetics, we were able to further classify them into 4 different classes. Of course, there are many more than 4, but 4 big ones. And the other thing we were able to figure out is that, specific drugs were working on each of these different classes. And so you cannot say that, oh, this is garbage, I'm not going to deal with it. But as you get closer, you are, decreasing the size of your target, and you're becoming more and more precise. So it doesn't always happen to that one particular point that you need to get to, but at least your target is much more smaller and much more specific to what you want to do. So, people thinking that, AI will solve all the problems and, everybody will have a perfect medicine, perfect health, that's not going to happen. It happens in stages. So you have to know. So right now, what science tells us is that, oh, okay, if you have these risk factors, if you look at American Heart Association or American Diabetes Association, right? They have done studies, for many, many years, and we know that the population in Massachusetts is very different from the population in California, right? So at least you can separate those two and see, what are the differences between these two populations and what specific treatments will work better in our population. And then as you start looking at, more detail and as you dig deeper into the data, then you'll get these insights that you would normally, you don't, like everybody gets the same medicine. That is much, much, worse than what we could do with the data we already have. Knowing that it's not perfect, but still we can, glean some insights into that data.
Yeah, so just quick to add on to that, and when we talk about personalized medicine is definitely for treatment. Another thing AI do is help us better connect treatment with diagnostic result. Diagnostic could be personalized too, and based on that result, could see which type of medication will be more effective. For small cell cancer, like lung cancer, it's not just the genetic reason causing the cancer. There's other like a lifestyle, other environmental issue, and the AI could help us better do this correlation, and which contribute back to like, if you want to do more targeted medication for this individual, you could utilize all the data. And meanwhile, for example, another big issue right now for the whole world is aging population. And related to that, now the increasing of amount of the mental disease is a big challenge. And mental disease is even more, I won't call it more complicated. I would say we have more unknown related to mental disease, like why for this individual specific person, what triggered the mental disease for this person, whether it's genetic reason or whether because other reason. For example, we invest a company doing the early stage diagnostic for dementia. And they found out, you know, some people because of family history, genetic reason, but other people may relate to their lifestyle. For example, smoking would contribute to that. If we have all this data and correlated to the which type of treatment plan you wanted, it will be more personalized. So without AI, you won't be able to kind of line up all this correlation, and the people would have to assume that, okay, same disease for different people gonna be same treatment. But if we want to do personalized medication, we also want to find out what actually triggered it for a specific person. So that's another part AI could play an important role. But back to originally what Dr. mentioned, I totally agree. It's gonna happen step by step. For healthcare innovation, especially AI in healthcare, I really worried about when there's too much capital coming in and people assume AI could solve all the problem. It won't. It will be something empower the existing player. It will be a process of integration. The replacement is gonna happen that whoever use AI as an effective tool will potentially replace the people who refuse to embrace the new technology. But it will take a long time for us to achieve the final goal, no matter it's a specific personalized medication or specific, you know, super early stage diagnostic or even treatment plan in the future.
Great, thank you. So we are nearing the end of our session, and I have one last question for both of you, because you both are investors and entrepreneurs. So so far we have had some splendid points based on the science, the research, you know, along those lines. They're great. But now, if we change gears a bit, are there any specific pointers that you'd like to share with us from being an investor or being an entrepreneur as to how, or you know, how the opportunities in AI are in these kind of times, and you know, or in general, if there's anything that you guys want to share, that would be great.
Okay, sure. I could get started, and I would say the first thing is I've been got asked recently a lot is founder asked me whether or not it's a good time or bad time to start a business, especially healthcare become a hot topic. But on the other side, the macroeconomic is going down. We're entering into a recession. My general feedback is always there are no good or bad time. But definitely now you can see the trend is coming that digitalization of everything and healthcare become a major issue, need technology for integration. So whenever you're ready, you should just start it. But the important part is to set the correct expectation, which means, you know, we're in the downturn, which means the capital is gonna be more concentrated. And it will be harder for mediocre founder to raise money, I will put it that way. But the top 10% of the founder will be able to get more concentrated capital. And meanwhile, in terms of competition, there will be much less player in the market. So for very few survivor, and they will be able to take over the whole market much faster. So that should be the expectation for the founder, understand what they're entering into and then be prepared for that. But in general, there are no good or bad timing. The only timing you need to consider is whether the technology integration with your solution with the healthcare sector, whether it's ready or not. Something might be too early, something might be already late. That's the only thing. Besides that, another thing is, especially for AI in healthcare, I was in a panel early this year in JP Morgan Healthcare Conference. I remember on that panel, I was the only investor, ex-founder, try to go through FDA for AI in healthcare solution. All other investors trying to ex-founder, try to avoid FDA regulation, you know, go to direct consumer process, which is much faster. I'm strongly against it, because if we really want to make this two group people work together, AI application integrate into the traditional healthcare sector, FDA will be a very important bridge. And on the other side, I understand the frustration when founder working with FDA, especially non-healthcare founder, they may think regulation take long time, capital intensive. It's getting better, definitely, especially for the past couple of years. We have many companies, they got FDA approval, 510K within half a year. I have a couple of them, AI in healthcare company, they got the first FDA approval for like deep learning for medical imaging improvement. They got 2 FDA approval within 1 year. We need to help FDA better understand how to accelerate in healthcare with AI and edge compute. And when you help them, they will help you back by accelerating process as well. And meanwhile, even only with FDA approval, it will make it much easier for the AI in healthcare solution to adopt by the traditional physician and the nurse. It's not just only about efficiency improvement, it's also about the justification for the existing player, how they trust your solution. So don't afraid of the regulation, try to work with them, treat FDA as your friend, and believe that they're getting better and the whole system is getting better to integrate with new technology.
Well said. Very important points about the FDA. So I do mentor and counsel entrepreneurs, especially when they're in the early stages. So the first thing I tell them is that make sure you are geared for the long run. You cannot do in healthcare, it cannot be quick. So that's number one. And number one is make sure you have a 5-year, 10-year plan, not just 2 years, 3 years, and you're gonna get out. So that's number one. Be patient and be prepared. The second thing I tell them is that make sure you have a healthcare person on your team. Ideally, if you're building a solution for let's say diabetes, you better have an endocrinologist or somebody on your team. So make sure they're a physician or a nurse or a pharmacist, somebody from healthcare, should be on your team. Most of the companies I see, they come in with the technology first. That doesn't work. The third thing is make sure you make contact with your potential customers early on. You need to learn exactly what the problem is. You don't come up with a solution and then start looking for a problem. First you go to your potential customer and actually find out about the problem. Study the problem, understand the science behind it, and especially when you're talking about data science and actually using data to be able to give you information about efficiency or cost or any of those things. Make sure that the business model matches the business model of your customer. For example, actually this morning I was talking with an entrepreneur, and he wants to create a tech solution to prevent strokes. Okay, so who are you going to sell it to? Well, I'm going to sell it to the hospitals. Well, if hospitals don't get stroke patients, they'll go out of business, they'll lose money. So they will not use your stroke solution. And so you have to figure out the business model first before you actually, think about it. It may be a great thing to think about it, in a science way, with the scientific background that you may have. But, if it doesn't fit the business or the business model of the hospital, they're not going to use it. And so it becomes a difficult situation. And so first find your customer and find the problem that the customer is having, and then build the solution rather than the other way around. Even if you have, the greatest solution for a problem, unless you align the business side of it with the solution, it won't be successful. Those are some of my key things that I suggest to entrepreneurs.
Great. Thank you so much, Dr. Chattopadhyay and Lou. So we have come to the end of our AI and Health Tech Roundtable. I'd like to thank both of you for taking out the time today and for some wonderful points. And thank you, everyone, for being here. Thank you.
Yeah. Thank you, Dr. Chattopadhyay, and thank you, Amit.
Thank you, Lou, and thank you, Amit. Have a good day.
Have a good day. Bye.
So back to you, Anna, I guess.
Thank you, Ami, for leading this panel. It's probably one of the most controversial things that's happening right now in medicine. It's taking benefit of all the data, the access to all the data that we have. But one of the people from the audience had a very good question about how do you link the data with the phenotype? Basically, what's the panel of symptoms that a person shows? And then we need to actually go in parallel. So it has been a wonderful discussion about this combination between and working on many multiple levels with the patient, with the hospital system, and with the government, as well as the investing system.
Great. So let's, I'm looking forward to the next sessions. Thank you.
Thank you. So if we are almost ready, we've heard earlier this afternoon about early startups in life sciences and things with a passion that comes from the heart. People who, young entrepreneurs who start their own businesses and the joy and challenges of starting a business in healthcare. And now we just heard about artificial intelligence in healthcare and how to use, but not overestimate the power of data. And the next panel will be on investments. Again, I want to remind everybody in the audience that you can watch these recorded sessions on YouTube. You can watch them live, or you can watch them recorded later on. That you can also join the panelists and all the speakers on LinkedIn. And you are welcome to share these recordings or the presence of the summit on the social media. So, Canis, is it almost ready? Are you ready to be introduced, or should we wait a little longer?
Yes, sir. Yeah, I think we're ready. Yeah, I believe we have most of the panels. I'm going to do a roll call first, if you don't mind, but go ahead, please.
Okay. All right. So our next panel is on investments from ventures, angels, and it is going to be moderated by Canis Wu. Canis is head of insurance practice of Velocity, and he has a deep interest in digital transformation and venture building. He has established many businesses with vertical solutions using innovating technology, taking them from launching and executing to market plans. He also developed many incubator and accelerator programs for startups with innovative technologies. So you hear a lot from Canis about innovation and technology in healthcare. So I'm going to hand it off to him for his roundtable on investments. And thank you, Canis, and all the other panelists for being present.
Thank you. Thank you very much for the introduction. Hello, everyone. Maybe the first thing I want to do is just want to maybe do a roll call on my panel. So I see Daniel here. I also see Charles. I believe Oren is here as well. Just do a quick check whether Peter Rosenthal, are you able to join us? No.
I'm here. Can you hear me? Can you hear me?
I can hear you fine. Yeah. Perfect. Perfect. Okay, everybody's here. Thank you very much. So thank you again for the introduction, and we're very excited to have this panel about the investment side of the equation. So again, thank you for the kind introduction, and maybe just one more word about me, which is I'm also one of the venture partner here with F50, and I work with David Tsao from the very, very beginning of F50, and a lot of fond memories in the early days of F50, and I'm very excited to be here to help on this event as well. So without further ado, I just want to maybe just take a few minutes for each of the panelists to introduce themselves. I'm just going to go through alphabetically, no, not in particular order, alphabetically. So maybe Charles, can you maybe start?
Certainly, thank you. It's a pleasure to be here. My name's Charlie Sidman. I am simultaneously an angel, a VC, a crowdfunder, a public market person, and my focus is young and growing companies, whichever their financing mechanism. I'm speaking to you from the East Coast in Bar Harbor, Maine. But I work globally.
Thank you. Thank you, Charles. Daniel, I know you introduced yourself a few times, but maybe there'll be some new audience. So Daniel, you want to introduce yourself? Can't hear you, Daniel.
Thank you, Kenisa. I feel a little bit like a broken record, but yes, I'll introduce myself. My name is Daniel Teo. I'm a managing partner at Hunniwell Lake Ventures. We are a Palo Alto-based VC firm that invests exclusively in medical devices. And within that space, our focus, our specialty is in the area of surgical innovations. These are devices and instruments that help our surgeons see, treat, and heal our patients better. C will be all of the visualization, navigation technologies, including some novel point-of-care diagnostics. Heal would be, treat will be all of the treatment modalities, RF, microwave, laser, ultrasound, and as well as home and portable dialysis. And then heal would be all of the tissue closure, wound closure, tissue healing, tissue regeneration kind of technologies. Those are our special areas of interest. But we can also invest outside of that if there is really an interesting opportunity. Thank you.
Thank you, Daniel. Next, Oren.
Candace, thank you. It's a pleasure to be here, and I appreciate being invited. I'm the CEO and managing partner at the Global Health Impact Fund. We invest exclusively in our first fund in digital health, telehealth, and medical device. And we have a really great portfolio already. I'm also a doctor. I've had 25 years of clinical practice, and I've trained in anesthesia, and I practice in San Francisco.
Great. Thank you for the introduction. And finally, Peter.
So I'm a 25-year member of two angel groups in the Bay Area, originally Angels Forum, and now Mighty Capital. We invest in about 1/3 life science medical, 1/3 enterprise software, and 1/3 consumer products. A unique aspect of our fund is we have a very close relationship with an organization called Products That Count, which consists of 300,000 product managers and senior level product people, which is a resource for our companies to both recruit, sell products, and get advice.
Great. Thank you for the introduction. I think the format is that I was basically lead with a series of questions, and I think we'll tee up for the panelists, and of the panelists, feel free to just chime in for some of the questions as well. And also, I think the audience, if you have also questions, I think we're going to take them also toward the end of the session as well. So get them ready, and we got a wealth of experience in in medicine, in investments, and tons of experience here. So let's learn from the experts here. Let's start with the first question here. So, the pandemic and COVID have obviously had major impact to the world, but also very significant impact to the startup and the venture capital community. What proactive strategies you as an investor have instituted in your portfolio companies, right? Maybe related to financials, maybe related to operations. Love to hear your thoughts and maybe some of the advice as well for the audience. So love to have the panelists to just go ahead, please.
I'll start off if you want. So early on in the COVID situation, we realized that there was potentially going to be a serious cash crunch for our companies, and we worked with each of the portfolio companies to really take a look at how many months of cash they had. We sort of felt that anything short of 2 years was going to be a potential problem. And so we encouraged them to downsize where appropriate or to scale back. And also all of our companies got help early on in applying for PPP funding for the company.
Yeah, I'll add to that. I mean, the issue really is one of risk management at this point. And I echo what Peter said is the first thing you have to do is look at the burn rate, look at the amount of money they have in the bank and what their runway is, and make sure that they can extend that as far as possible, with the idea that it's very probable that there won't be a lot of capital coming in the near future due to the market shocks. I think the other thing to recognize is that many companies have had problems because they're not currently able to do clinical trials or work with hospitals. And so that's really frozen a lot of the operations in place. Where, you can't get through the IRB, you can't deploy a new product. And so you really have to plan around that and creating more time in terms of not just capital runway, but in terms of deployment runway.
In terms of clinical trials, I think I want to pick up on that point. Yeah, it certainly has been affected, but one of the ways in which we try and mitigate that is to have contingency plans. Try and develop alternative sites, because you don't know when and where they're going to open up. Every jurisdiction is a little bit different, especially if you're doing an international trial. Every jurisdiction has its own timing. So it pays to have some contingency plans, alternative plans, so that whichever jurisdiction opens up first, you're ready to go. As far as cash is concerned, that's certainly a problem, and the prudent thing to do is to conserve cash. But one of the things we realized was that, again, this depends on jurisdictions, but many of the companies that we work with actually have got exemptions. They were granted exemptions as an essential service. And so that allowed them to continue to do their work, even though clinical trials are not ongoing, but at least the engineering and mechanical work can be done in the labs.
Charles, you have something to add to that as well? So a lot of good insights so far.
I think the others have covered anything I would add. I'll chime in on some of the others.
Okay, you bet. I think on the operations, do you see certain, because of the environment, are there certain areas of operations that you think might be easing because of the urgency of the situation? Yeah.
I would take that question. Sorry, go ahead, Charles.
Well, in terms of easing because of the COVID climate, in some ways, there are funding sources available now, investors and government programs that are responding more rapidly and administratively almost. Some applications are not going through the standard review process. So for some companies, particularly in the healthcare area, I think it's, to rephrase Charles Dickens, it's not the best of times and the worst of times, but the worst of times may be the best of times.
I want to echo what Charles said. In fact, we at Hunniwell had just recently compiled a list of grants that are specially designed to fund COVID research and development, COVID-related research and development. And believe it or not, there's still about $7 billion of grant money that's out there that's still available. So if you happen to be working in a COVID-related product or area, that's certainly something that you should access. And in fact, we've made that list available on our website. Anyone can access it and search it and find one that's suitable for you. So hopefully that will be of some help to you.
I'd like to add
something
to what Daniel said.
Go ahead.
There are enormous resources now, but there's also a downside, a danger of that. Given that there's such interest and need, I'm seeing an uptick in the amount of bad science, nonsense science being proposed, because you can say COVID now, and it's like AI was a year ago. It's magic. So if you say that word, everybody thinks that it will fly. Well, a lot of them don't. So special care and attention is warranted.
Yeah, I'd like to add to that I have an AI blockchain COVID solution if anybody wants to invest. No, but seriously, this is an interesting point that you bring up, because one of the themes of our fund is that it's clinician founded and clinician driven. And what's critical is to include the clinicians and the scientists from the beginning all the way through execution in the decision-making process of a company. The insight that community can bring will hopefully filter out the bad science, so that really only the better companies get through the processes in order to ultimately commercialize. But this has been an opportunity. Crisis creates opportunity, and I think that operationally there have been a lot of problems, but at the same time we've seen in our portfolio a number of opportunities that have arisen because of solutions that our companies had that would help things in this current environment. So there is a lot of money that can be invested. There is capital that's on the sidelines. And if you can point it in the right direction to deploy it, this is a terrific investing opportunity. It's changed, the culture around telemedicine, for example, has completely changed, whether it's through reimbursement, through adoption of patients, through adoption of doctors, getting good solutions that are telemedicine-based solutions. That's a phenomenal opportunity right now.
May I add another comment to follow that? Just another caution. I'm all on board with you in terms of having the doctors and the clinicians involved from the beginning, but there's a danger in only having the health professionals and the technology people governing something and pushing something, because we have to remember that all of these solutions have to go out and be accepted by the real world, who are not healthcare professionals and technicians. And often we say, and some of the previous talks today have emphasized this, we think it's a great solution if the world would only do things our way.
That's true. I agree with that, but just to say, I didn't say doctors should have the table, but just a seat at the table.
Right.
So actually on that topic, I'd love to maybe follow up with a question about maybe directly related to COVID or maybe beyond just during this environment, have your areas of interest, right, shifted or have been impacted because of COVID and the environment? Are there certain technologies or innovation that you're looking at? You talked about telemedicine and telehealth. That's a big hot word these days, but are there other areas that you see are popping up that you think actually really have some good promise? I don't think I stunned everyone here, right? So come on.
Well, I'll venture to say something. I think the obvious ones, of course, telehealth and remote monitoring and respiratory health. Those are clearly areas that are very relevant now. But we are a little bit. We look at it very carefully. One of the problems with telehealth and remote health is payers are generally wary of funding that. Pre-COVID, there are very few CPT codes that are available for telehealth and remote monitoring. With COVID, yes, a few more opened up, but the indications we are getting from conversations with them is that the intent is to review. All of these are temporary measures, and once COVID is over, they are likely to be rolled back. So we need to kind of understand exactly what is going to survive and what isn't, in order to make a better assessment there. But beyond that, beyond the obvious, we see opportunities in several areas. I won't call them opportunities because that sounds bad. But number one, renal health. We know for a fact that about 10-15% of COVID patients also present acute kidney injuries as a comorbidity. The percentage for COVID patients in ICU with kidney health or renal health injuries is even higher, 20 to 40%. That means not only are kidney transplants going to be less available going forward, the need for more dialysis is going to be even greater for the next decade because of all of the 2 million people so far in the US have had COVID, and that's going to have some kind of impact on them. Beyond that, we also see that similarly in gastrointestinal GNI space, 18 to 23% of COVID patients show some form of COVID malfunction. Show some form of gastrointestinal malfunction. And therefore, we believe that non-invasive, preferably point of care diagnostic technologies and treatment modalities for GNI diseases and conditions will be more badly needed than ever before. And then finally, COVID also damages soft tissues significantly, leading to secondary complications. And so we believe that high precision energy-based surgical instruments, innovative wound closure and tissue healing solutions will also be in high demand. So those are the three immediate trends that we're seeing that are not immediately obvious. But if you look a little bit at the surface, this is what we're seeing.
I would throw a comment on that as well, Daniel. You speak of GI or diabetes or other areas interacting with COVID. COVID is really just the canary in the coal mine, and it's revealing the problems which have pre-existed, and it's exacerbated and exacerbating these previous problems. So the problems of poor lifestyle or poverty or malnutrition or other disease states, those are really the fundamental things. And 10 million people a year die of TB, but we're not talking about them now. We're talking about the few 100,000 who are dying of COVID. Yes, the people who have TB are going to interact and be more seriously affected by COVID, but really this is the tail that's wagging the dog. Let's recognize what the dog really is. It's not COVID, it's these other things.
Peter, Oren, any comments before we move on?
I'll pass.
You'll pass. I'll
Okay.
add to it, vaccinations and pharmacology and supply chain, solutions. These are all areas that I think are going to get renewed interest. But I think what I would mostly add is that I think there's been a reawakening of the awareness of the importance of innovation in healthcare, whether it's in terms of healthcare delivery, whether it's in terms of the disparities and the social determinants of healthcare, or whether it's in terms of just creating new things, whether it's antibiotics or antivirals or what have you, that these are things we need to do. And if we wait until there is a pressing need, it's already too late. And so we have to innovate, we have to create new strategies for getting innovation out of the lab and into commercialization, new incentives all across the board. I think that's very exciting.
Yeah, that was actually the question I was gonna. Can you hear me? Yeah, that was the question I was gonna follow up on, which is, there's the diseases and the conditions, but yeah, you would talk about, are there other related innovation or ways to kind of help distribution, supply chain, or access? There's a lot of areas that needs to advance and be able to address some of the people with all these conditions around the world on a global basis all at the same time.
Well, one issue is, I suspect most of you over the last few years have seen one or more companies looking for funding for vaccine or vaccine delivery systems of one sort or another. We certainly have, and we've always passed on them because the economics of reimbursement for that, both here in Western countries and in developing countries, the reimbursement has always been a challenge. Now, all of a sudden, these companies in the vaccine field and vaccine delivery are getting a lot more attention. I think we'll be seeing more down the road. Whether that's a long-term trend and how to solve the financial reimbursement part of that, I think remains a problem long-term.
I mean, I think you're getting a real-world example of managing disease states early versus letting them come to fruition and managing the consequences, and not just in terms of the social impact of people getting sick and people dying, but of the economic impact. And if we look at some of the countries in parallel who've been dealing with the COVID crisis and who are much more aggressive in the beginning and who haven't had the impact to their economies and to their healthcare infrastructure, you can see that preventative care is very effective and ultimately saves money. The question is, can we translate that new knowledge into preventative care in this country? And that remains to be seen.
Great, thank you. I'm going to switch gear a little bit, and since we're talking about investors, right? So, given this shifting gear to kind of shelter-in-place topic here, right? How has shelter-in-place, being forced to work remotely, really impacted in terms of how you've engaged with the startups, or possibly how has other companies been pitching remotely, and how have you made determination what to invest in a remote setting without having the face-to-face type of interaction? Love to get your thoughts on that.
I'll chime in. I have never been as busy. There are times today, twice today, I've had 3 or 4 competing obligations, and I couldn't obviously. I've had 2 screens open at once and my sound turned off and trying to listen to both, but I have never been as busy. We don't spend time on airplanes and airports. It's amazing.
I can identify with Charles there. I think we can certainly do a lot of work that's online, by email, by Zoom like this, phone calls, and in some ways, we're more productive than ever before. But on the other hand, in terms of making an investment, there are a couple of things that you can't do without. Usability, for instance, is very important to us. And so the ability to be able to touch and feel and see how this instrument actually works. If it's small enough, they can have it shipped to you. You can look at it at your home office. But if it's connected to some other machinery and you can't do this at home, but you need to look and see how it works in animal labs, for instance, or clinical trials. We talked about clinical trials earlier. That's definitely affected. We have offered, and then the next point, of course, is investing is not just about the technology, it's also about assessment of the team. Is this a team that can actually take it through? And you can build understanding and get all of the data through Zoom and electronic means, but you'll still need to look the founder in the eye. You still need to be able to assess for yourself from his body language, from the conversations, the side conversations they're having within the team, if this is a team that is going to be able to handle the $1 million or $2 million or whatever amount of money you're going to put in their hands, whether they're going to take good care of it. That is difficult to do online. Now we've offered, so what we've done is we've offered term sheets, for instance, to companies that we've previously met and are now kind of going through the process. But to invest in a company that we haven't met entirely, that's going to be very difficult.
Yeah, I just add a quick thought because I agree with everything. I've probably been more productive in this period of time, but I think that the biggest loss is the loss of the conferences and the meeting of people in person and the networking and getting the key opinion leaders together with the companies. I think that's been very hard for the companies and very hard for investors.
Yeah, I've heard investors where they literally have 100 interested entrepreneurs asking for funding, and it's really hard to wade through that, particularly if you have not met them before and you don't know them ahead of time, right? So, how the heck do you assess that? And then, as you mentioned, Daniel, the face-to-face is so important to build that level of relationship, that level of connections with the entrepreneur and the investor, and it's very challenging doing it remotely on the Zoom, no matter how you look at the person via remotely, right? So,
can I chime in?
Great. So
body language is really important.
Mm-hmm.
The interaction is important, and it's fun to share coffee or wine together. But equally important for me is the give and take and the challenge and the response. And a lot of that can happen remotely. After several cycles of interaction, to questions, to challenges, to uncertainties, you can learn a lot quite quickly about someone you haven't actually physically met.
Well, the old line, you learn a lot about a person when you play golf with them, right? So, yeah, you can play golf, but it's hard if they're not there, right? So
I can't play golf, so what do I do?
Yeah, play pickleball. No, just kidding. So, a different question. So, I'm sure you all heard that a lot of investors like to invest in founders and startups that are within driving distance from their home or something like that, right? So that's a kind of a joke, but given that all this working remotely, and and I mentor a lot of startups, and some are literally from down the street from where I live to Taipei to Germany, right? And so virtual connection all of a sudden expanded very globally, but has this virtual connection globally affected in terms of the types of companies or maybe the geography of the companies and how you connect with entrepreneurs in terms of those type of relationships? Do you invest outside the area? Or do you invest in international startups now?
I do and always have. And so this is not such a big change for me.
Yeah, likewise.
Okay. Daniel?
Nothing has changed in terms of our geographic coverage, but again, the practical reality is that now you can't, there are many places that you can't travel to at the moment. And so that's a practical reality at the moment.
Great. We only got a few more minutes. Maybe I'll just see whether are there any questions from the audience? If not, I can wrap up with one more question, but I'd love to maybe get audience all questions from the audience. All right, so we'll give it a few more seconds. All right, so why don't I just wrap up with one more question, and there are questions posted in chat or whatever. So given all this conversations, right, in terms of, do you have any advice for entrepreneurs just in general given this time? And also, do you have any advice for fellow investors during this time, right? So I'd love to turn the table around a little bit in terms of how would you think about, you know, advice on both sides of the table? And we'll go down the chain of, go ahead.
So I think one thing that anybody looking for money now needs to think about and include in their presentation is an acknowledgement of the COVID situation and the limitations it's placed on doing business. And they need to talk about how they're going to deal with that, or how they have dealt with it in their business plan and financing needs. If they ignore it or pretend it doesn't exist, I think that's a bad leg to get started on.
What I would say to startups is that you know, COVID is of course a lot of bad things, but it doesn't have to be all bad, and that there are actually opportunities also to be found there. You know, new areas that are now becoming more important, but also, you know, what's the saying that the cream always rises to the top? And I think in this environment, it is all the more vitally important that it's going to be the top 10, 15, 25% of the companies that are going to do well and do better than ever before, you know, pre-COVID. And if you are in that top 15, 25%, then you're good. So, you know, tighten up your procedures, be disciplined, be very, you know, now you have a lot more time to think instead of act. So think more and think through your plans, make them robust so that you'll come out of this process a lot stronger and better before.
Charles? Yeah.
Okay, well, I believe, as several people have said, that problems, times of stress, create opportunity, and the cream will rise. When I talk to entrepreneurs, when I talk to investors, I tell them to pay attention to what I'm going to say now for entrepreneurs. Make sure you consult with and show me interactions. Before you talk to me, show me interactions with, one, investors. So you've done your homework, you know what might fly or not. And secondly, tell me your interactions and support from the market, either the actual or the potential customer, because your idea of what the market needs is not as powerful as what the market says it's ready to buy.
Great one. Oren, last but not the least.
Last but not least, I would agree with all of that. It comes down to, if you have a disciplined process for evaluating companies, that process, you shouldn't throw it out. You should use it. You shouldn't cut corners in it where maybe we would in a hotter market, frothier market. You know, if it's a good business doing something well that other people can't do, with a team that is the right team to do it, and there's a market for the product, it should do well. And, you know, it just may need more time, more capital, but, you know, the fundamentals still work. So I think, you know, stick to your discipline and you should be okay.
Great. Thank you very much. Again, I just want to thank all the panelists for your great insights and also your time. So thank you very much. And I think onwards to onwards to the I guess the next panel.
Thank you.
Thank you very much. Great time.
Thank you. Yeah. Thank you very much.
Hey, Kenneth, that's a great panel.
Thank you, David. Nice to see you.
Yeah,
can you hear me?
Catch up face to face soon.
Yeah.
Thank you, Kenneth.
Hey, Randy. It's been a while. How are you doing?
Good. How are you?
I'm doing good, thank you.
I have all new terminals in front of me, and I have a couple of them. I want to make sure. Can you see me and everything's fine, and you hear me? So we're all good.
Yep, all good.
Good, Randy. I can hear you well.
It sounds like David.
It is, David. Come on.
Hey, great job, great job. I mean, a lot of work goes into these virtual events, and we're blessed. Last 2 months we've probably done maybe 50 of them around the world, and it's such. But getting back to the question, I was going to chime in, but it wasn't my panel. But it's really embracing the challenge right now, and with entrepreneurs, they're raising a lot of money right now, and I can kind of tell you why in a little bit when I start our panel.
Right. Now I'm waiting for one more panelist. Okay. Yes, Zoom meeting was pretty easy, but the big Zoom conference not easy.
A lot of work. I empathize.
Yay.
I turn that one off. David, we're just waiting for a while.
James is online. His video is not on yet.
Okay. How's your day been?
Huh? It's getting better. Hey, James, I like your hat.
Hello. Thank you. I had a different hat on this morning for the other one, the SVE judge thing. I had a different hat on. I had a different shirt on too. I changed it because I wanted to match my hat. I had a blue hat on earlier, so I'm matching the brown.
Okay, great. I do have another super angel, so he's waiting there. How come he's not on? Okay, so one more person. Yes, we got the other speaker, right? Okay. No, okay, let's get ready to start. Amanda, let's start. Good afternoon. Welcome to the Super Angel Roundtable. So we invited a couple people who are very active in the angel space to talk about angel investment as well as the impact of the pandemic to the angel investors. So I'll start with Randy. Randy's Crazy Forum was ranked by Forbes for 2019 most active angel network That's a pretty big achievement. So one question that in 2020, are you still active? Start with Randy.
Well, we have 53 locations globally, and I've used to travel to all of them, and I feel now I have a deeper lens in the marketplace because I'm on most of the Zoom calls. Tomorrow will be Spain. Last week was Sweden. The week before was Istanbul. And we are seeing more and more fundings because what we're seeing is our members, and also we also have a family of funds, which I'll talk about that later, but we have more time to focus on the great entrepreneurs. Just in Northern California alone, we've had, maybe 24 events virtually, and we're having a thought leadership event in 1 hour that about 100 of our members are joining. But again, we're trying to embrace the challenge, and we're trying to articulate to the entrepreneurs that yes, you have to obviously be very mindful of your evaluations. They probably need to come down. You need to win, but we need to win also. And as such, you know, we are saying, well, maybe the rounds are decreasing too. Instead of $100,000 unit investments by our members, now it's 50. But conversely, if they're making their milestones next couple months, we'll increase that. But we're seeing more and more syndication happen between our chapters, especially globally with our domestic chapters. So the answer is we feel it's robust right now. We miss obviously gathering. We miss seeing our community. We have over 3,000 members around the world, and we've missed many expos. Our expo in Northwest is held at Redmond at Microsoft. Down here, we meet in California Street. Many of you probably that are listening have been to some of our expos where 500-600 of us gather. And generally, there's probably at least 6 to 8 investments that happen from these large events. But virtually, we're getting through this. You know, we all want to be together. But conversely, this is the best next best thing. But more important is our members have time. And our entrepreneurs have more time to interface virtually with our members, and checks are being written and wired. So we're open for business. Thank you.
Okay, that's good news. So next one, I want to invite James. James was ranked by Forbes most active angels multiple times. Maybe James, can you tell us a little bit more about the impact of pandemic to your angel investment?
Yeah, it's interesting because now a lot of events that are not even in the United States, I can do them on Zoom and do a lot more demo days. Like every day of the week almost, I have a demo day, sometimes two, one in the morning, one in the afternoon, or one in the morning, one in the evening. So I'm still making investments. And also with the Pop-Up Venture Syndicate, with some guys I know, we're doing some larger checks. And the interesting thing about that is some of the deals that are like Series B or C that would have been harder to get in with an angel check, you can pool money and you actually can get in those deals. And before they weren't as open to having a bunch of angels or a bunch of individuals pooling money to go in.
Okay, I see. So my next question is that the pandemic, of course, there are many different investors are being impacted, the ventures, the small investors, private offices. So for the angels, so sounds like from Randy that it's a good thing that the angels has more time. Is that because of pandemic now priority of angel investment increased?
David, are you choosing us to talk, or we just talk spontaneously?
The question's for you.
Okay. I mean, you know, looking at the market right here, you know, obviously it's gone up today. I think the market conditions on the public side have a lot to do with obviously investor confidence and liquidity in the marketplace. Our thought leadership event.
Okay, looks like Randy has an internet connection. Maybe James, you want to take over the question?
Yeah, one thing that's interesting now too is a lot of people don't talk about it, but spending time with your current portfolio, because not all companies are doing bad because of COVID. About maybe 1/4 of my portfolio is actually doing better, and then 50% is kind of like just surviving along. I mean, have some ups and downs depending, and then the last 25% or 1/4 is kind of in struggle mode because of the pandemic. So I've been spending time, obviously the ones that are doing better, you talk to them and they don't need your help, so you don't focus there. And the ones that are in the 50% mode, you just want to make sure they don't go into the 25% mode going down. And the ones that are really struggling, you just want to try to help them. A couple of companies had to end up getting acquired because of it. So that's one thing. And another thing with the pandemic is just spending a lot of time at events and on Zoom, not only with founders, but just even speaking at events and just learning about things that you wouldn't normally do because everybody's got more time.
Well, Randy mentioned spend more time on Zoom. So does that mean that because of the pandemic, the angels actually spent more time in angel investment? Is that true of us?
Making more investments, more numbers of investments?
More time in angel investment.
More time, yes, because I'm seeing more companies than I was able to see before with Zoom.
Okay. Okay, got it.
So same number of investments, but I'm able to see more companies.
Okay, I see. So I'm going to invite our next panelist. Paul Singh is also a very active angel investor. He's a member of Thai board member as well as Thai Angels. Maybe Paul, welcome on board. Can you introduce yourself?
Yes, thank you very much. And so I wouldn't call myself a very active angel investor, but you know, all of us in the Valley do some angel investing. But I am involved with Thai Angels Group and see the investments that are coming through there. So yes, thank you for having me.
Okay, Paul, you missed the first question was that how does the pandemic impacting people like you as well as the angels around you?
So I think there are, you know, you can't put the same lens on everything, first of all, because there are some businesses that have actually benefited tremendously from the pandemic. And then there are probably businesses that are neutral. And then there are businesses that are kind of, you know, very negatively impacted. So I think for the negatively impacted business, it is really hard, you know, to raise the next round or to get the first round in. The ones that are, you know, already on the upswing, I think nothing has changed for them. And the issue is of people who are sort of in the neutral because they always have to defend as to how their business is getting impacted or not getting impacted by this pandemic.
Okay. I remember a couple of years ago when we started F50, the VC money is pretty easy. So nobody want to talk about angels because they want to go to VC, get a bigger check. In the winter, the VCs slow down the investment, everybody go to angels. So you said positive versus negative. Maybe I'll start with this question that I want to invite all three of you to comment. From an investment standpoint, the pandemic impact to the angels, that's a positive impact or negative impact?
Well, this is Randy Williams. I just came on another computer. Can you see me, David?
Very good, Randy.
Yep. So that's a two-edged question, but let's speak positively because I enjoy being positive in this ecosystem or any ecosystem, is that we are starting to see, you know, we have 1,700 fundings at Corrective Forum, and our funds, we're up to 240 fundings. We have blockchain, we have real estate, we have tech funds. What we're seeing is quite frankly, and let's speak for brick and mortar, real estate. We do a lot of real estate funding at Corrective. And you know, we've seen companies that were delivering 8 to 12% returns to us are now delivering anywhere from 12 to 14 because the banks are so polarized with PPP and are not lending to obviously some of the real estate investors, the GPs we're investing in. And so interest rates are climbing. There's the cap rate compression. Yes, there's a lot of obviously damage out there for retail. But, you know, we're sticking to our knitting with multifamily. Obviously, we invest in retail, but self-storage is something we're very interested in. Opportunity zones, we've seen probably half dozen opportunities. I mean, opportunity zones, I mean, even in San Jose, Google is in some of the opportunity zone areas. And so we're investing in that arena because a lot of our members, all our members are high net worth individuals, and they need taxable savings when they invest. So opportunities is funds we're looking at obviously the last year. So on the real estate side, there's real opportunity. And again, what I said earlier, embrace the challenge. There's a lot of challenges. And what we said, probably a year ago, David, is that we said, what inning are we in? And, you know, everybody's talking about, well, the 8th or 9th inning, you know, getting ready for a recession or correction. Well, it's here. So let's embrace the challenge. We're blessed. A lot of us have powder dry. And this is a time to obviously, you know, hopefully create a win-win, the entrepreneur and or the general partner on the real estate side. But if you have capital right now, there's a lot of opportunities.
Yes.
Yeah, like I had mentioned before, I've seen a lot more opportunity to get into deals that you couldn't get into with quality companies at pretty close to the last valuation at Series B, so they didn't raise the valuation. Sometimes it's dropped a little bit. And I've also noticed too from some of my brokers some great discounts on secondary shares that are companies that are pretty close to going public. But the people who are desperate, need money, and are liquidating for 40, 50, 60% below the last valuation.
Yeah, Paul.
I think like I'm involved with a couple of companies who have raised their next rounds. So yes, the money is there, but like you just mentioned, you don't always get the valuation that you were able to get. And so I know one of the companies that I'm involved with, I'm doing a pro rata, and they have managed to up their valuation because they are in a space which is suddenly hot. So I think there is no general formula that I think seems to apply. It varies from company to company and the stage they're in, and how did they raise their last round versus what the current climate looks like for that business.
Yeah, and I think all of you are saying be in the game. We think this is a tremendous time to be in the game. If you're on the sidelines, you're not going to sense and see these opportunities, and that you can possibly, create a win-win and get the valuations decreased. And or, obviously you said about unicorns right now. One of our companies, Link2, and we're seeing secondary markets, yes, decrease in value right now because people need obviously the capital, and it's a great time to obviously be hunting.
I see. So let's talk about the health tech a little bit more. So there's companies in the health tech space are directly related to COVID-19. I believe that had been covered a lot by other speakers. Let's talk about the companies in health tech space are not directly related to the COVID-19. Are there areas you personally or your other angel members are looking to invest? Anybody who's ready?
Yes, and telemedicine is hot right now, and then obviously our members, including myself, like making impact investments, especially this time. But a ventilator, companies, 3 or 4 months ago were hot. Now they're not. Obviously, we got to look at the trends, and we're trying to see things 4 or 5 years out or more. And so yes, we obviously want to have a cure, and some of our companies, in particular, East Coast companies that we've invested in are attempting to find the cure. So yes, game on. It's another opportunity, especially in that sector.
I think the thing that is changing in the healthcare that I've noticed and some of the entrepreneurs coming in is that the whole healthcare sector is being forced to digitize so fast that they never thought they will do. So as a result, I think they are probably more open to looking at some new ways of doing things. So efficiency, touchless, remote, all these things are kind of real in the healthcare so fast, but outside of COVID, it would have taken probably another 5 years before they'll talk about it. So that's a positive thing. So I think the opportunities are big for entrepreneurs now, again, back in health tech, to look at this, because the health tech sector, which generally lagged everyone else in technology adoption, is finally starting to look at it.
Yeah, I'm noticing that a lot of companies too are adding some type of telemedicine, and there's even now veterinarian telemedicine on being pitched. But one thing I'm actually more interested in is the picks and shovels for this. So kind of the infrastructure that will help the people that are setting up the technology that would have never used it before. Because like some of the other panels were saying, telemedicine is hot right now, but in 3 to 5 years, there might be a ton of competition there. So I'm trying to look for people who are building the infrastructure and the picks and shovels that in 3 to 5 years are going to be the ones that have the big revenues. Because I think that's changing a lot too, to go back to one of our other questions, is it's great to blitz scale and to take all the market share, but now we have to be a little bit more careful about the burn too while we scale. The cash flow.
Profitability and cash flow are back in fashion.
Okay, let me go to another question to look at this issue. Okay, in the past, there is a rules called angel investing called 90 miles rules. So some people say it's 50 miles, means that angel investors typically only invest the founders within 50 miles. Why? Because you can drive to meet with them whenever needed, maybe only a few times a year. But now with Zoom, virtually you can meet anybody in the world. So let's say, does that change the game of angel investing?
Well, absolutely. And, you know, we pride ourselves, and, you know, everybody on the call, you know, please get involved if you want to, you know, see any of our companies. We have anywhere from 100 to 150 page due diligence books, you know, written for each company. And we share that knowledge, whether it be our Swedish chapters, you know, our Chennai chapters, or Bangalore, or San Francisco, Silicon Valley. And we're sharing knowledge. In fact, again, our event we're having in an hour, Thought Leadership, is about sharing knowledge about how we can exit early. We've had a seminar on this for about a year and a half. You know, I mean, you know, angel investors have to be patient, and we're trying to, you know, obviously get to a point where we're actually, instead of exiting 5-7 years, we're exiting 2 or 3 years, because our relationships, and all these men have great relationships with strategic, but we have strategics not only here, but obviously in Hong Kong, or, you know, name it, around the world. Our strategics are coming in to not only invest heavily, but conversely to acquire. And most of our exits, you know, I've rung the bell at Wall Street, but most of our exits with strategics. And so we care deeply about introducing knowledge, and so we can all invest, whether the company's in Istanbul. And a lot of our global chapters like to invest in Silicon, but I like to change the narrative and say, hey, we like to invest with you. We don't think we have the best deal flow. I mean, you know, we always precociously think we do. But, you know, as I travel the world, you know, and I've been to all 353 locations globally, it is, you know, there's great deal flow everywhere. I mean, I was fortunate to get out of Hong Kong on January 14th, but I was with 3,000 individuals at an event, and I saw some amazing things in China that I hadn't seen in years. So I'm, you know, I've made 57 investments at Kaiser, and then I've made over 200 with our funds. And right now we're about 90% domestic, but, you know, 4 years ago we're 99. Now we're moving 10% global, and then hopefully in a year from now, David, when we talk, we'll be 80-20. You know, our funds, but we want to be thinking globally all the time, because, you know, there's great opportunities everywhere.
Actually, on the same thing, I think Thai Global has opened up the, you know, investment for people to invest kind of anywhere on the platform. And, you know, obviously the traffic is both ways, but I think more Silicon Valley investors are starting to find deals in various parts of India through that forum, rather than the other way right now.
Yeah, I think it's changed the habits of a lot of investors, because people who wouldn't have normally seen certain companies from overseas are attending like 500 startups digital demo day and things like that. And vice versa, people from the United States are attending demo days in Singapore and places like that. So I definitely think it's going to change the habits.
All right. For instance, like demo day, first, like in March, we first physical demo day for VC and 500 were canceled or become online. And so people are very concerned at that time. Now it sounds like a new normal. All the demos online. So does that mean that even the accelerator programs and all the early investor networks, all those networks behavior will be changed? Will that be forever or just temporary?
Well, I think, you know, in the next couple of years, I think we're going to have a hybrid model of, you know, obviously coming together, hopefully, and then using, you know, this technology. You know, however, you know, for me, the joy is, and the membership at Kaiser is participation. There's joy in doing due diligence. There's joy in investing. There's joy coming together. You know, this is not always, you know, joy, you know, doing this. I'd rather shake your hand, David, and hang out at one of your great events. But, you know, we got to make the best of it. But, you know, going forward, you know, we're also sensitive to traffic patterns globally. I mean, you know, obviously we're talking here in Northern California. And do we want to get on the highways again? Do we want to use public transportation? You know, do we, you know, all my team, my Northern California team is very comfortable working remote. You know, I didn't put anybody on, you know, furlough, or, you know, all my employees are working fully paid, but they're not here. They're all over the country. But, you know, we're efficient, and conversely, aren't we lucky? You know, we're starting to see people, you know, very happy, you know, conducting business in wherever in the world. And we're starting to see people move out of centers just last couple months, starting the stress of San Francisco, people actually, acquiring properties, other places outside the city because of stress of the city. Again, we have to look at what the new normal is. The new normal for us is going to be probably hybrid. It's going to be a combination of this and also gathering.
So Randy, I want to have a follow-up question with you. Since you have members in all over the world, in the past, each of your chapters will operate relatively independently, right? Now with Zoom plus the online does not mean that you actually have more integrations or collaborations, co-investment between different regions of the investors.
And I want them to be really independent. I want them to, obviously, build their own market share. But yes, they are enjoying more and more syndication. And if you've been to any of our events, David, you can see our chapter presidents all over the world come together. They're coming together for knowledge, but really why they're coming is to source great deal flow to take back to their chapters, to syndicate. And I would say, over 80% of the companies that get funding in Keiretsu, we encourage, we don't require, but we encourage them to not only get capital from other chapters and, enjoy TIE or enjoy great other, we enjoy collaboration, cooperation, all obviously Angel Group, but we want them to enjoy the resources that might come from Singapore or might come from our Chennai chapter or wherever in the world, because our members, are givers, and not only they have giving of capital, they're giving of resources. So that's kind of a theme I've trying to insert in Keiretsu Forum last 21 years. Yeah, the mother's milk is capital, but more important is resources. How can we help them with customers, introduce them strategic, all pro bono. All our due diligence reports are pro bono, free. But we want to give resources to these companies because customers or resources are sometimes more powerful than money.
Okay, so I want to put the same question for Paul. TIE is a very big global organization. Of course, the Silicon Valley has a little bit of advantage in the past for doing angel investment. Do you see any change of the TIE's angel structure globally towards earlier investment?
So I think, like I told you, that basically, TIE has always been trying to open up the kind of the global investment arm to every member, every charter member in various geographies. So that effort got accelerated because of this, because now, there is, because of the location challenges are even less so. And then also on the, event and introductions and all those have all become virtual. And so that is also changing, obviously. I mean, previously you will only get a notice from TIE Silicon Valley. Now I get it from TIE Global, which has everybody's events listed, because now you can attend anybody's event if you want to. If they're in your time zone and you're not, feeling sleepy at that time, you can still join, right? So there is a big change that has occurred. Now, would this change continue? Would we go back to our old ways? Probably. I mean, we are human after all. So I think we'll have some changes, but I don't think the changes are going to be so major. Like, we will not pretend that we are in the remote world again once this gets over. So I think there are a lot of things which will change, but there are a lot of things will still stay the same.
Okay, now James, you as a super angel, actually, you participate in many different demo days, organize a different network. What do you saw the trends of the angel investment going non-local, going out of local?
Yeah, it's interesting now because now I can attend, see the demo days for like a Techstars that's overseas and things like that. But I've noticed a lot of these people with their demo days are also doing Slack channels. So now you have the opportunity and the ability to communicate and network with the founders and other investors. So that kind of helps too, because it's almost like now you're part of a group, kind of like Randy and his guys, where you can share diligence and things like that.
Okay.
So it's definitely going more global.
I see. So what about the due diligence process? So one of the biggest reasons why angel investment was like 15 miles in the past, because you want to meet with the founder to look at the eyes, so you can get the confidence that this guy is or this lady is worth for investment. Now it's Zoom. How do you do the verification? How do you do the DD work?
Well, you could still use Zoom to talk to the customers and talk if they have any other investors, things like that. And you could even get a tour of the plant via Zoom, believe it or not.
Oh, okay. Never thought that way.
It's pretty cool. This robotics company did that for us.
Okay. How do you guys do? How does your organization do due diligence virtually?
So I think, you know, for every due diligence, it is really, really important that if you are, let's say, if I'm doing an investment in India, I would still like somebody from India to be part of that due diligence committee. Why? Because there is a different understanding of the local culture and things which you cannot get on Zoom. It just doesn't work on Zoom. That is what the kind of the local muscle memory, if you might, that exists. And so I think it is something that most of the time, if we are doing an investment in India, you would like somebody from India that you trust to do the due diligence besides other people.
And part of validation, and when we have 5 chapters in India, is a part of validation. Obviously, customers actually validating it for us. But we started inserting this last year background checks. We don't want to get burned, and we're approaching 2,000 investments at Kaiser. And there are some bad actors out there, and we just really don't want bad actors to come to any of our angel groups. And so I think it's really incumbent on all of us, leaders of angel groups, to make sure that we not only share due diligence, and we love sharing it with our strategics and or our VC members and or obviously the ecosystem of angels. But more importantly, we have to do background checks. We got to figure out, obviously, track record, but more importantly, if they've done the right thing in the past.
Okay, so based on YouTube side, I just want to verify that still, although you can meet the founder virtually, but actually you still cannot write a check if nobody is in the ground locally with that person. Is that true or false?
I think so.
Yeah, that's
unless
true
you
for
happen to know the
overseas.
person.
Yeah, I think checks are being written most for our particular experience to our portfolio companies, because we have met with them, and as they obviously creating their milestones and obviously creating up rounds, and we're still investing. Kaiser Capital, which is our affiliate funds, of which we have 7, of which I'm a general partner, with 2 other general partners. We I would say probably 60% of the companies have come back the well for additional funding, and we funded I think the most we have funded is 4 tranches. And the AUM is small. We're only 50 million, but conversely, we're doing checks between 150. The highest we've done is 800,000. But we're very comfortable, David, with our portfolio companies. We know them. We've obviously met with them, and those are the companies that are getting the most funding during this pandemic.
Okay, great. So we have our last panelist. He's a super angel from China. He's also he has a fund as well. So he's quite famous in China. He was based in Hong Kong and China. He has a affiliation in New York, sorry, in East Coast as well. So let's welcome Steve Lau from Eagle Fund. Steve,
hi, thank you, David.
You can introduce yourself.
Yes, thank you, David. Nice to meet you all, guys. Yeah, glad to join finally. Right now in Hong Kong and Beijing time is about 6 o'clock. Yeah, so yeah, Eagles Fund was founded in Hong Kong, and then we operate in Greater China and also in North America. We have been invested about more than 200 deals, and our ticket size is about 500K to 1 million US. And we started from angel the period to pre-A and A round, and mostly our deals are the TMT and technology startups. So we coverage in quite a number of sectors, and some of our deals like the mobile operating OS, which is from Finland. It's called Yola Selfish, and this OS has been up and running in Russia. So recently, Finland government also want to invest into this OS, and then we have another deals called Movie Star. It's a unicorn that we invested about 8 years ago in China, and this company is running about 2 billion the revenues per year. It's going to be to IPO next year. Yeah, and we have some other deals like in Silicon Valley and in Los Angeles and also in Boston. Yeah, thanks, David.
Okay, great. Welcome on board, Steve. So I want to come back to similar question to Jim's server just now. I'll ask Steve to answer the same question earlier. The question is that angels go global, but without, do you have to have somebody on the ground to do the due diligence work? James.
So that's, oh, you're me. Yeah, that's where it comes into the great thing about the Slack channels for some of these demo days that are overseas, because you're networking with people, and if someone else is going into the deal, you can review their diligence. And you can still talk to customers and things like that too. I mean, like the other panelists were saying, there's some issues where the local people have a different kind of thinking. So you're not necessarily familiar with that. But normally if the accelerator is there, then the people who are at the accelerator are local. But it is more challenging though than.
Okay, Steve. So the question was that how does the pandemic change the angels investors' behavior in terms of non-local investment, and how do you do the due diligence work?
Yeah, pandemic changed a lot because it affects our deals that we have invested, and also affect the way we are doing due diligence. And for our existing deals, some of them they're really falling into the difficulties. Like yesterday, we have a robotic deals that we have a shoulder meetings over the Zoom, and they are running into cash flow problem. And all our the later round investors, like the pre-A round, A round, A+ round, they have put a lot of money in. They are so disappointed because just soon after they put in the money, pandemic started. The end of last year. So in China, so they have no solutions, and nobody wanted to put in more money to save the company. Yeah, and then for the new projects, we are quite reluctant to proceed. So we have been delayed the due diligence on site, but yeah, we still host a lot of teleconference and also a video conference to talk to the founders, to talk to the team. But it's difficult to travel around. I have been stuck in Beijing for more than 6 months without traveling to other places. So even though I'm able to go to Shanghai, to Guangzhou, to some other place, or back to Hong Kong, but I just refuse. I just say, okay, I'll stay at home, and I'll stay in my own city that I can still walk around. But if we go some other place, once I come back, maybe there are 14 days. So that's the problem.
Okay, got it. We're gonna let the audience ask a few questions you have. Okay, just submit the question right now. For the panelists, for our roundtable host, it's great to have super angels around the world here. So my last hosted question for all of you is that is about duration of this impact. So just now we touched this a little bit. So, but do you think this remote investment over Zoom will be last longer forever. I just last maybe half year, 1 year, and go back to the normal 50 miles.
I think it'd be a hybrid, because you know what's another interesting thing about the Zoom? If it's recorded, where the person's pitching you and showing you stuff, if they're recording it, or if you're recording it, you can get them to send you the video if they record it, or if you record it, you can watch the video later and go back and review, and then you don't have to go back and ask them certain questions that may have happened in the presentation that you just missed. So there are some advantages of that. And I think it could change to a hybrid model where people may have an initial meeting this way, and then if they're interested further, they'll go meet in person for diligence and things like that. So it'll become part of the diligence even.
Yeah, as I said earlier, David, I agree. I did say hybrid too, and this is what where we're going to live in and get used to it, the new normal. But also back to a comment about funding, is that when a company, whether it emanates from Istanbul, wherever in the world is, if it does come to here, Silicon Valley, we want the validation of capital from that region before it comes. We want due diligence done before it comes. Well, for instance, if it doesn't have customers, so we're a little late. It's really important that we see the validation of capital from wherever it came from around the world. If it comes from China, we want to see the fact that people have pulled the trigger and believe in that opportunity. So we don't, we're not that early stage anymore. After 21 years, we are, we're going a little upstream. Not, there's a lot of risk in what we do, but conversely, a lot of opportunity. And to mitigate some of that risk is to obviously look at, one, it's been funded before, and two, it has customers.
I think what I think post this is going to be kind of new normal. I don't think we're going to return to the normal we were at, and we won't return to where we are today. So I think the new normal will probably define itself over time, but I think it will be, people will travel less if, it will be acceptable to travel less, if you might. Right. Today, it is not acceptable to travel less. So that acceptability of traveling less means we will learn to do a little bit more things remotely, and therefore things will change, and how they will evolve, yet remains to be seen, but they won't be exactly like they were before, at least for a long time. And so we will see some changes, hopefully for the positive, where, for a 50-minute meeting, people don't have to travel just to be next to each other and feel good. But for, still the value of, meeting somebody in person and looking them in the eye is not going to go away, because Zoom is not a substitute for it, no matter what we do. And so that will still be there, and more so in, other countries than in the US, because in US, we've kind of always been used to doing business without looking everybody in the eye, but you can't do that in many countries already, and that is not going to change. Culture is not going to change because of this.
Steve?
Yes. Actually, we have been meeting some founders in the last month, but just only a few days ago, Beijing has been new pandemics, right? In the seafood market. So everybody is scared. So now the Beijing is come back to very strict control. So we still have to stay at home and go back to the video conference. But yeah, luckily speaking, that in Beijing, we stay not in the CBD. We stay in the countryside, and we still can play a round of golf and meeting people. But there's no soccer, no basketball, no people gathering. And so I think life is changed us, and we need to take care of all the things that we are facing. And but I believe, like in China, maybe 1 month later, things will improve and people will go around. And yeah, there are lots of people on the street. The since last month, and we'll continue to look at more deals. And then our fundraising, our new funds fundraising scheme is continue. And there are some LPs there. They are started to look for good GPs. They wanted to invest. So it's a good sign. But we'll focus on different areas. For example, like tourism, online traveling, all those things is difficult. And so yeah, to look at more SaaS software, more internet solutions, and all those smart devices. Thank you.
Okay, great. So UCSF Entrepreneur Center Stephanie has a question. Her question that will you invest into a founder? Of course, assume you met in the Zoom, but you never met the person in person. Will you? It's a question for all of you.
Yeah, I think it depends on who introduced the founder. If this founder is coming from the street, from email, then I think I will not invest in. If from a close friend, that will be different.
Right, I kind of agree with that. If it's a warm introduction, or if it comes from like an accelerator or a referral from a startup you've already invested in or another investor, then it's possible. But if it's just some cold email or spam email on LinkedIn, someone you never met before, then probably not.
Actually, I just made an investment about a couple of months ago with somebody that I have actually never met personally. But this one was recommended by the Thai Angels Forum, and they had done the due diligence. And I missed the meeting when they presented. And I did have a phone call with them. And based on that, I went ahead with it. And so far, touch wood, it's going really well.
Lauren Anderson.
I'm sure Randy does that a lot already, right, Randy?
Oh, are you still on?
Yes, I have to jump off pretty soon because we have our big event coming in 7 minutes. But yeah, I agree with everybody. And Stephanie, to answer your question, is that, we have to have that warm introduction. We have to have the validation of obviously capital from, people we know and or respect. Of my over 200 investments that I've made, I've probably only met maybe 25% of the entrepreneurs, the founders directly. So, I'm relying, fortunately, on mind share, swarm intelligence of our community and smarter people than me when I make investments.
Okay, so time flies. I want to thank you all for the great panel. I want to ask each of you give a very short summary to other angel investors who are watching this video. Whoever is ready.
Okay, I'll start. All of us are part of community, so don't do it alone. Join a community. Join Accelerator, join Thai Angels, join Kaiser Forum. We're blessed to have members at Kaiser Forum. They're members of many organizations that bring obviously expertise and deal flow from other angles and other obviously groups. And so be part of a community. Don't do it alone. Where I've made bad investments before I started Kaiser Forum 21 years ago is, I didn't have obviously swarm intelligence. I didn't have mindshare. I didn't have smarter people around me. So build your community, trust your community, and be careful. And if you want to make a $500,000 investment, go 100,000, and then force obviously entrepreneurs to meet their milestones, and then you'll invest up to 500,000. That's how I invest personally. I like doing many tranches and rounds predicated on their projections. Meet your projections. If you do, you'll get more capital. Thank you.
Yes, I agree. Community is very important. In Beijing, we have many angel investment associations. So each association has the different networks. So join more communities and then to find more good deals and follow on with those experienced guys that to save your time and to to save your money and save your failure. So there are still many good deals that potentially will be founded in all the incubators, accelerators, and also in the communities. So yeah, I've been doing many deals in those communities that bring us a lot of returns. Thank you.
I couldn't agree more. I think, Thai Angels is another group like, many of us invest through. So community is important. And I think at the same time, the other thing I would tell the investors is that maybe this is actually a better time to invest than it has been, because, the entrepreneurial ecosystem, there are probably more openings to get better deals than before. So rather than, because we're all investing for long-term, not for short-term deals. So this might still be a great time to invest rather than just saying, okay, I'm going to wait and see.
Right. The one thing I would add to what everybody's saying too is learn as much as you can about the tech and the market of what you're looking to invest in, and then lean on your network and your community to fill in what you don't know. And then you can also form your own critical thinking from getting the different viewpoints.
Okay, great. So I want to thank you all for the great panel. And today I learned a lot about the remote angel investment, so Zoom. I look forward to see you all in the Zoom again very soon. Thank you.
Thank you very much.
Thank you.
Thank you all. Bye.
Thanks, everyone.
Bye.
Bye-bye.
Bye.
Okay, so we have a few minutes before our next session is the virtual VIP reception. We had invited all the global community members to join us. Actually, we have about 7-8 community members registered for this event. Will be a few minutes. Again, it's 4 p.m. Okay, good afternoon, everybody. I know it's a long day. Hope you have enjoyed our sessions on YouTube and on the Zoom meeting earlier. We had released lots of video today. So we invited some of our committee members to join us. They will join us momentarily. So first, I just want to take this chance again to thank all our volunteer committee members who joined us last 2 days for our wonderful content created online and on the Zoom. So I believe Una and Nicola had done an amazing job from yesterday and today to MC our content. So I want to take this time to maybe just introduce our committee member a little bit. So maybe I'll ask first, since lady first, I just noticed Daniel Croft is here. Maybe I'll ask him to turn on his video once he's ready. So Una, maybe you can, oh, hey, Daniel. Good to see you, welcome.
Am I in the right place? I never know where to go here.
Yeah, it sounds like you're in the right place. Great to have you. And I saw your video today, and the video is amazing. I'm a big fan of your speech.
Thank you. Good to be here.
And also, I like you use our background and so integrate our background in a couple of your pictures. That's amazing. You're great. You're a great speaker. So this feature is featured in our today afternoon email, by the way. And tomorrow morning, we will send another reminder. We'll feature that video. I'm sure lots of people love to see that video. So maybe I'll ask Una to introduce yourself since you're quite busy today. Now it's about yourself.
Sure, I'm Una Marcu and I am trained as a biologist. I actually used to teach developmental biology, so I was really interested in how body patterns form starting from one cell in Southern California. And then I got tired of the traffic and there was a lot of aerospace engineering around. So I moved to the Bay Area and I ended up working for this place that had this crazy name, the Cross-Second Center for the Study of Life in the Universe. And I found myself doing astrobiology for NASA and for the SETI Institute. So I worked a lot with biosignatures, looking for life elsewhere. And also I worked a lot on International Space Station projects. I actually participated in 2006 on an experiment looking at immunity in fruit flies. That was on the Discovery. So it stayed on the mid-deck on the shuttle to the International Space Station. So that was just a fabulous experience in something that was completely new. And also that you have to act like right then and there. Why? Because no one has done this before. And I also built hardware. I used to have projects at the Stanford Linear Accelerator Center, the synchrotron. So it was really fun to come up with things. I remember sitting one night at 2 a.m. watching this little chamber that I devised for extremophiles, mapping elements in real time, like changes in real time in this live organism. I thought, oh my gosh, I'm the first one in the world who does that. So I've just been really incredibly lucky to be involved in all these like extreme places, in places that I didn't expect. So I am finding myself right now working with Dave. I've known David for about 2 years, and he's just yet another one of those places that I didn't expect to be part of.
Did you do any work with Chris McKay at NASA Ames?
Ah, of course, I know Chris very well. We actually even established a science camp together. I had this idea of doing a science camp. So for 4 years, we ran a science camp together. Yeah, of course, I know him well.
I went on an expedition with him to the Atacama Desert in 2003, I think. It's pretty
Yeah,
amazing.
maybe I used your samples because I used to work on samples from the Atacama. Some of the extremophiles were the cyanobacteria in the salt, in the halides.
Right.
Yep.
For those who don't know, Atacama is like one of those places that looks like Mars. And so they'd send teams there to try and find signs of life. If you can't find it in Atacama Desert, you won't find it on Mars. So I think it was doing early PCR work for different microorganisms.
Yeah, in the meantime, actually, they did the entire phylogeny with somebody from the East Coast. Mm-hmm. And so what we were trying to do, it was the fact that you couldn't culture these microorganisms because you don't know what the nutrient environment is. So that's what I was using XRF or the synchrotron for, to try and look directly at the community while you cannot culture the community. You just basically take a piece of there and then see if you can map the different elements in the different organisms in the community.
Okay, great. I want to utilize this chance to acknowledge our committee member. Just a little bit. So assume you can saw my screen. These are current committee members. We have 22 committee members total. And this is the first 12. This is our second 10. So many medical doctors around the world in Silicon Valley and in China, in Europe, and join us for this global committee member. I'm sure, Daniel, you know a few of them. Maybe Dr. Patrick was our keynote speaker last year. And we have a couple doctors there speaking at our event. And also Dr. Shafi, he's from UK. He'll be a keynote speaker tomorrow. Per his request, he want to do a live session because his keynote speech is called a virtual. So we agreed his request. If you have time to see his speech tomorrow.
Well, I was in the operating room with him 4 years ago when he did the
Really?
first virtual reality live stream of a surgery to I think 5,000 people at once. They were on Google Cardboard, but it was kind of historic at the time.
Wow. Okay. We also have Dr. Qian Xiang is from Stanford Hospital. He's the director of international medicine. And Dr. Shi actually is a pretty famous doctor in the Summit Point Hospital in China. Dr. Manish is from Port Hospital, is we call it NHS, one of the NHS hospital there. So we create this quite diversified organization committee to create content for this event. Actually, many of our speakers actually were introduced or invited by our committee member. We are very thrilled to have so many great leaders worldwide join us for this particular event. Anyway, so this is the acknowledge part. Also, just a little bit logistic of acknowledge. So those are the people who put this event, organizations put this event together. We have for whole coast, Bay Area Council Economic Institute and UCSF Entrepreneur Center, Global Mentor Board, and the Silicon Valley Entrepreneurs as our four co-host organization. And two sponsors, Hunniwell Lake Ventures and Penny Springs law firm, which is led by Roger Royce, and strategic partners, including NewsBite, is the #3 news app from India, and Floating is a streaming app founded by Indian founder, but the app is globally. Nike is the #1 media company in China, and we have a couple other organizations work together with us. So this is a global operation. So the good news is yesterday we had about 15,000 views from YouTube. The YouTube statistic has delayed. We have not get to today's statistic yet, but we'll announce our data tomorrow morning. We are hoping in North America we can reach tens of thousands of viewers next, including tomorrow's last days of content. And then the rest of click from our partners. This is our goal. These are still our goal. We want to have 100,000 people view our live, our streaming live and the recordings next few days, and we hope we can reach into 1 million people worldwide. So I want to recognize next a member of global committee member. She's a managing director of UCSF Entrepreneur Center. Please welcome Stephanie.
Thank you, David. You've put together an amazing program. I've been watching all day long, and it's really high quality content. So good job at that. And I just wanted to hear what you said about the number of people who are seeing it, because as I watch the screen, there are just a small number of us who are on, but you feel like you're going to get this feed through thousands of people somehow.
Right. So yesterday, so the YouTube count has delays, has about 24, maybe like 8 to 24 hour delay depending on when you click it. So yesterday we checked this morning. Yesterday's status about 15,000 views, not unique. It's about 5,000 unique visitors yesterday. We don't know the statistic today yet. We have some small number of views. The statistic on the YouTube views is pretty delayed. You have yesterday, one day before, it's relatively close, but for today it's pretty low. So anyway, so by the way, so we have the videos distributed from, so to back to your question, through multiple distributed channels. Newsbite is number 3 news app based in India. They have 15 million daily active users. They have a banner about our events on their platform right now. Floating is a news stream, music streaming, so video streaming company app. And they have 100 million views. So the founder is also based in India, but it's a global company. These two are our distribution partners. And Nike is the #1 media company in China. Their video has not on yet. They'll be on like slightly today because they're delayed because it's international, the regulation, the translation. So their video will be delayed for like 1 to 2 days. Will be on China. China, they just record a part of a session today live. So they replaying tomorrow. So this means like next 5 days, we're slowly getting the clicks from all over the world. So we believe that it looks like this is our goal, to have 100,000 viewers to view our videos worldwide. So to tell the truth, that probably in a couple of our China apps, they'll be exceeding 100,000 alone. But outside, honestly, in Silicon Valley, the content is quite competitive. So we need to work a little more on the local market to have more local clicks.
Yeah, well, it's impressive. And it's been nice to meet a whole group of new people that I didn't know, who are your speakers and panelists and so on.
I want to actually introduce you guys to Daniel. Daniel Croft is our today's keynote speaker. He's a fantastic speaker. I've watched him spoke a couple of times. He's most recently he spoke at Singularity University, the first conference about COVID-19. Is fantastic. His video is on today, will be featured on Today and Tomorrow.
I've heard Daniel speak many times, and hi Daniel, and he is truly fantastic. So I've been a big supporter of his conference in San Diego, and love to hear how he parses all the information out there.
How I parse all the information, it's kind of impossible to parse all of it. It can easily be all COVID all the time, but there's actually a lot of other interesting things happening in parallel. So it's interesting to see how all the innovations from many fields are being applied to the pandemic. And then hopefully the silver lining is that the collaborations, the sharing of data and ideas will help many fields of healthcare advance, from drug discovery to virtualized care to public health. So there's no way to keep track of all of it, but the most interesting things happen at the interface of fields rather than in the old-fashioned silos.
What time are you speaking?
I think I already did virtually this morning.
Oh, you spoke virtually. Anytime we feel like, I guess.
Okay, so Dr. Osama, maybe I want to introduce our next committee member. And Dr. Osama is early stage VC, and he has been a big old friend of me and F50 for a very long time. Thanks, Dr. Osama's big support. Maybe can you introduce yourself? Are you muted, Dr. Osama? Let me unmute you, okay, just a second. Yes.
Can you hear me?
Yes.
All right, terrific. I'm afraid I don't have anything good to say. I've actually been an investor since 1982 here in Silicon Valley, with maybe a break for about 3 years in Canada, in Ottawa. and for 8 years in France in cooperation with France Telecom. And in all instances, it was very much about spin-outs that are correct by design. Recently, it has been in cooperation both with Justin Trudeau on the artificial intelligence applications and with the Personalized Medicine Initiative at the University of British Columbia in Vancouver, Canada, where I am actually an alumnus. I graduated back in 1976. And the PMI is very much two things about it. One of them is, of course, the treatment of patients without the use of drugs. And the second one is we get 200 presentations every 3 months. We have a group of wonderful mentors, very much impact driven, to select from them 12 companies from the 200 that we incubate between 6 months to 2 years and apply for government grants and to some extent also the protection of intellectual property, even though it has been developed actually on campus at UBC, but it is transferred to the startup. And once a quarter, we provide seed financing for a company that could potentially be a good strategic partner for Johnson & Johnson, the companies that are here, Illumina, that are actually interested in innovations and what have you. Today, we have 74 companies that have been financed, and I actually had the opportunity earlier today, still on YouTube, to make a very brief 10-minute presentation about trends and investments in healthcare, using some examples of companies in genomic sequencing, and particularly the ones that as of about 2 months ago started to focus on the use of RNA, DNA, and nanomolecules to create vaccines for the COVID-19. So I'm delighted to be joining you today. I'm actually based in Menlo Park, and I'm calling you from home.
Ooh, so you have some very nice furniture, huh?
Well, it's the office. I'm stuck.
Okay, great. Also, I want to also acknowledge our handsome afternoon MC, Nikolai. Nikolai is my long-term friend, and also he's a VC as well. Maybe Nikolai, can you introduce yourself?
Yeah, excellent. Thank you, David. My name is Nikolai. Thank you, everyone. I see some old friends, also Dr. Asama. Very nice to see you too here. And thank you, everyone. Thank you for everyone guests and for insightful talks. I really enjoyed this day. It was wonderful sessions, very interesting information I picked up. We've talked on a variety of topics. I've listened. And a little bit about myself. I currently run, a couple of years ago, I started my own VC firm, Elysium Venture Capital. We do venture capital investment in mostly on early stage. We do some follow-on investment on a growth stage as well. Previously, we worked with David, co-invested and looked for some exciting startup companies as well. And it's my pleasure to be here. And it was a wonderful day. And thank you, everyone.
Okay, wonderful. So, you know what, Daniel, can I ask you a question? So I know you spoke at many different big events before, and especially Singularity University started the first big virtual events on COVID-19 about, I think, 2 months ago. I watched it for many hours. So I'll ask you, this is our first global summit on Zoom and YouTube. Of course, we have lots of things to improve as well. So our statistic, we'll get our statistic probably on Thursday or Friday, get all the numbers in right now. So from your perspective as a big speaker in many different events, do you have any suggestions? I know there are lots of we can do need to improve, but any suggestions for us to do better, maybe later this year or next year?
Well, I mean, there's a lot of new platforms that are growing or expanding or being built for virtualized conferences, and Zoom is okay for some things. It certainly works technologically well, but there's some other platforms I've seen conferences done on, like I think one's called Hop On It. Another one is CrowdNet or something along those lines. The key things for those is it enables you to have more interactivity and breakouts. You can have an exposition hall with demo companies or venture funds. You can have speaker breakouts. You can have networking and a chat. So I think it's worth exploring ways to do live events that kind of help recapitulate some of the things you get in a real one. You can bump into in the hall, who you can match make with. So that's one thing I think that is going to be part of these future virtualized conferences that you could look into. And I think there's a variety of platforms. None of them are perfect, but there's room for improvement, but also room for ways to have interaction that you can't quite do on YouTube.
Right. Actually, we realize that Zoom's video quality so far I found is very good, but the interaction part is very bad. It has lots of restrictions. We found out that there are lots of restrictions on Zoom webinar. Webinar doesn't have breakout room. And Zoom meetings, then you cannot import guests. We saw the manual like 1 month. Oh, you can do import, you can do this. Now, okay, you like only do this if else. Then you cannot do it. So lots of constraints there. Great to have Zoom meeting integrate with another like social communication tools or something. I actually applied to Hoppy, but they said that let's talk in July 30. I submitted my request like a few weeks ago. So look, they just received some funding. Maybe they're very busy doing the product development right now. So I hope they can release their product very soon. So Hoppy, it looks like you used Hoppy before recently.
I did something with Salim Ismail and EXO Live, and they did that on that platform. I've seen one other as well. And again, what it lets you have is a main stage, but then also sort of breakout rooms, which can be going concurrently. So you could have a main stage session and then have the speaker go and meet and have a one-on-ones. It also has an expo hall, so you could have a startup and their video and a sign up. It still has some severe limitations, but it's an example of how quickly things are coming together. And I've seen some futuristic versions, which are much more, you put on your augmented reality headset. If any of you have an Oculus Quest or Oculus Go, Alt Space is an example of a pretty good place where you can feel like you're with other people and you can hear them differently depending where you are. So I think we'll see this change in how conferences happen. Even physical ones will still have a virtual component that can sort of amplify and augment real world meets virtual world.
Okay, maybe I can ask a question for all of you. Let's say if we have a virtual session which require VR, that means more production manpower. Do you think the tickets right now, this event is pretty much free for all the investors and most for many select entrepreneurs? Do you think maybe some people pay for the tickets to make sure to cover the VR experience?
Well, now that you can get a device like an Oculus Go, which is the earlier version of the, I think it's only $100 or $120. And that could be cheaper if you buy them at scale. I don't think everyone wants to spend an entire conference in a VR headset for hours and hours, but you could have components are virtual, or even on a screen, you can move around virtually and hear folks depending on you are in 2 or 3 dimensional space. So it doesn't need to always have a headset, but it can give you some of the experience of being able to go to different virtual spaces. And you could have a premium version of an event, I imagine, where the breakout rooms give you higher level access to the certain speakers or fun meetings. So I think there's lots of ways to blend it together.
Cool. Tomorrow I'll ask this question to Dr. Shafi because he's promoting the virtual stuff. He told me, hey, David, I have a great topic called virtual. Virtual for what? Virtual for medicine, virtual for surgery, virtual for everything. Another topic of virtual for conference.
Well, one of the big things that's come out of COVID is virtual healthcare has exploded, right? A lot of the HIPAA laws have been relaxed, and now you can do virtual visits without breaking the law, and it's being paid for. And I think the genie's out of the bottle. So more and more care will be virtual. It doesn't always need to be the doctor or the nurse and the patient on the screen. It's going to be blended with chatbots and wearable sensors and other data. And the last step might be talking to a human, but in many cases, you won't need to have a human interaction at all.
And I have to confess, I completely disagree with this, even though I'm on these panels where I discuss artificial intelligence because I reviewed so many things, projects about artificial intelligence and interactions and sensors, and I think there's a certain place for that. And on the other hand, I actually have a private practice in what you could call emotional trauma, but I've seen everything from chronic fatigue to Parkinson's to divorces, right? So there is nothing that replaces the personal interaction. And so on the other hand, I'm advocating big for this natural intelligence that we have to self-heal. So one of the things I'm really interested in to, because it's exactly like you said, Daniel, the real juice here is an interaction between fields, right? So this is an event for investors and it's been for MDs. What I would like to see, for example, from a science perspective and as a human perspective, as someone who was diagnosed 6 years ago with a mass, and what saved me was my curiosity. I'm going, this is not supposed to happen. What's happening here? Is to see what we're constantly monitoring is the disease state and all the personalized medicine, all the data that we're collecting, all the artificial data is around being sick. But what we never monitor is we let these people go out of the hospital, wherever that we monitor them. We never monitor the recovery process. Mm-hmm. Well, that's the natural intelligence of the body to regenerate. And we're making absolute zero use of that in the data that we're collecting. And to me, that is the power of your biology. I have a mother who's been suffering. I shouldn't say suffering. She's had 23 years of bladder cancer. Well, this is a woman who's gone through 19 surgeries. So on one hand, you can say, well, she's very sick. On the other hand, my gosh, she's recovered 19 times, right? What is the power of regeneration? And truth is, in science and in medicine, we never study the organisms who actually have regeneration and they can do differentiation, right? So in science, we have this whole thing about the brain, how it can't make new neurons. That is not true at all. In the last years, we're discovering how we have these stem cell capacities to develop, right? So I would love to see kind of the content pushed in that direction, that it's actually it's enabling more and more of our natural intelligence instead of just staying virtual and constantly thinking about disease. Let's look at how we actually recover, because many people do.
Well, it could be a simple thing. I think I agree. Many interactions can't be replaced by AI, particularly around mental health and stress. And I think for some things, let's say urinary tract infection, you can now at home, dip your urine dipstick, take a picture with your smartphone camera. It'll analyze your urinalysis stick, send an order to the pharmacy and delivers the drug by drone, and you've never talked to anybody. That's a possibility. That's a relatively simple, straightforward potential medical thing that you don't need to spend half the day going to the lab, dropping off your urine, waiting to see the doctor. And also chatbots and other elements can start to do a lot of the basic questions and then bring that information to the point where you have the human interaction. So that part is more high level and you're not spending time asking 20 questions that are, can be checked off ahead of time. So I think there's like a blend of how those things can happen. And on regeneration or recovery, great point. I mean, it can be even as simple as your Fitbit. At UCSF, they did some nice studies on people after they went home from a hip surgery or a total knee replacement, and you can measure, are they walking more or are they walking less? Simple step data. And that could help track someone's recovery or the fact that they're not recovering as well. So we can take all these digital biomarkers and look at both disease and recovery and help use that to optimize prevention and the recovery process.
There's certainly a balance between that, and part of it is speeding things up with all the data and all the bots and all the sensors, and part of it is slowing down and actually asking the patient the right question. So I have this example when I was actually working with an investor, and he came to me, he's like, how do you know when to trust, when to invest? And we took this, which is actually trust. What is trust? It's an emotional state, right? It's a state of being where you have this thing called trust. We don't know how to define it. In fact, we don't know anything about how any of our feelings work, and yet we're constantly driven by them in organization and investing everywhere. So anyway, I ended up working with him, and it went back to an event that happened in childhood when he was 4, and something happened to his family, and nobody from the community supported them, and he lost trust per se. And now, 40 years later, he is unsure when to trust. This was about a year ago, and now he has a full-blown business and investment and whatnot. So, and my point is, precision medicine has a place with the drugs and whatnot, and it's precision, being a very precise human being. So a lot of these things show up in our body, show up in the way we speak, the way we hold. We just heard on this last panel of the investors, for example, how you use the body posture, the body language. Well, we don't understand biologically even what the body language is, right? Well, that's the gold. What is the body language? I teach young women how to walk. so they won't get bullied, and how they have a presence, right? Where is that coming from? A sense of unworthiness in the world that was probably triggered somewhere when they were 2 or 3 or watching their mom or whatever that happened, right? So I am a huge proponent for let's solve things without drugs. Drugs totally have a place in the world. There's someone at Stanford, for example, who developed these bracelets that he puts on skin. Well, the skin is the biggest organ. And we receive information every single second from the environment. It's just in our subconscious. So psychologists say that 93%, 93 or plus of our behavior is driven by the subconscious behavior, which is basically our brain and body, right? Well, to me, as a scientist means, wow, we don't know 93% of our biology. So overwhelming ourselves with sensors, I don't think it's the right thing. We have the capacity to sense. Just as I walk in to an investor or to any person on the street, a new sense, can I trust them? How do I interact? The people, the super angels use the words, do you click with this person? Well, what does that mean, right? If you ask the question, what does that mean biologically? It means you have a fundamental interaction where you perceive something in them. Well, that's a sense, right? So I would like to see a lot more around that, because I think we are not using even like 0.01% of our biological capacity to interact. So I love the way you're on that background of network interactions, because that's exactly what's missing in the world, right? That's exactly what we need to try and define better.
Okay, wonderful. So maybe let's conclude a little bit. Particular, I really appreciate and Daniel to be here. Very happy because I invited you to be around the table. I know you have lots of insights. I was interested to organize a round table for your topic. Maybe can you share a little bit more insight about the global things? Right now, one of the trends, because of the Zoom and webinars or online virtuals, you can go international without travel. In the past, have an Indian track, have a China track is impossible. But now it sounds like it's still lots of work, but it's significantly easier than 1 year ago to have an international track for a conference. So for the event you spoke recently, do you have any suggestions how we can engage international events? For instance, we started is midnight in China, is evening in India. So then they go to sleep. They will watch our video tonight after they get up. How can we enhance international users' experience? Do you have any suggestions, ideas?
Well, one idea, you've already got a lot of great content. A lot of it is pre-recorded. But I think the valuable part about conferences often, again, is the interaction. You can always watch YouTube videos anytime, anywhere, in the privacy of your own home, asynchronously. But maybe the potential is, if you had a session, an opening session, maybe, you could then play that in India or China in their time zone, and then have moderated discussion groups afterwards. Probably not, again, on Zoom, though you can do Zoom groups. But the interesting part is when you break into groups of 5 or 10 or 15 and discuss the section you just had, or bring in the speaker if the time zones match. So it doesn't feel like it's just a recorded session. And again, I think that interaction piece is what makes a conference often most interesting. Otherwise, you could watch the talks later. So that would be one suggestion, is even if you have great content here in California area, you could play it separately, but have the interactive conversation part later in the proper time zone.
Got it. Dr. Osama, you have been great friends. Maybe Nikolai, you've been IMC for the, maybe you guys include, when you have any suggestions, let's do a summary of suggestions.
Nikolai, please go.
Yeah, I think, we are still kind of learning all together to communicate online. So, you know, the pandemic actually educate us many things. And I think this is just in general for the future of education, conversation, business-related matters, conferences as well. There is a certain value in having this conversation online, that we kind of educate the audience to return to the content back, because sometimes there are so many nice thoughts captured during the conferences, but people don't remember them. And here, being like posted online in the cloud, people can always be referred to this. So that is that is certainly as an advantage. I'd say for all of us, for speakers, for participants, for audience as well, we're still kind of in adjustment mode, because it's something already exists but relatively new and unnatural. And I'd say it's only comes with the practice, and it just give it some time. And I'm pretty sure actually, then in a few years, maybe in a decade, majority of the events and conferences will be much more natural. We'll be looking at online sessions rather than in the like full packed audience.
Yeah. If I may just add that in many of the gatherings, whether it is Zoom or in person, people get to know each other, and presumably it is to explore areas of cooperation. Given that we all say to each other, and certainly to ourselves, the most important thing we can do is what we can do with each other. There is nothing that we can do alone. And today, luckily enough, institutions and governments, corporate venture capitalists, entrepreneurs, incubators, accelerators are all looking for being integrated into an ecosystem of cooperation like the F50 has created and has actually led to it blossoming. About 2 months ago, I had 2 interesting Zoom calls, one of them organized by 2 ladies in Beirut who said they have 129,000 families that are starving. And there were a number of expatriates. I'm not a Lebanese myself, a number of expatriates. In 15 minutes, knowing what it will take to provide food for 1 year for any one of these families, $920,000 were committed, and you have no idea where it came from. But everyone said, anything that I can do to help in achieving the mission, I will. In the case of the UNICEF, because of the starving children, particularly in Africa, $10 million were raised in about maybe an hour. I'm mentioning these examples to say that, as we all know, whenever we are objective-driven and key results-oriented, things happen. So, for example, if as a result of an F50 conference, we would like to have 250 corporate strategic partners being engaged so that co-investment opportunities, acquisition, benefiting from innovation, and it can be anywhere from Malaysia to Brazil and what have you, the likelihood of these objectives being achieved is actually quite high. So now you're giving us all the opportunity to know each other, and hopefully somehow there will be ways whereby we can actually be connected. And in any upcoming event, if the objectives and the key results are actually highlighted and outlined, then every one of us, including those who are being kindly invited to make a presentation, would actually know at the end of the presentation, what should the key takeaway be, right? It's not simply, I have some ideas, or this is what I do, or what have you. But in the end, what are the key takeaways? And to the extent that they help achieve the objectives and the key results of the F50 webinar, then we are all participating in making things happen.
Thank you, Dr. Asama. I saw Sean Randolph, who is the Senior Director of Bayer Council Economic Institute, is here. So Bayer Council Economic Institute actually is a co-host of this event. And Sean, I really thanks for the partnership. Hope it works for you. And you brought a great opening roundtable this morning. That's fantastic.
Well, thanks, David. No, I enjoyed it, and it worked out in the end. there were so many moving parts. I wasn't quite sure until the last moment how it would come together, but it did miraculously. You and your team sort of brought it together, and I thought we had a good conversation. There was a nice balance with sort of a mix of different perspectives. We could have gone on and on, of course.
Yeah. Have you met Daniel Kraft before? So Daniel Kraft is our keynote speaker today, and he's the chair of medicine for Singularity University. He's a great speaker.
Fantastic. Hey, Daniel.
So I want to connect you too. So together. So Daniel is very deep in the health tech. He's organizing the Exponential Medicine Conference every year. Okay, Daniel, maybe you can tell us a little bit about your event.
Well, I started exponential medicine 2011. The idea was that most healthcare conferences are pretty siloed. You know, I'm an oncologist. I'll go to the ASH and ASCO and conferences. The cardiologists go to cardiology conferences, etc. And the future of medicine is really at the interface between different fields and different technologies. So the theme of exponential medicine has been understanding and appreciating what's happening in AI, robotics, 3D printing, nanotech, genomics, synthetic biology, VR, AR, etc. See where the fields are coming together and how they can address challenges in healthcare. And so it started out with about 100 participants, about half physicians and half investors and technologists and inventors and startups. And now we've grown to about 800 folks who meet every fall at the Hotel del Coronado. We're not doing it this year. Virtually, I think in-person events will be not happening for at least a few more months. But the magic happens when you get people mixed up from different areas. You know, you've done a lot out today at F50 and expose people to things that they haven't quite seen yet that are on the leading edge and expose new startups as well as academics and get people again out of their silos and helping rethink and reimagine healthcare from prevention, diagnostics, therapy, clinical trials to public and global health. So that's exponential medicine in a nutshell. And again, it's not one field, but looking at them at this convergence.
Yes,
very cool.
You know, Sean, I just want to come back to you is that maybe we ask every members to see any suggestions we can improve. Of course, this is our very first called online event. Lots of things can improve. Let's say if we do it next year or even this fall, how can we do something better, Sean?
Oh, I don't know what to say yet, David. I know you've had you know, quite a gargantuan task to make all these different sessions come together. So I think we'd have to see at the end of the day how it all worked out. I thought that our session this morning ran very smoothly. I think depending on how many people are speaking at a session, we could have used a little bit more time. I think we actually did fit in all the major points, but some of these are big topics and we could have gone on longer. So the one very small thing I observed was, I think we had 35 minutes, maybe if we had 45, you know, a little bit extra. But I think for, you know, not having done this before online, it's a huge achievement.
Okay, thank you, Sean. Thank you, Sean. Okay, so yeah, Daniel. So for your conference, if you need any help or maybe promotion, we'd love to help. I have a master of computer science background, so I love to support others. I respect all the people with MD degrees. So I want to, if any chance, we can support.
Thanks.
Okay, so last round, any additional thoughts or suggestions you want to share to our audience? Anybody? Okay, great. So let's conclude today. Again, I want to summarize that. Okay, tomorrow morning, the conference kicking off by Dr. Shafi. The name is virtual. He's making live speech from UK, and followed by a great panel organized by Dr. Hadley. It's called Future of Medicine. He brought like 5 amazing people in a round table. Yes, we should give them a longer time tomorrow for sure. So, but overall, we are doing pretty well. And go to our YouTube channel, subscribe to our channels. We have lots of more videos to be released tomorrow. And also thanks to this, our keynote speaker Daniel and our committee members Sean, Osama, Muna, and thanks Nicola for MC today. Thank you. You all have a wonderful day. Thank you. Bye bye.
You too. Bye bye.